to give us an opening prayer. Madam Evelyn, you can stand up and they give you the microphone.
Thank you. Good morning, everyone. Yeah, let's humble ourselves for an opening prayer.
Maybe we stand up.
Yeah,
That's
can
also
stand
good.
up,
Yeah.
Our loving Father, we thank you for this day. Lord, it's you who made this day to be today, and we call upon you to be with us during this meeting. We actually thank you for the journey mercies all of us have made from our whatever to this destination, and we also pray for our colleagues who are not yet here. God, give them a blessed journey to actually reach us on time. Lord Father, we also appreciate the organizers for today. Lord Father, thanks for giving them the brain and for everything they've organized to make this meeting happen today. Lord Father, we ask for a justified mind and also capacity to listen to each other as we deliberate throughout this meeting. And Lord Father, whatever comes out of this meeting, may it create a transformative change for our nation, because this is not for us, but we are meeting here because of the people we care for. Father, be with us throughout, and we thank you for that. In Jesus' name, I've prayed.
Amen. Thank you so much, Madam Evelyn. Ladies and gentlemen, an applause to Madam Evelyn. Thank you. Ladies and gentlemen, I know some of our guests are yet to arrive, but we thought in a few minutes we would have some self-introductions to know who is who currently in the house, and then other distinguished colleagues could be recognized as and when they come. But allow me also, colleagues, to remind us of the purpose of today's meeting. As you have seen from the invitation you received, today's dialogue is premised on the purpose to reflect on progress made and explore practical pathways for strengthening sustainable nutrition financing, or putting it the other way, sustainable financing for nutrition. And colleagues, this is building on the recent 2025 Paris Nutrition for Growth Summit, where a number of targets and commitments were made for enhancing sustainable financing for nutrition. So in today's meeting, we shall be listening in to a number of speakers who will tell us what's happening on the front of mobilizing domestic and international resources for improving nutrition, but also areas of investment that we foresee as critical in this journey of ensuring that we leave no one behind in ending malnutrition in Uganda. So at this juncture, we are going to have some self-introductions as we try to manage the arrival of the chief guest and other distinguished colleagues who will be talking to us today. And starting with myself, I am Peter Milton Rukundo from Chambogo University, where I'm the Dean of the School of Vocational Studies, but I also teach in the Department of Nutritional Science and Dietetics, where I've been now for about 20 years, and I'm very happy that I see a number of colleagues, my distinguished teachers, and former students who are now at the front line of improving nutrition in this country. So we shall go, I don't know where do we start from, maybe I'll first jump this table. So I will start from that table of distinguished ladies. There's a gender imbalance on that table, but I'm sure we could start with it. They are the early comers. Most of them came early, so it would be nice to know who they are, and then we shall move like that and end with this front table. So the microphone, I don't know, someone will help me move the microphone to this table where we have our number of lady colleagues. Someone help with the microphone. I don't see IT. Okay. We are starting with, yes, thank you very much. We are starting with this table of distinguished ladies. And kindly tell us who you are and which institution you represent. Feel free to add any word that you want to add.
Okay, thank you so much. A very good morning, ladies and gentlemen.
Good morning.
My name is Nalwa Dafiona Masiko, and I'm the Social Policy Officer, Financing for Children, UNICEF. Thank you so much.
Thank you so much.
Good morning, everyone. Happy to see you here. My name is Mary Nabisere. I work for UNICEF. I'm the lead for food systems and financing for nutrition.
Thank you, Mary.
Good morning, everyone. My name is
morning.
Joeria Namboze. I'm a senior lecturer in the Department of Nutritional Science and Dietetics at Chambogo University.
Thank you, Dr. J.
Yes, good morning, everyone. My name is Mirembe Kalumba, and I work with World Vision as a health specialist. Thank you.
Thank you, Mirembe.
Good morning, ladies and gentlemen.
Morning.
I know we don't have tea yet, but good morning, ladies and gentlemen.
Good morning.
Thank you. My name is Martha Nakakande. I am from the Global Nutrition Cluster, but currently seated here as a program advisor supporting capacity strengthening efforts under the GAIN2 project with Action Against Hunger, the Uganda office. Thank you.
Thank you, Martha. Thank you.
Yes, good morning, everyone.
And to really give it energy, everyone should be appreciated. Yes.
Yes, good morning, everyone. I'm Elizabeth Namuyomba, working with Action Against Hunger, but based in Karamoja region. Thank you very much.
Thank you, Elizabeth.
Good morning, everyone.
Good morning.
Hello, everybody.
Hello.
My name is Isabella Namsoke. I am a nutrition and advocacy officer for Action Against Hunger, Moroto.
Thank you, Isabella.
Good morning, everyone.
Good morning.
I bring you greetings from His Royal Highness, Rot David Unena Chana II, who is the Paramount Chief of Acholi. My name is Stella Kijai. I'm the Minister for Gender and Youth at Kekwara Acholi Chiefdom.
Thank you, Honorable Stella. Thank you. We are jumping that. First, go to the other table. There.
Good morning, everyone.
Good morning.
Yeah, Peterson Katochi Komeko is my name. I chair the Scaling Up Nutrition Academy and Research Institutions Network for Uganda. And I also lecture nutrition at Chambogo University. Happy to be here.
Thank you, Dr. Chikomeko.
Yes, good morning, colleagues. Yeah, my name is Benon Musasizi, and I'm the Health and Nutrition Manager, World Vision.
Thanks, Benon. Colleagues, we keep the applauses going on.
Good morning, members. I'm Joan Biaruhanga, a senior sociologist in the Ministry of Water and Environment, a member of the Ministry's Nutrition and Food Systems Committee. Thanks.
Thank you, Joan. Thank you.
Thank you. Good morning, ladies and gentlemen.
Good morning.
Monera Mbabas is my name. I work with the National Planning Authority as a senior planner for family health systems and nutrition. Thank you.
Thank you, Dr. Munira. Yes, this one, this table.
Morning, colleagues.
Good morning.
My name is Nyautono Medias from Kawoda, the ED, in Chenjojo, working in partnership with CARE, implementing the Cascade project under Domain 3, which is having the main outcome as promoting nutrition among the women of reproductive age and the children of under 5.
Thank you, Medias. Thank you so much for representing the people of Chenjojo. Yes, Chenjojo. Thank you so much.
Good morning, everyone.
Good morning.
I'm called Aloyo Sandra. I work for Mission Uganda, and in partnership with CARE, we are implementing a project called Cascade, which is nutrition focused. Thank you.
Thank you, Sandra. Thank you so much. Yes.
Good morning, colleagues.
Good morning.
My name is Jane Frances Nawana. I'm the senior planner for Moroto District Local Government, and I'm also the budget desk officer. Thank you.
Thank you so much, Jane Francis from Moroto.
Good morning, everyone.
Good morning.
Praise God.
Amen.
Iriama Charles Lorota, my name. I'm the district planner for Nabilatuk District Local Government.
Thank you, Bona Charles Igeme.
Good morning, friends.
Good morning.
I am Godfrey Kokoi. I am the team lead for Karamoja Youth Empowerment Network Organization, based in Nabilatuk. We work hand in hand with Action Against Hunger.
Thank you, Godfrey. Karamoja, Nabilatuk.
The Lord is good.
All the time.
All the time.
God is good.
I'm called by names Iloko Paul Roosevelt. I work for Regional Police Initiative for Development, organization based in Nabilatuk District. I am public health specialist and a founder of the organization. Thank you.
Thank you so much, Brother Paul Ilukol, again from our people of Karamoja. Yes, my senior brother.
Protocol be observed.
Yes, sir.
My name is Simon Ondoga. I work as a principal nutritionist in Moroto Regional Referral Hospital. And I am an alumnus of Chambogo University.
Oh, thank you. Thank you, Principal Odonga Simon. We say he's among those senior generals on the front line against malnutrition from Karamoja. Yes, that table, we are moving well. We're trying to buy time, so let's wrap up.
Good morning.
Yes, good morning.
Max Chaudhry is my name. I work for Rural Action for Development Organization based in Nakapiprit, that's Karamoja, in partnership with Action Against Hunger, the Gen 2 program. Thank you very much.
Thank you so much, Max, for joining us. We can have the next.
Good morning.
Good morning.
I'm Atiang Eunice Patience. I work with For Africa as a health and nutrition lead.
Thank you so much, Eunice. You're welcome.
Good morning, everyone. My name is Jeremiah Nyaga. I'm the National Director for World Vision Uganda.
Oh, Jeremiah, thank you so much. Although you sat so much behind, Jeremiah, we shall need you in front.
He wanted to balance with me.
Okay, oh, okay. Okay.
Good morning, ladies and gentlemen.
Good morning.
My name is Andrew Adrian Muchiwi. I'm the foundation manager at the Navageka Development Foundation.
Oh, thank you so much, Bwana Andrew Muchiwi. You're welcome.
Yes, good morning, all.
Good morning.
Name Wadada Lawrence, Nakapiri District. I'm a cow.
Thank you so much, Bwana Wadada from Nakapiriprit. You're welcome.
Morning, colleagues. My name is Furo Ali. I'm the Livelihoods and Resilience Support Specialist at FAO based in Kampala. Nice to meet you.
Thank you, Flory, for coming.
Hello, everyone. I'm Chui Yishu. I'm come from the Policy from the Food and Agriculture Organization. Look forward to working with everyone, and thank you so much.
Thank you, Trishu, for coming. You're welcome. Yes, okay.
Good morning, friends.
Good morning.
Jacqueline Nanyombi Nyombi, Minister of Health, Personal Secretary. Thank you.
Thank you, Jacqueline.
Good morning, everyone.
Good morning.
I'm Nasubuga Jackie. I work with local government, Hoima.
Thank you, Jackie.
Good morning, everyone.
Good morning.
I'm Bazanya Sandra Hither. I work with Uganda Women Parliamentary Association. Thank you so much.
Thank you, Sandra.
Good morning, everyone.
Good morning.
My name is Ichizanye Daphne, Bugwere Community Care Initiative.
Thank you, Daphne, from Bugwere.
Good morning.
Good morning.
Praise God.
Amen.
I'm Nirabunto Joyce. I'm from Kabari NGO Forum.
Thank you, Joyce, from Kabale.
Good morning, everyone.
Good morning.
Assalamu alaikum wa rahmatullahi wa barakatuh. I'm Owase Suleha, Chikube District Local Government.
Thank you, Suleha, from Chikube.
Good morning, ladies and gentlemen.
Good morning.
I'm Basemera Majore, Staff Minister of Health.
Majore, thank you so much. Next table, yes.
Good morning once again.
Good morning.
My name is Evelyn Nambiru. I work with the Hunger Project Uganda as the head of programs.
Thank you, Evelyn, our prayer warrior for today.
Good morning, everyone.
Good morning.
I'm called Justin Nasali, Kawale District
local government, clinician, and the Ministry of Health.
Thank you, Justin, all the way from Kabale. Yes, the next table there.
Good morning.
Good morning.
Nice to see everyone. Such a diverse group. My name is James Terjanyan. I'm the Food Security and Livelihoods Coordinator at FAO Uganda.
Thank you, James. So glad to see you once again. You're very welcome.
Good morning, everyone.
Good
My
morning.
name is Chichoncha Stunjile. I work with the Ministry of Health under the Community Health Department.
Thank you so much, Madam Chichoncho, for joining us this morning. Yes, now we're winding down with the introductions. Yes, Prof.
Good morning, ladies and gentlemen. I'm Achille Okaya from Makerere University, Department of Food Technology and Nutrition.
Thank you so much, Professor Achille Okaya, our teacher. Thank you for joining us.
Good morning, everybody. Thank you so much, my professor. My name is Grace Lonyo Prospero Ocheng. I know you've all seen my name on some paper. I work with the Ministry of Health in the Nutrition Division. You're very welcome.
Thank you so much, Madame Prospero, for the warmth and, as always, for leading us in these matters. Yes, ladies and gentlemen, we are going to the final table of eminent persons, and we can hear. Just introduce yourself. Oh, okay. Prospero has guided that we shall get to know them, but maybe, okay, we shall get to know who they are, since they will be talking to us. But if you don't mind, we can still know who you are, maybe, Prospero. Prospero, let's hear who we are. It's okay.
Thank you so much.
With
Dr.
due respect,
Mwanga
protocol.
Moses are my names. I'm an assistant commissioner at the Ministry of Health.
Thank you so much, Dr. Mwanga, for coming. We really are very grateful.
Morning, ladies and gentlemen.
Good morning.
I'm called Grace Bwenje. I'm the Senior Planner for Agriculture, National Planning Authority, and I'm representing the Chairperson, National Planning Authority, actually as your chief guest.
Oh, much obliged. Thank you so much, Grace Bwenje. We are really very, very grateful for your commitment, sir, and we are glad and looking forward to hearing from you.
Good morning. Good morning.
Good morning.
Agnes Kirabo is my name. I'm the Executive Director for Food Rights Alliance, but also the Chairperson for Scaling Up Nutrition Civil Society Network.
Thank you so much, Dr. Madam Agnes Chirabo, soon to be doctor, and the frontliner, really, in this struggle in the civil society space.
Good morning.
Good morning.
I am Rita Cavajoro, Country Director, Action Against Hunger.
Thank you so much, Madam Rita, from Action Against Hunger. We are really very grateful. Ladies and gentlemen, that marks the end of the self-introductions. We shall introduce other colleagues as and when they come, but we are really very, very grateful and happy that you are able to join us during this momentous dialogue where we deliberate on strengthening financing for resilient and inclusive nutrition in Uganda. As per the agenda item, right away now, allow me invite, first of all, a representative from the Ministry of Health, Madame Prospero, who will welcome us, and then proceed to invite the co-representative representing the Commissioner to really give us the welcome remarks. Madame Prospero.
Good morning once again. Thank you so much, Dr. Rukundo. For us students who passed through some of these places, we call all our teachers professor. So we shall always address you as professors. So you're very, very welcome to this second national dialogue on nutrition financing. It's not my role to be here today, but we want to start in the interest of time. We agreed that we're going to start on good time, and I think we're in good time. So I would like to invite the Commissioner from the Ministry of Health, Community Health, to come and welcome us officially and start us off in this dialogue. Dr. Mwanga, you're welcome.
Thank you so much. I think you have heard my names. I'm Dr. Mwanga Moses. I'm an Assistant Commissioner at the Ministry of Health and in charge of disability and rehabilitation. I'm honored here to represent my commissioner who is on official duties up country. Our chief guest from the National Planning Authority, partners from various organizations. I'm happy to be with the gurus of nutrition. From Moroto, Chenjojo, from the kingdoms of Uganda and Kabale, different players, the academia, World Vision, UNICEF, to mention a few. Our esteemed colleagues, stakeholders, and participants, ladies and gentlemen. On behalf of Ministry of Health, I'm honored to welcome all of you to this second level nutrition financing dialogue, convened under the theme, Strengthening Financing for Resilience and Inclusive Nutrition in Uganda. On behalf of Ministry of Health, I extend my sincere appreciation to all of you, the partners from different parts of the country. I think let's give ourselves a very big hand clap. And I'm excited to see many partners are coming from Karamoja and Moroto. I don't know whether it is purposively done like that, but I'm very happy that you are here to have this dialogue. So I want to thank you for creating time to come and we sit and dialogue. I want to thank you for the collaboration, the commitments in advancing nutrition agenda in Uganda. This dialogue comes at a critical time as we reflect on the outcomes and the inaugural dialogue which we held in 2025 about nutrition growth summit in Paris. We are reminded that while the progress has been made, we still have challenges of malnutrition, particularly in the communities. We have visited, when you visit down there, you go to Karamoja, not only even in Karamoja, you go to Busoga. There are some regions where you really see children are malnourished. Despite all the efforts we are doing, despite all the partners we are having. So where is the problem? People have put in money. People have put in time. The academia have planned. Ministry of Health has done all it can do. And we have sensitized the people. But they still have the problem of malnutrition. Where the burden is felt in that community. And now we are seeing even malnutrition in our pregnant mothers. We are forgetting that some men are also malnourished. You know, the only problem is men don't complain. But we are seeing malnutrition in children, in pregnant ladies, because whenever we take these ladies for operation, we are seeing many problems, especially of anemia and malnutrition. I was in Moroto one time and I was discussing with the surgeons. When they are carrying out operations, especially when a patient in Karamoja gets a problem, a hernia means a hole in your abdomen. So when they repair that hole, they just create another hole because these people have they have no muscles. So when you repair, you just tear. So they have, when you come with a hernia, with a problem in the abdomen, they have first resuscitate you with malnutrition intakes before they operate you. So nutritional financing is not merely budgetary consideration. It is a strategic investment in the community and in the health system. Adequate and sustained financing enables us to strengthen our preventive and health and promotive health services, to support the community health workers, to improve access to nutrition interventions, and to access the underlying determinants of nutrition. We need to plan, and I'm sure in this dialogue, when we sit together, we need to see how we use the data from the academia to ensure that we plan. The security for the food, the sanitation, the health system. How do we plan to ensure that that community, those people in the community, something is done about nutrition? Money can be put there, but if the interventions are not the right ones, and I'm calling upon all of us, let's use the community to be part and parcel of our planning. I would have been very excited if in our planning session here, we had the real indigenous people from Karamoja. These people have the plans. We sit here and we talk about it without forgetting the community. Those people being part of us, they can really bring a solution. You can have a solution when the people concerned have a solution which is better than what we are planning. So from the community health perspectives, the benefits from the investment in nutrition and the population, I'm happy that we are here to plan as a team. In today's dialogue, we have created a platform whereby we have to look at what is done elsewhere. We can't invent a wheel. We have to look at some studies from some areas and reflect with our areas here, being mindful of the context we are working in. Because if you are in Moroto, the context is far much different from the context in Kabale. Similarly, the context in the central here, they are different, but you can see malnutrition. People can have good soils, they have everything, but they still have malnutrition. So in today's dialogue, we have brought all together stakeholders to see how we can plan together and reflect on what was done. And I'm happy that we have many players at international, national, regional, and community levels. And we are happy to have even the financiers. We invited people from Ministry of Finance. For them, it is us to give them a direction. Where are we putting money? If money is put at a wrong place, then we won't see results. We need to look at what are the objectives we are fighting. Then we need to, after getting the objectives, what are the outcomes? Who are the targets? Which people are we intending to target? This time, we are seeing a generation whereby we are seeing the elderly coming on board. And many of these elderly people are also getting malnutrition. So we need to plan holistically, not forgetting people with disability. They're also complaining. We are not mindful of their health. And the people with a mental problem, they're also having that challenge. So I encourage all the participants to actively share their experience, their contribution in this nutritional dialogue. And let's move closer to our national and the global nutritional goals. We have the SDGs where nutrition is guided. Together, through our sustained commitment and strategic planning, we can build a healthy community and secure a better future for Uganda. As Minister of Health, we are committed to work with all of you. We have a division of nutrition under the Community Health Department. And I'm sure when our director comes, he'll assure you that Minister of Health, this is the way to go. We want to see that everybody, you are what you eat. What you eat can even send you to your grave, or it can lengthen your life. We are seeing our children eating a lot of junk, and we think they are feeding well. Obesity is also part of malnutrition. It's a bad nutrition. If you find that your belt is disappearing in your abdomen, then you also have a problem of nutrition. So we have to look at the other external end and the worst end. So we are free to support, to share, to guide, and to ensure that we move as a team. Once again, I want to thank you for coming. I want to thank you for the collaboration. I want to thank the people who are supporting our hard to reach Moroto and Karamoja. Let's give them a very big hand clap. And I want to recognize the cow. I heard the cow came from some district. The cow? She's where? Thank you, cow, for coming. Those are the people who are planning. And if we plan within the system, I think we can have it sustained. At this juncture, I want to open this workshop. Thank you so much.
Thank you so much, Commissioner Mwanga. Ladies and gentlemen, an applause to Commissioner. Yes, ladies and gentlemen, that was not enough. A big applause to Commissioner Mwanga. Yes, Commissioner, we are really very, very grateful for your very thoughtful remarks and very encouraging remarks. You have rightly put it that malnutrition is not merely a budgetary issue. There's need to involve widely, but also ably brought out the issue to strengthen prevention and promotive measures in a way involving the community at all levels of planning and financing for nutrition. The Commissioner also ably explained to you the different contexts that we work and we live in, and therefore the need to contextualize our planning, and also the need to really strengthen multi-stakeholder involvement beyond the Ministry of Health. He also expressed his commitment and urged us to really target our interventions and our actions effectively, but also not lose the sight of the key goals for health for all within the SDG and other frameworks. And indeed, Dr. Mwanga has applauded us for bringing the grassroots players in this meeting. I think an applause to the planners and organizers of this meeting. Colleagues, I don't want to unpack everything that Dr. Mwanga said, but at this juncture, allow me recognize our partners and therefore invite the country director of Action Against Hunger, Madame Rita Kabanyoro, to also provide to us her opening remarks. Another applause, ladies and gentlemen.
Good morning, ladies and gentlemen. Kindly allow me stand on the existing protocol, as stated by the Commissioner, Assistant Commissioner. And allow me begin by expressing my sincere gratitude to you all for honoring our invitation and coming here today. And also especially, I want to thank the partners that have worked with us to put together this dialogue. World Vision, the Ministry of Health, kindly clap for them. Ministry of Health, World Vision, UNICEF, Action Against Hunger, and all the other partners that we've worked with over time. Ladies and gentlemen, this is the second nutrition financing dialogue, and our hope is we will be able to do this every year. However, we can all agree that we've been in too many boardrooms. We have a National Nutrition Forum, we have the Nutrition Symposium, now we have the Nutrition Financing Dialogue, and so many other nutrition meetings happening. However, we are not seeing a lot of these translate into the outcomes that we are seeking to see. If you look at the numbers, our stunting levels are more or less the same from the last 2 years. I was reading a report this morning from the Global Hunger Index saying Uganda has a serious hunger problem. We've been graded in the serious category, which is, I think, the third level to the worst case scenario. So in as much as we come here, dialogue, agree, share ideas and all, my hope is from this engagement, we can actually walk out of here with clear, actionable, plans or blueprint that we can go and implement. And by the time we reconvene next year, we should be speaking about the outcomes that we've seen in the space of 1 year. I'm sure I will be preaching to the converted when I say financing or investing in nutrition is not just an economic decision. It's not just, It's not just a health decision. It goes all the way to productivity. It goes all the way to human capital development. You will look at the future leaders of Uganda, maybe some of these children who are stunted. Someone once said, you cannot build or develop a nation on empty stomachs. So when we come here to discuss investing for nutrition, we are discussing the future of our country, the future of this world, and everything development that we seek to see. The inaugural Nutrition Financing Dialogue of 2025 provided a platform for us to reflect on the challenges and identify the pathways that we need to do to move forward. Today, we are building on that same foundation now to move to the next level. We know what the challenges are. We know what the difficulties are. What do we need to do now? Should we be doing system strengthening? Should we be at the grassroots, like the Assistant Commissioner has said? What do we need to do from today? And as we know, our current investment in nutrition is mostly from external partners. And we all agree that this funding is going lower and lower. So we cannot rely on the USAIDs of this world anymore to help us solve our problems. So what do we need to do as actors in Uganda? I like to call of us local actors. Whether you're working for FAO, James understands more about nutrition in Uganda than many Ugandans do. So all of us here should be considered local actors in our capacity. What do we need to do as Ugandans, as people who are working in Uganda? What investments do we need to do without waiting for another person or an external party to come and help us solve our problems? However, increasing domestic resource mobilization and improving the efficiency of existing investments across sectors is still struggling. We know what the reports are saying. OPM has released reports. We've done the FSNA analysis that is done every year. We are still struggling to mobilize resources, and the resources don't just have to be financial. Sometimes it's knowledge. There's a lady, I think, who said she's from the western part of Uganda. If you go to Toro, every household has a farm. And yet the highest rates of malnutrition are in Toro. Maybe it's a knowledge gap. Maybe that's the resource that we need most. Invest in people, give them the knowledge they need to know. Many of us are here, there's an obesity problem, mostly in Kampala. And some of our children in this room are struggling with obesity. And yet we are the experts in nutrition. So maybe the resource is knowledge. It's beyond money. We have enough food. We all say we have enough food in Uganda. So why exactly are we struggling? What resources do we need to mobilize together? Is it human resources for health? At every facility, is that what we should be advocating for? Should it be increased government investment, budget allocations? Should the nutrition division be a ministry of its own? I don't know. But I'm hoping by the time we are done today, we will have answers to some of those questions. As we all know, nutrition is multi-sectoral. When we talk nutrition, we are discussing health systems, food systems, education, water and sanitation, and social protection. So this means that our response must be equally integrated. I'm glad that the room has people spanning from all these different sectors. We had someone from Ministry of Water, we have local government. I think the gap was getting a community person in here, someone from Nabila to Karamoja, those ladies to actually come and tell us what the experience is. But this requires all of society, and it should be integrated. So we must strengthen and improve our budget tracking, ensure that nutrition is not treated as an afterthought, but it should be a central pillar in national development planning. I'm glad our guest of honor is from the National Planning Authority. As we are discussing growing our GDP to $500 million, billion dollars. What is the role of nutrition in all of this? Are we going to have the same stunted children raise $500 billion for Uganda? Adolescent nutrition is struggling. Are these stunted or adolescents who are stunted, and we all say when someone has been stunted, they can never reach their full productive potential. So are they going to be able to raise that $500 billion investment? Nutrition should concern all of us. The next president of Uganda could be stunted right now. What does that mean for all our development outcomes? As all of us looking at the room, I'm sure in 20 or so years, we will be considered as part of the elderly. Do we want a president who's currently stunted? And it is possible, you know. If we do the statistics of how many Ugandans were stunted when we were young, I was not stunted, but I was malnourished. So if we did the statistics of how many Ugandans were stunted when they were young, we will be appalled by the numbers. We know 14 million Ugandans are mad, right? We've all seen that report. The nutrition report, I'm sure, will be worse. So our future leaders may be currently stunted. What do we need to do to protect ourselves? Unfortunately, we don't have retirement homes in Uganda. So these people are going to be with us. They are going to lead us. They are going to be in our health facilities. They are going to be in our government ministries. They are going to be in the INGOs that we are working for today. What do we need to do to change that status quo? So we must be bold in pursuing policy reforms, measures such as taxation of unhealthy foods, repurposing agricultural subsidies towards nutritious diets, and integrating nutrition into primary health care and social protection programs. This should not be optional, it should be absolutely necessary. It is equally important that the transformation of our food systems is prioritized so that we ensure availability, accessibility, and affordability of diverse and nutritious foods, which requires deliberate investments from supporting smallholder farmers, like we like to say, from farm to plate. So we should ensure that we advance legislative frameworks, including the Food and Nutrition Bill and the other bills that are in the process that are directly geared towards nutrition. So ladies and gentlemen, what we are discussing here today is beyond policy, it's beyond financing. As I've mentioned, this is about the future of Uganda. And we cannot afford to leave our future to coincidence, to luck, to faith. For some of us who are Christians, faith is going to require an action from you as well. So can we be more intentional about what we need to do? So as we engage in today's discussions, I encourage all of us to focus on delivering a clear and actionable blueprint so that we have more action than boardroom meetings going forward. Next year, when we come back for the nutrition financing dialogue, we should be seeing the numbers going up or improving. We should see improved investments. We should see lowered stunting, wasting numbers. We should come here to celebrate, and say, how do we move forward together? How do we secure our gains? That's the theme for the next 5 years, right? So how do we secure the nutrition gains that we have and ensure we strengthen and add on? And in the next 5 or 10 years, as all of us are still active in the workforce, we should look at the future of Uganda and be excited and know we are in good hands. We did what we had to do. So with these remarks, I still want to thank you for coming through, for honoring our invitation. And I look forward to a great meeting and fruitful engagements with you all. Thank you very much.
Ladies and gentlemen, a big applause to Madam Rita Cavanyoro. Yeah, of course, if you have the job of Rita, you are really looking at hunger every day. And you're looking at the statistics. And you can imagine the frustration that she has. And from her speech, Rita was so bold. I was feeling it there where I was seated, that we need to go beyond the boardrooms. She's not happy with the boardroom talk. It's time for action. And she seriously said that we need a blueprint that really will sort this problem. And she gave a hint on the Global Hunger Index that says there's a serious problem in this country and the situation may get worse. Of course, bearing in mind the current war and the effects, somebody has predicted that we are going to have many more mouths to feed. The fuel is going up, everything is going up. Rita is saying it's beyond the health and economy. We need to look at all measures, all of a certain approach. And she was so worried that the tenfold growth strategy, which my senior brother Bwenje will talk to, may not be achieved if we don't do much. The 500 billion US dollar economy, she's a bit worried that if nutrition is not central, we won't do much. So Rita really nailed many points here, but she reminded me of a big statistic of the 56% of Ugandan adults who were started as children. And that was from the cost of hunger report in Africa. And that tells that many of us in the room here could have been started as children, and maybe that's why planning for nutrition has failed. So, ladies and gentlemen, yes, we can keep talking and dissecting the issues, but allow me to recognize very distinguished colleagues who joined us. Honorable Philip Lokwang from Karenga District. Sir, you're welcome to this meeting. We are very happy that you joined us in this dialogue. I also see my sister from the Office of the Prime Minister, Madam Orishaba Judith. Maybe also she can wave to us in recognition. And colleagues, as you see many other people joining us, please keep reminding me who they are so that we do not miss them. But in the interest of time, allow me proceed with our agenda. And ladies and gentlemen, it's my honor and pleasure to invite another distinguished partner, Bwana Jeremiah Nyangai, the National Director of World Vision. You're welcome, sir.
Yeah, thank you very much, MC. I think after Rita made her remarks, I was wondering what else to say, and perhaps just one of us would have spoken on behalf of the partners. And she was very figurative and figuring out a president who is standard, and just figure out a president who is standard. Then she said she was malnourished. So I wonder if Rita was malnourished, what was I? Probably I was wasted. Yeah, all protocol observed, our guest of honor from NPA and all partners here, the government, honorable members, I want to greet you. As the MC has said, my name is Jeremiah, and I am the National Director for World Vision. I'm so glad that today we are talking about a dialogue, because it needs to be a dialogue. When we still talk about malnutrition in Uganda, for me, it becomes a bit mind-boggling when I compare with my own country. Because one of the struggles I've had in Uganda for the last 6 years I've been here is to finish the food that is served to me in restaurants. To the extent now these days when I go to a restaurant, I say, give me all food except, because I do more of exemption because I see a lot of food. And yet we are still struggling, and we are discussing today about the issue of malnutrition. And therefore today's discussion is really quite important for us to really discuss. I just want to say a few remarks because we really have a long day and there are many things that we really need to discuss. Adequate nutrition, and again, I think we are really preaching to the choir here, people who are really converted. Adequate nutrition in childhood strengthens immunity, supports cognitive development, improves learning outcomes, and lays foundation for long-term development. As an organization, as World Vision, we just completed a new strategy that is going for the next 5 years. And I'm so glad that as an organization, we still prioritized nutrition as one of the key areas that we are going to focus on in the next 5 years. Because truth be said, there's still a lot that we need to do as an organization and as partners and as government. And that's why we are having this dialogue today and asking ourselves, how much more can we be able to do to ensure that we have adequate resources to address the issue of nutrition? And through the work that we are doing, we also launched a campaign like 2 years ago, and we are calling it Enough campaign. And enough is all about saying enough to malnutrition. And you also is saying enough to many things, enough to lack of action by different actors, by the government and by different organizations. And therefore that campaign is a campaign that as an organization we shall continue to leverage on. And it's a campaign that we have also invited other people and they're working alongside with us. We are talking about boggling statistics in Uganda, but yet we must also appreciate ourselves for the progress that we have made regarding the same. Because actually, compared with other countries, Uganda is making progress towards the attainment of nutrition targets. It may not be at the pace that we want, but definitely we are making some progress. Child stunting has reduced from 29 to 26%, and this is according to NDP4. Wasting in children under 5 is at 2.9%, and that is actually lower than the average in Africa. And undernourished of the global of the population decreased from 40% to that 6.9%. It's marginal decrease, but still we appreciate there's an effort that has been made towards that. Therefore, despite that progress, sustaining these gains amidst volatile geopolitical and economic environment calls for innovation and collaborative approaches. We can no longer do business as usual. It has to be business unusual. We must explore new ways of working, adapting, and building resilience. Times are gone when we had abundance of money from donors, where they were looking whom are we going to give money to implement projects. Especially for us who work in the civil society organizations, 2025 was a roller coaster because of what we went through. Many NGOs, many organizations shut down. And what does that mean? It means those organizations, many of them who are focusing on health and nutrition, they are no longer doing the same. And therefore, just a few players have been left in the industry addressing the issues that we are having dialogue over today. So therefore, as we celebrate these milestones, we remain cognizant of the fact that current standing rates are still very high. A rate of 26% means a quarter of Uganda children, 2.2 million children, are chronically malnourished. And just figure out that. And that's why Rita was projecting that if you are not careful and we don't do anything, project into our future, the generation that is going to come, we are going to have a generation of very standard people. And therefore, that is going to have an impact on our economy, even as we seek as a country to leap into qualitative leap into a middle-income country. Reflecting on this dialogue, I'm reminded of Maureen, a 29-year-old mother who lost her home and property when Lake Albert and River Semliki burst its banks in 2024. Feeding her 3 children became a daily struggle, forcing her to stop breastfeeding her 14-month-old daughter due to food scarcity. The child's health deteriorated amid limited access to care. Because these issues, they are related and they're interconnected, health and nutrition. Through World Vision, UNICEF Ministry of Health outreach, the child was screened, diagnosed with acute malnutrition, and referred to Karugutu Health Center 3. She received therapeutic food, while Maureen was supported with practical nutrition, education, and ongoing follow-up by a village health team member. And these are the grassroots people we are talking about, the work that they also do. I share this story to underscore the cross-cutting nature of nutrition and the urgency of sustained financing for nutrition if we are to realize the National Health Compact 2025 and 2030 agenda commitments. One of the major barriers to nutrition financing in Uganda is limited funding, and all of us agree to that. This situation is likely to worsen with the funding current crisis. Right now, I think some of us have started getting accustomed to Strait of Hormuz. I'm sure many of us didn't know what Strait of Hormuz is. But due to the ongoing war, Iran and US and Israel, many things, the inflation is going to go up and so on and so forth. But I'm glad to see that now there is likely to be a ceasefire, or rather there is a ceasefire. So the situation is likely to worsen. Last year, for example, we witnessed a lot of food insecurity among the over 1.9 refugees in Uganda. When, because of inadequate funding, because US was funding much of what WFP was, having an as for us as World Vision as implementing partners. And therefore, we quite suffered a lot because of that rationing. I do remember immediately after that going to where we work in Yumbe, and I went to a food distribution point. And it was really heartbreaking to see the refugees lining up because they couldn't believe that actually like 60% of them, they were out of food ration, they were out of cash. And they would come there, then they are turned back. You look at those people in their desperate situation, and you could see in their faces they are asking themselves, do we die out of hunger in Uganda, or do we die out of war in our own country? When you think about these things, your heart needs to be broken, and you need to be moved. And that's why the action is very urgent today as we discuss about the financing. So even for those few who are getting the ration, getting the money they were getting, I just noticed that the fish I ate that evening costed what a whole household was given for a whole month. And that was really heartbreaking. Just to imagine what I consumed within dinner. That was what was available for probably a family for a whole month. Therefore, I hope today's dialogue inspires and challenges us to explore new approaches to sustain nutrition financing while strengthening implementation, accountability, and systematic follow-up on the commitments we agree today. And World Vision as an organization, we make our commitment to join these efforts because all of us, we can be able to do something. I'm just reminded about a Swahili saying because I come from a Swahili country. And that the saying says, kidole kimoja hakivunji chawa. Now, that is, if I may interpret it, just means, and I don't know why that is, because probably in Africa we were infested with fleas. And therefore they were saying you cannot kill a flea with just one thumb. You need both of them. Okay? So, and therefore it needs all of us to be able to kill the fleas, and probably those fleas of malnutrition. So thank you, and I wish all of us really good deliberations today. Thank you.
Asante sana Bwana Jeremiah. Ladies and gentlemen, an applause to Jeremiah. Yes, colleagues, you appreciate that World Vision indeed has been a great partner in this effort. I recall right from those times of scaling up nutrition, but also Jeremiah has really added to the mix by saying if Rita was stunted or undernourished, perhaps he was wasted. But he doesn't look one. He looks a well-nourished gentleman, really. Colleagues, Jeremiah really was astonished by our diverse food potential. No wonder, perhaps it could be the best in the world. Yet, despite the land of abundant food that is diverse, malnutrition still prevails. And Jeremiah said, yes, stunting has improved from 29. Some will say 24 or 26. But on the other hand, the problems continue to persist. And like Commissioner also said, the other side is growing in terms of overweight, obesity, and diet-related non-communicable diseases. But the worry that Jeremiah sees is the declining financing. We all know the effects of the change in U.S. policy, but a global decline generally of official development assistance, and the current crisis of many wars, the war of Russia and Ukraine, but also the current war in Iran and the crisis of the Strait of Hormuz. Jeremiah gave us a case of Maureen from Karugoto, highlighting how multiple actors and centers are required and efforts are required to really address the multifaceted problem of malnutrition. But also another case he gave us of the declining financing for key vulnerable social protection areas, including refugee support systems, equating the cost of his dinner to a whole month of really support to the refugees. And he was wondering how much can that 30,000 do for an entire month. And therefore, what is it in terms of what they have to put on the table? So clearly, creating a big case for increasing our efforts to source new ways for financing nutrition. And he mentioned innovative financing approaches, but also strengthening our commitments to ensure that we really leave no one behind. And he used his own Kiswahili analogy of kidole kimoja hakivunje chawa. And if you understood him, I'll not repeat. But really, we appreciate Bwana Jeremiah for those very encouraging remarks. Ladies and gentlemen, our agenda is getting a bit delayed. We were expecting that we proceed, although there's also rumor that the tea is ready. Glucose levels are a bit down or low, and therefore there was a call for a short health break. You know, us who are teachers, we say, if you have a teacher who takes the whole hour talking, people need to rest a bit after 40 minutes and etc. So I don't know whether our keynote is around, but if the keynote is yet to reach us, I don't know, Peter, how we are there, but we are all set for a short health break, a nutritious one at the very least. We shall evaluate it. So, colleagues, we already had a prayer. I know there are new faces in the house. We shall try to follow you up and get to know who you are so that we can recognize you as and when we go by. So we had talked of a moving break, and so we are dedicating not more than 15 minutes to the health break so that we come back for the keynote speech and another speech by our key partner, UNICEF, and then NPA, and then we roll into the critical beans of the agenda. We no longer say the meat, but the critical beans, and I'll tell you why as we go by. Ladies and gentlemen, I invite you for the short health break. There's a cup of tea for us and some bites. Remember healthy diets, and also what Jeremiah said, that the cost, and look at the cost of waste also. How much do we waste and how it could be used by others. So, ladies and gentlemen, short interlude for a health break. So, and we could get going. I don't know whether we begin with the high tables here. I think people are waiting for you to rise. So, colleagues, Jeremiah and others who have been talking, kindly, let's go and energize, and then we continue like that. Okay, short break, 15 minutes. We had talked of a group photo, but we may have to wait a little bit, and we see how it will work out. Thank you. Sips, it's okay. We can continue with the working tea, coffee, or juice, whatever nutritious food that you have. We really can continue as we enjoy our meal. Colleagues, at this juncture, I would invite those who are done with the breakfast to join us back so that we can continue with our session. Ladies and gentlemen, I realize that we also have an online audience, but somehow our technology people didn't display for us who is who online, so that we don't miss really our online or virtual participants. But hopefully, if the IT team can help us at some moment, we shall be very glad to recognize those colleagues of ours who are following us online. But I'm told they are listening, so colleagues online, we really welcome you as well. We recognize you, and we appreciate that you're able to continue to be with us as we deliberate on this very critical subject of financing nutrition. Colleagues, also on that juncture, allow me to recognize some distinguished colleagues and participants who have joined us in this dialogue. First forward, we have the UNICEF Country Representative, Dr. Robin Nandi. Dr. Robin Nandi, you can wave to our people. Ladies and gentlemen, another applause to Dr. Robin. Yeah, these colleagues are very busy sometimes. So, Dr. Robin, we are very, very grateful that you dedicate space in your program of today to be able to join us. Accompanying him is also the Chief of Nutrition, Brother Zakaria Fusheni. Zakaria, you can wave to our people. And those in nutrition should really know Zakaria. He has been a very great colleague, supporting Uganda in most of these initiatives. Of course, in addition to Mary, who had already introduced herself and the team. Ladies and gentlemen, we also have, for protocol reasons, allow me also recognize, ladies and gentlemen, 3 additional members of parliament who have joined us today. We have with us Honorable Betty Ethel Naluyima, woman MP for Akiso District, and she's coming back for the 2nd time. So she's already back with us. We are really very grateful. We believe she'll be an advocate, even in the 12th Parliament. So, Honorable Ethel, you're really welcome. We thank you so much. You've been a fighter with us as part of the Alliance for Nutrition, and forever we are grateful for your efforts. Colleagues, we also have Honorable Flavia Kabahenda, woman MP Chegegwa. Colleagues, those who do not know Honorable Flavia, she's a very strong advocate for social protection, a champion for nutrition who has been with us in the struggles, and also someone who has been really interrogating why Toro has not effectively improved its ratings around stunting. But we are very grateful that Honorable Flavia has been on this journey consistently, pushing really for the improvement of the wider population through social protection, having been a chair of that forum in Parliament. Ladies and gentlemen, also we are privileged to have Honorable Byakatonda Abdul, who's with us here today. And Honorable Byakatonda Abdul is the Workers' MP in the 11th Parliament, and we're very, very grateful that he has been able to join us. And we believe that the workers are key. I think there are colleagues even who are promoting workforce nutrition now, because if there's no good nutrition for the workforce, there can be a challenge. And colleagues, we have many other members who joined us. I have a colleague who joined from ISA, I think replied from ISA, Institute of Social Economic Rights, has also joined us. We are really very grateful. And I saw many other colleagues out there. I have not seen names coming to me, but I will be recognizing them. I see also a commissioner from Ministry of Finance, Planning and Economic Development. We shall recognize him at an appropriate moment. For now, we shall allow him to take a breather. Ladies and gentlemen, as we continue with our agenda and prepare to wait for the keynote, allow me first of all to invite the UNICEF country representative, Dr. Robin Nandi, to also give us his remarks. And he's representing the Nutrition Development Partners Group in Uganda. What a very important honor to have Dr. Robin to talk to us. Dr. Robin, you're very welcome to share with us your words of your remarks and how best we could work together in addressing these problems. You're welcome, sir.
Good morning, Honorable Chief Guest, Madam Grace Buenje, all the dignitaries from our various line ministries, our distinguished MPs, members of parliament who are here today, really grateful for your presence. The MC talked about us being busy, but I think there's no people busier than our dear MPs. So thank you for making time for this. Our dear development partners, distinguished friends and guests. I'm sorry that I arrived a little bit late due to the traffic. Please accept my apologies. But we did join online, which the MC did not know about, and we did hear the excellent speech of Jeremiah, and so we were there. So apologies again, but it's a pleasure to address you today in the capacity of UNICEF representative to the Republic of Uganda, but also on behalf of the development partners as the chair of the Development Partners Group in this very, very important nutrition financing dialogue. I'll start by commending the Republic of Uganda, the government of the Republic of Uganda and partners for convening this national dialogue on this important topic and for the continued leadership in advancing the national nutrition agenda. As we all know, and I realize I may be preaching a little bit to the converted here, but I think we need to spread the message far and wide that nutrition is one of the most powerful investments that the Republic of Uganda can make. It underpins child survival, cognitive development, education outcomes, and long-term productivity. Yet, malnutrition in all its forms, including undernutrition, micronutrient deficiencies, and rising overnutrition, remains a major challenge. A key driver of child food poverty, with many children lacking access to diverse, safe, and nutrition diets. Addressing this requires both scaling nutrition intervention and transforming food systems to make healthy diets accessible and affordable. Sadly, ladies and gentlemen, we all know that in the world that we live today, unhealthy foods are cheaper than healthy foods. And in order to change this, we will need to reimagine food systems. While Uganda has demonstrated strong commitment through policies and multi-sectoral frameworks, financing remains a major bottleneck. Investments are often fragmented and insufficient, and with continued reliance on external funding. This underscores the need for sustainable, domestically driven financing. We all know what has happened over the last 12 to 15 months to the global development architecture and context, and it is really important that we in the Republic of Uganda respond and adapt to that. This dialogue, therefore, offers an opportunity to define a clear path forward. With the constrained resources that I mentioned, we must prioritize high-impact, equitable interventions, particularly during the first 1,000 years of a child's life, from conception to the age of 2. This period is marked by rapid growth and development of the brain, body, and the immune system, making it a crucial time for establishing the foundations of lifelong health and well-being. Sadly, if we miss this opportunity, we will fail to influence some of the development milestones that I talked about. Investment in childhood nutrition helps children reach their full potential as economic, productive adults in the future, and this will obviously have an impact on the long-term development of the Republic. In addition to improving a child's diet through adequate and diverse diets that include all food groups, proteins, micronutrients, and others, we need the support of stronger national systems, including workforce, supply chains, and data systems. Sustainable progress will require increased domestic resource mobilization and allocation, better integration of nutrition into sectoral budgets, and innovative financing approaches including fiscal policies and blended financing. Here I must stress the multi-sectoral nature of nutrition. Nutrition cannot be the responsibility and role of a single sector, so it is so nice to see multiple line ministries and sectors engaged and present in this room today. On behalf of development partners, some of whom are present, or many of whom are present, we affirm our commitment to supporting the government of Uganda in advancing its nutritional priorities. We have started our new UN Cooperation Framework 2026 to 2030, and we have aligned this very, very closely to national priorities, particularly NDP 4. We commit also to strengthen coordination and commit to catalytic investments that leverage sustainable financing and build sustainable systems. We will continue to support food system strengthening, improve child diets, evidence generation, and sustainable financing solutions to ensure that no child is left behind. UNICEF, and I would say other agencies as well, have all realigned their country programs to strengthen Uganda's capacity to mobilize and effectively use resources for high-impact nutrition interventions. Over the past 3 years, UNICEF has supported increased government financing through match funding of approximately $1 million annually under the Child Nutrition Fund and innovating financing mechanism. We need to do much more of this. Additionally, we are happy to support the development of a costed food and nutrition policy, which is intended to promote the creation of additional fiscal space for nutrition for children. I thank the government of Uganda for the leadership and all the partners for the continued commitment and collaboration. This dialogue is a critical opportunity to align priorities and mobilize resources to improve nutrition outcomes. We must accelerate investments in nutrition, and every missed opportunity affects a child's lifelong potential. Colleague, we know that we have a very young population, we have a high fertility rate. We cannot waste time, because each year and each month that we waste, we lose a proportion of children who do not develop in an appropriate manner, do not develop physically and cognitively. And colleagues, let us look at this now as we approach the 2030 SDG targets with a sense of urgency. So please, as we continue to deliberate, we are very clear on what our respective roles are and what the action points are, and we as development partners remain available and present to support the Republic of Uganda in this mission. Thank you very much.
Thank you so much, Dr. Robin. Ladies and gentlemen, another applause to Dr. Robin Nandi. Ladies and gentlemen, you appreciate that Dr. Robin has really given us some of the hints around what we could even build on as we really strengthen our financing for nutrition. He really told me nutrition is a key priority, so whereas I had announced that he has a busy schedule, for him this is his business, so it's a priority for him, and for that we are sincerely very, very grateful. And he really told us how investing in nutrition is a key opportunity for development, perhaps in all its forms, if we'd use that word. And he ably highlighted how the critical window of opportunity is key, reminding me of the 1,000 days from conception to the first 2 years of the child's life. And for us to achieve that, Dr. Robin has called for system strengthening for nutrition, highlighting a number of systems, including food systems, health systems, innovative financing, and many others. And he expressed commitment from the development partners that he leads Already he has told us there is a new UN cooperation framework aligned to the NDP4, which is a strong opportunity for us to perhaps benchmark on and identify those areas of common convergence. But also he has alluded to the fact that already UNICEF has realigned its country programming towards high impact interventions in nutrition, and already UNICEF has supported the costing of the food and nutritional policy, and I think the action plan, as highlighted, therefore calling for a sense of urgency. Ladies and gentlemen, another applause to Dr. Robin Nandi. Indeed, as Dr. Robin talked of accelerating domestic investment in nutrition and financing, at this juncture, ladies and gentlemen, allow me invite Commissioner Joseph from the Ministry of Finance, Planning and Economic Development, who is going to give us a keynote speech on financing the future. Investing in nutrition is investing in Uganda's prosperity. And the Commissioner is representing Ramadan Ngovi, who is the Permanent Secretary, Minister of Finance, Planning and Economic Development, and also Secretary to the Treasury. Commissioner.
Our guest of honor, the representative of the Chair, National Planning Authority, the members of Parliament present here, the UNICEF country rep, and other development partner representatives. I see on our program we have Action Against Hunger and World Vision. And the senior government officials in the room, our very distinguished stakeholders, ladies and gentlemen, good morning. I bring you warm greetings from the Ministry of Finance, Planning and Economic Development. As introduced, I am Joseph Enyimu. I have the honor to represent PSST here this morning. He conveys his very sincere apologies for not being able to join you. As some of you may be aware, the cause for his absence is a cause that equally relates to the essence why we are here. PSST this morning is delivering a public lecture on health financing at Makerere University School of Public Health. And it goes to demonstrate the commitment the ministry has on matters of health and human capital development in general. And I'm happy that I can be able to represent him. I have his written remarks that I will gladly deliver, and also participate in the dialogue that follows on his behalf. So allow me proceed to deliver those remarks. Thank you for the opportunity to address you and the nation at large on the subject of nutrition financing. The timing of this dialogue sits well with a number of related developments in the recent past. The theme of this particular segment on financing the future, investing in nutrition is investing in Uganda's prosperity, touches on Uganda's development journey in the past as well as the trajectory of her growth. About a year ago, we learned from the final report of the 2024 National Population and Housing Census that Uganda's life expectancy had further improved. It is now shy of 70 years, up from 43 years, a generation ago. A few months into 2025, we also learned of 3 separate but related developments that are strongly connected with nutrition outcomes. Income poverty in the country had further declined from 20.3% to 16.1% in 23-24. Uganda registers better health outcomes compared to her regional peers, despite having a lower level of per capita public investment in healthcare. That's according to the Human Capital and Growth Review report released by the World Bank last year in May 2025. Uganda of course sits within a region that is among peers that are equally transitioning out of the LDC category of countries. And it goes to show that the above outcomes build on 2 equally important outcomes established a year before. Uganda has seen sustained improvements across all the 4 key outcome indicators of nutrition: stunting, wasting, underweight, and overweight incidence. Having met the criteria for graduating from the least category of LDCs, including that of the Human Asset Index, which resonates significantly with nutrition-related outcomes. We know that as of 2022, in Uganda, 2 in every 10 children aged 6 to 59 months were stunted, less than 1 in every 10 were wasted, that is too thin for their height, and 1 out of every 10 children were underweight. A notable share of children, of course, also was overweight. Sustainable nutrition, therefore, is about having a healthy balance sheet for food financing over a period of time. In the decade preceding the period we are discussing currently, we established, specifically at about 2010, that Ugandans became net food buyers. That means households now buy more food from the market than they sell. At the global level, UN agencies indicate the state of nutrition and food security is on a positive trend. The share of the population affected by hunger reduced in the last 6 months. This, however, is in contrast to a sharp increase in the population affected by hunger in Africa, the most severe hunger crisis in decades. Put together, the above developments and facts leave us with a very clear message. It takes an integrated development response to deliver sustainable nutrition outcomes. That said, the current situation remains, of course, unacceptable for the affected children and their families. We accordingly need to correctly diagnose the opportunities at hand for speeding up the improving trends I just talked about. It is on that note that I wish to spend the next moments discussing with you briefly, or drawing your attention to the imperative for a market-facing policy posture as we discuss nutrition financing. It is clear that the state of nutrition and food security today is seated in a global context of increasing occurrence of conflicts, declining ODA flows, and retreating multilateralism. The options for governments to use subsidies to address food shocks has become untenable. For governments that tried the route of subsidies, including a few regional peers of Uganda, many have since implemented policy reversals on account of unsustainable macroeconomic imbalances. When the Russia-Ukraine war-induced food and fuel crisis hit hard on economies, Uganda opted not to yield to populist pressure for introduction of food subsidies. Instead, government promoted import substitution and agricultural diversification to replace imported wheat, aiming for long-term self-reliance. Government also determined to support use of locally produced fertilizers, better coordination of fiscal and monetary policy to curb imported inflation, and to speeding up of local oil production as a long-term solution for addressing surging fuel prices. As you are aware, fuel feeds into the food, the cost of food, because it's a major input in the food processing. The key lesson in managing food shocks from the last decade is clear. Efficient economy-wide capital allocation is key to ensuring sustainable food and nutrition security. Uganda's experience clearly shows that without increased and inclusive participation of households in the monetary economy and commercial food systems, many people will remain trapped in food insecurity. Looking back, one can see that Uganda's decision 5 years ago to bring on board all households into the money economy as well was well conceived and a foresighted move in the right direction. Let's unpack a little bit more the issue of nutrition financing. Nutrition financing is no doubt a whole of society matter. It entails mobilizing resources from across all funding channels, public and private, domestic and external, for purposes of ending hunger, food insecurity, and malnutrition. The scope of resources involved is also wide-ranging, from financial to knowledge resources, logistics to food safety regulation, climate adaptation to technology solutions. The guiding framework for government intervention on nutrition has been the Uganda Nutrition Action Plan. The plan has so far been implemented in 2 phases, as many of you are aware, 2011 to 2016 and 2021 to 24-25. The estimated financial resource requirements for delivering UNAP 2 was about 3.3 trillion shillings. More than half of this was to be spent on nutrition-specific interventions. The other half was shared between creating an enabling environment and indirect interventions, nutrition-sensitive interventions. The framers of UNAP 2 conditioned the attainment of high-level policy outcomes of NDP 3 to effective implementation of UNAP. In other words, they were saying the success of NDP 3 will be made or broken by how we invest in nutrition. The outcomes in reference were per capita income, life expectancy, income poverty, food secure households, and the level of stunting among children aged under 5 years. We now have evidence to look back and see whether that assertion was in fact correct. Recent evidence confirms that NDP 3 targets for all the above outcomes were either met or narrowly missed. This raises the question, was Uganda's attainment of high-level development outcomes in NDP 3 period entirely attributable to implementation of UNAP 2? There is need to conduct a terminal evaluation of UNAP 2 to answer this question and inform future investments. UNAP 2 correctly recognized the multiple actors and programs required to deliver desired nutrition outcomes. It specifically assigned implementation roles to 8 of the 20 NDP programs then. Government still believes in a collaborative approach as being most suited for nutrition financing and programming. Within the framework of NDP 4, the annual budget strategies will focus on the ATMs and enablers, including human capital development. Nutrition outcomes will equally be managed within the context of the ATMs and the enablers. Within human capital development as an enabler, priority interventions include strengthening the foundations for human capital development, including food safety, food fortification, and food production. National production of animal protein has been prioritized under the parish development model, as many of you are aware. Key commodities being financed there include dairy products, beef, poultry, and fish. Grant financing of households in the subsistence economy to participate in the front line of the value chains for animal proteins represent one of the best ways for attaining all 3 aspects of food security: availability, affordability, and adequacy. Government has gone ahead to establish the large-scale commercial farmers scheme effective this financial year. The scheme makes available interest-free loans worth over 176 billion shillings for food security, including feed for animals, poultry, and fish. Uganda's national food system also benefits from the Agriculture Credit Facility, the SCF. This facility has cumulatively disbursed over 1.3 trillion to over 6,000 agricultural projects, including block grants to small farmers that do not have collateral security. Using an array of innovative financing instruments, government is also unlocking significant streams of private investment into local food value chains. For example, between 1981 to 2025, public investments have unlocked over 1.5 billion US dollars of private investment in a single commodity value chain, that is crop oils in Uganda. Similarly, over the NDP4 period, additional project interventions worth over 1 billion US dollars are programmed to leverage private investment in food value chains including beef, dairy, poultry, fish, and cereals. The above investments are very vital for sustaining food supply for Uganda's rapid urbanizing population. In view of that landscape of both public and private investment, it's important that we prioritize something called execution discipline. And that is the call to action to us here today. Distinguished ladies and gentlemen, delivering sustainable nutrition financing demands us to have a razor-sharp focus on execution of strategies we've laid out in the respective NDP4 program implementation action plans. At the household level, farming households, including grantees of the parish revolving fund, must embrace commercial agriculture in collaboration with private sector players running aggregation centers. At community level, government has significantly increased investment in its community level institutions. These institutions need to demonstrate a corresponding return on investment through, among others, effective mobilization of households to take responsibility for their health and nutrition outcomes. Number 3, as far as health financing in general is concerned, and thanks to the innovative spirit of the private sector, we now have a number of market instruments that can be leveraged to increase nutrition financing. Policymakers and professionals in the healthcare space, including us in this room, need to drive structured dialogue with the private sector on what works within Uganda's context. The Ministry of Finance, Planning and Economic Development stands ready to be an active player in such dialogue. Lastly, is on public service delivery. It is now common knowledge that actions of different MDAs significantly impact the enabling environment for nutrition investments, from roads to energy, ICT to skills, logistics to regulation. Effective public service is required for private actors to play their part. Inaction on efficient delivery of public services slows down deployment of capital for nutrition investments. Let us all live here with determination to turn our workspaces into pockets of execution excellence. In conclusion, ladies and gentlemen, rapid accumulation of human capital is a non-negotiable for Uganda's growth trajectory. Government's commitment to financing human capital development as an enabler is unquestionable. What remains to be seen is whether those entrusted with the responsibility of translating budget allocations in human capital development to public services will also demonstrate the same commitment. Ministry of Finance, Planning and Economic Development is a reliable partner in bridging the gap between budget numbers and nutrition outcomes. I pledge our continued availability and effort in keeping evidence at the center of national strategies for delivering better and bigger nutrition financing outcomes. I thank you for your very kind attention.
Gentlemen, another big applause to Commissioner Joseph Enyimu. For those of you who may not know, Joseph is a well-converted nutrition financing advocate. Currently, he's the Commissioner, Economic Development, Policy and Research in the Ministry of Finance, Planning and Economic Development. So we are very, very happy that you joined us. And for you who may not know, Commissioner Joseph has been with us in a number of areas. Social protection, you'll find him there. And indeed, if there is anyone official from the ministry who has been very interactive with us in this field, really we highly commend Commissioner Joseph. Colleagues, ladies and gentlemen, the keynote speech by Commissioner Joseph raised a number of key issues. I can't unpack all of them, but just to emphasize his emphasis on timing, that this dialogue was timely, meaning it is well appreciated by government. And he laid out also the fact that indeed there's some progress being made despite also some constraints as he put them forward. And he made some key point around the need for a healthy, balanced sheet for food and nutrition financing, emphasizing how already Uganda now is a net food buyer, meaning we are buying more than we are selling, perhaps, and also calling for the integration of development responses, highlighting what we have already observed this morning, that we cannot only pin nutrition investment and improvement to one sector or two. Multiple actors are required, multiple sectors, and the whole of government approach to address the bottlenecks before us. And he called for market efficiency. Of course, this is very common with finance, that if we do not grow our markets, then Uganda won't gain more in terms of the balance of payment. So import substitution and export orientation is the focus of government. And he showed how without subsidies, government is still supporting key sectors of the economy relevant for nutrition. He highlighted a number of them, and he showed how nutrition financing really requires a wide range of resources beyond food, to include infrastructure, climate change mitigation, and many, many others. He also highlighted how UNAP 2, the Uganda Nutrition Action Plan, which recently expired, we are now going for UNAP 3, was a key enabler for NDP 3. Of course, NPA is coming next. They'll tell you, well, NDP 3 had challenges of COVID-19, and therefore it wasn't fully implemented. So we had some lost opportunities, one would say. But Commissioner Joseph highlighted now NDP4 brings new hope and momentum through the ATMIs, or ATMs as they call them, the agro-industrialization, tourism, minerals, etc., etc. And the enablers that include human capital development, where nutrition investment has been highly prioritized in areas of food safety and etc. And he outlined how PDM is a key engine at the moment for transforming communities and households, and really emphasizing the need for increased participation in commercial agriculture, of course emphasizing the line of income for improved food security. He went on to highlight many other things, public-private investments. There's a point here, we need to have a laser-sharp focus on the PIAPs because there's a lot in there that we can benefit from. But also he said beyond market instruments that are available for us to be able to get a high return on investment, there's need for what he called public service delivery improvement by bringing the various multiple actors together. And he expressed high-level commitment from the Minister of Finance. Ladies and gentlemen, that was a really great presentation from a rare actor in this dialogue sometimes. I must say, Joseph, we are really privileged that you came, because oftentimes finance is missing. They always say, what do we have to talk about food and nutrition? But the fact that you have given us this priority really means a lot to this community gathered here. Colleagues, I don't want to take a lot of time unpacking the keynote, because there are distinguished colleagues who will do that. And at this juncture, we are going into the final speech of the morning. I know we are a bit late. The keynote, the chief guest speech. But before that, for issues of protocol, I wanted once again to invite Commissioner Mwanga from Ministry of Health since they are the main hosts for today from the side of government, to say one or two words to what has been said by the Commissioner from Ministry of Finance, and thereafter invite the chief guest to make their remarks. Commissioner.
Thank you, MS, Master of Ceremony. Let's give him a very big hand clap. And let's clap for our keynote address speaker. If we have finance with us, we have the partners, we have the academia, we have UNICEF with us here, we have the beneficiary. Commissioner from Finance, I want to welcome you. I'm here to represent my director, who was supposed to give a remarks and invite our chief guest. I'll stand on the protocol I gave. Good morning, everybody. I'm pleased, as the director from Ministry of Health, now I'm wearing another umbrella, to join you on this second level nutritional financing dialogue, convened with the theme of financing for nutrition, a pathway to achieving government's commitments and ending malnutrition. I extend my warm appreciation to all the partners whose collaboration continues to strengthen our response to malnutrition, especially our hard-to-reach areas, Moroto, Karamoja. We want to thank you so much. Thank you so much. Thank you, UNICEF. Thank you, World Food Program. Finance, you are supporting us. As Minister of Health, we appreciate. As we build on the discussion initiated after the 2025 Nutritional for Growth Summit in Paris, this platform provides important moments not only to reflect on finance gaps, but to critically examine our policies. Governance, taxation. You heard the minister, the keynote address. Innovation, innovative financing from domestic and foreign. Regulatory systems to shape our effectiveness, equity, and accountability on nutrition investments with the support of the civil society and the private sector. From the governance point of view as Minister of Health, it's not only financing. Ministry has done a lot in terms of leadership, in terms of human resource, in terms of delivery of service, in terms of financing. We have collected a lot of data and information as Minister of Health. We have had many collaborators. We even have a division for nutrition. So it's not only financing. The real impact of finance resources depends on the systems to guide the allocation, the utilization, and the oversight. It is the systems we need to look at. Strong governance ensures that nutrition financing is prioritized within the National Development Framework, as you heard, to align with all sectors toward evidence-based interventions that yield results. Regulation, on the other hand, plays a fundamental role to create an enabling environment to improve nutritional outcomes. Through appropriate policies, standards, and enforcement mechanisms, we are able to safeguard food quality, promote health dietary practices, to guide the private and the public sector towards nutritional goals. Effective regulatory framework also help to curb the proliferation of unhealthy foods. We have many people who are producing unhealthy foods, which are increasing the burden of malnutrition. Furthermore, the robust governance structure can enhance transparency, accountability, and this will allow to track the financial flows, access performance, and ensure the resources reach those people who are intended, especially the vulnerable groups I talked about, the children, the pregnant women. the elderly now, the disabled. We are having so many refugees who have this problem. So if we plan well, have proper regulations and oversight, I think the intended objective will be met. In today's dialogue, therefore, it is very relevant. We know the challenges. We have mobilized resources. Finance, in the keynote address, he has told us how we can do it. Through this lens, we can promote coordination, multi-sector approaches for nutritional financing. We can strengthen accountability and the monitoring system. We can have innovations. We can align our national priorities to the global commitments. As we move forward, let us remain deliberate in strengthening the governance and regulatory framework in nutrition and financing the central pillars of the efforts of malnutrition in Uganda. As we dialogue today, let us come up with actionable policy direction to improve our nutrition outcomes and our health for our people in Uganda. I call upon all the players into this field to ensure that we come up with policies and actions which can help us. I remember one of our colleagues shared a scenario of some lady which involves very many system players. It's not only one person. We have to play as a team to ensure that we are there. I hope we are going to have very nice deliberations today, and I say all this for God and my countries. Ladies and gentlemen, at this juncture, I want to take the honor to invite our chief guest of honor today to address you all. Our guest of honor, at this juncture, as Minister of Health, I want to invite you to address the gathering. Thank you so much.
I am tempted to stand on the existing protocol, but I would like to appreciate the honorable members of parliament who are really present here. I see many of them, and I want to also thank the PSST representative, Commissioner Enyimu, for making it here, and the different development partners who are in the room who have supported the process, the Director Health, many government representatives from different MDAs, civil society. I see them in here, the private sector. I see academia, which is always supporting, and also all the invited guests in your capacity. Ladies and gentlemen, good morning. It's very interesting to speak after Commissioner Enyimu. He's one of the celebrated speakers we have in this country, actually. And I'm privileged really to speak after him. And as the National Planning Authority, we are very glad to be part of this important second National Nutritional Financing Dialogue. I want to bring you greetings from our Executive Chairperson, Professor Pamela Mbabazi, who entrusted me to come and deliver her remarks, and she sends you greetings and regrets for not being able to join us physically. The special thanks we really go to Ministry of Health, with your partners, the Action Against Hunger, World Vision, we do have CARE, UNICEF, and all other partners, Food Rights Alliance, for pulling this off. This is very important. Like all other speakers actually stating, this dialogue is very strategic, and it's very important and very timely, coming at a time when we are in the first year of implementing. We're about 2-3 months shy of finishing the first financial year of the fourth National Development Plan. The fourth National Development Plan is the first plan to implement what we call the tenfold growth strategy that is supposed to catapult us from the about 50 billion US dollars to about 581 billion US dollars 2040. So this is the first plan, meaning that this talk is very timely, and like as highlighted by the commissioner, we are implementing the ATMs, and there is that close linkage. You realize that the agro-industrialization has a very big component of this food systems that supports nutrition. We will not achieve the nutrition unless we have support for agro-industrialization, agricultural systems, industry, then also the tourism, minerals, and then also leveraging on science and technology. It's also at such a time, remembering what Rita was saying, it comes at a time when we are also looking for resources, local domestic resources, to implement our interventions, because you realize that development partners also their budgets are shrinking, and so the onus is on all of us now to try to tease out the resources, and especially I told you to have a razor eye that can look through the PAPs and identify all this money. It comes at a time when we are fast-tracking SDGs realization through transforming our food systems. The UN and all the countries realize that when we transform our food systems, then we will definitely realize the SDGs. And if you remember, in 2025 in Paris, the Nutrition for Growth Summit, countries committed to have high-level political commitment and nutrition financing. So this is the time I'm talking about. And this is exactly the conversation that Uganda must now deepen. How do we move from these commitments to financed, coordinated, and accountable action? Nutrition financing must be understood first and foremost as development financing. And you had more of that from the PSST's speech. The NDP4, which is part of the series of plans to achieve the vision 2040, considers us having higher household incomes, full monetization of the economy and employment for sustainable transformation. But we cannot achieve this progress. When our children are going to school, when they are hungry, when our mothers are also hungry, but also when our workforce is less productive due to malnutrition in all its forms. So therefore, every shilling that we invest in nutrition gives us a return, and you know that. I was looking at a World Bank report of 2024 saying for every $1 that you invest in nutrition, you're going to get $24 return. So isn't that amazing? And I'm saying this, Mr. Commissioner, I want to repeat this, and you're going to tell the PSST that for every $1 that we invest in nutrition, that's a World Bank report, your partners, that we will get a return of 24 US dollars. It even goes further. When you go to industrial food fortification, where we are adding all these nutrients to foods using industrial processes, for every $1, you get about $27 in return. How? Through increased productivity of the workforce, through averted disease, and all of that. So therefore, in the Uganda's context, nutrition is therefore not a social cost, and it's one of the most strategic economic investments that we can make. But let us be honest about the problem that we want to finance. And I've listened to other speakers, but let's agree that we are still suffering from a problem of the triple burden of malnutrition, micronutrient deficiencies, we have undernutrition, and we have obesity. Yes, and we continue to have these candidates. And all the statistics you gave them, iron deficiency, and all that, and I don't want to repeat that. So, nutrition financing cannot be narrow. It must address the full range, maternal, infant, young child, and adolescent nutrition, diet quality, the food safety, micronutrient deficiencies, and the growing burden of diet-related NCDs. Now, one central message, and which I want to give a little bit of highlight, is that nutrition financing cannot stand alone. Nutrition financing will not stand alone. Why? It must stand, and the country director talked to this, it must stand on the other pillars of governance. It will not stand alone. And it will work where we have policy clarity. It's going to work where there is institutional coordination, strong data, and accountability. And I have a few questions here for us in the room. Where are we regarding these frameworks? Along the policy, that's the 2003 Food and Nutrition Policy. Yes, I'm aware. It's been under review for the last 3 years. Yes, where is it? I don't know whether we have some representatives from Ministry of Agriculture in the room. That policy was very important, but now the dispensation has changed. We have more pressure, yes. We have more disease burden, we have urbanization, and also have NCD risks and the changing form of food systems. Where is the third nutrition action plan? Yes, Commissioner, you talked to second and what they did. You see, we are supposed to have a UNAP aligned to the national plan, and we move together. So where is the third UNAP that should be guiding investments in nutrition? Are the relevant nutrition actors speaking to each other, or we are still operating in silos? The NDP4 brought forth the programmatic-based budgeting, implementation, financing, planning, reporting. But silos, duplications are continuing to show presence, and it's upon us to make sure that we don't have these silos and duplications continue to show up. And interestingly, they show up at all levels: MDAs, development partners, CSOs. Yeah, I will not be shy to talk about that. Where is the Food Regulatory Authority that Cabinet put forth that that it addresses issues of food safety in this country? And you saw recent development is the MAIF moving at the same pace with National Drug Authority, Ministry of Health regarding food regulation in this country. And how far with the private members bill on food and nutrition, and I see some of our representatives from Parliament. I always see you on this in our meetings addressing this, and I know you moved far, but where is this? And another question would be, should it even be a private member's bill? If you really get to Parliament business, is this supposed to be a private member's bill? Is the National Nutrition Coordination Committee under the OPM well facilitated, well supported? Are the district nutrition committees, are they functional? So if we don't have answers to these questions I am asking, we will continue chasing nutrition like wild geese. It's very hard to catch a goose in the up there when it is flying in the bush. So we will need answers, and some of those answers are to be obtained from what the director was saying. Some of those answers will be obtained in this meeting. So to repeat this, nutrition has been integrated into the NDP4 to attract domestic financing. And I can say we went further and articulated these interventions in program implementation action plans, to which ministry and agency strategic plans must align, and the subsequent work plans and budgets of those same institutions must align to their strategic plans, and in which case we tease out and get the financing through our program budget system in the Ministry of Finance. But ask yourself a question: how many times have you gone to the program working group where resources are shared, where the cake is shared, where decisions are made? Because you see, when you have interventions in this PIAP, there's a program working group which will now say we are putting money here for nutrition, we are putting money here for health, we are putting money here. So have you even gone to have your voice heard in that meeting to say, hey, we planned for a policy on this and we need this money? And this is also where the role of local governments have become very critical. I'm very happy I had very many local governments within this room. And we've used the parish development model to emphasize government, a whole of government approach, and the parish-centered approach, socio-economic transformation. You realize that that pillar 1 of the PDM has a lot to do with nutrition. And it must take us time to understand what is in that pillar to make sure that we pull out the nutrition intervention. NPA is developing regional development plans because we realize that some regions are lagging behind regarding development, and so they require affirmative action. And therefore, these regions like Acholi, Busoga, Bukedi, some areas of Bunyoro, Karamoja, need regional plans. And we have developed the Karamoja one. We are now doing one of Acholi. And we've put in these interventions. Therefore, that means MDAs, development partners, private sector must look out for these nutrition interventions in these areas to make sure that there's emphasis on their implementation. The food systems nutrition nexus must be at the center of our thinking, and I already talked to that. You will not talk to nutrition alone. The food systems is very important. The food safety along these food systems, food trade, market access, the availability, and all the pillars of food security must be taken care of. And this is where the private sector now becomes very important. The private sector is not only a source of jobs, investment, it's also a delivery partner in nutrition. You realize that they're adding food, they're adding nutrients to food through agro-processing. We have digital innovators, we have financial institutions, we have insurers, transporters, we have the media, and all that. Therefore, we need responsible private sector participation in nutrition-sensitive value chains, and more so for biofortification and industrial food fortification. At the same time, sustainability must remain at the heart of today's discussion. I'm very happy to see where government of Uganda is saying we are organizing this nutrition meeting, and development partners have come just to attend and see what is happening, but not having them having pulled from their what? Pockets. You get what I'm saying? The sustainability we are looking for. Government has provided for nutrition. At least the NPA tried its best to put these interventions to the NDP. And how are we attracting this domestic financing? So we need that sustainability. And therefore, we must now move beyond traditional financing and begin to ring-fence nutrition within innovative financing frameworks, linking it to performance-based budgeting, climate financing. You know, climate change is an issue, and even blended finance. So that, and Rita talked to this, so that nutrition is not an afterthought, but a core driver of resiliency and inclusive growth, just like our topic is indicating. Nutrition should show up not only in process speeches, like this one I'm delivering, commissioner delivered one, director delivered one. You know, we keep speaking English in meetings, but it should show up in costed plans. I like when he says that they're going to cost the nutrition policy. Yes, but how fast are we moving? Where's that enabling environment to make? Because imagine UNICEF has money and it is here waiting. Where are you, government? And we move. Okay? Must move into costed plans, annual budget frameworks, implementation matrices, and audited performance reports. But are we accountable? Are we accountable at all various levels? About 4 years ago, 4 or 5, when the food systems approach was beginning here, we said, okay, yes, we want to invest in food systems transformation, but how much is already in and how much do we project? So a study was conducted. It was very easy to find what government is offering because sometimes it's minimal or none. But when it came to the development partners, CSOs, to obtain information was very, very, very hard. This speaks to our accountability. Let's be accountable with the time and the resources that are within this nutrition space. And that is why we must evaluate ourselves. Are we evaluating ourselves? Do we have robust M&E frameworks that criticize our progress positively or negatively? How are we assessing our progress? Does even the National Development Plan reporting framework have nutrition indicators? Do we have agreed upon indicators and their targets upon which we are assessed? Lastly, are we reporting? You see, whatever you never report on, actually you did not do it because you don't have evidence that you actually did it. Do we interest ourselves in what appears in the National Development Report? And is nutrition even reported in there? We have a national report, National Annual Performance Report by the OPM. Do you go in there to actually see if your nutrition was reported on? Let me bring it down now. Where you come from, you have institutional annual reports, financial, and the other one. Do you actually report on nutrition? Do you read those reports to see that, okay, this is what was put in, or these are the interventions we have delivered? Therefore, the NPA, we're going to remain committed, and this is the message from my chairperson, at supporting this process, especially of making sure that everything is in plans. We at NPA do evaluate and approve strategic plans of institutions. And I also appreciate my colleagues who are here, Philip and Dr. Munira. At least we make sure that nutrition is, for those nutrition relevant MDAs, that nutrition, what we put in the plan, is well captured. Therefore, we remain committed to this process. And on behalf of the Executive Chairperson, National Planning Authority, Professor Pamela Mbabazi, I wish you fruitful deliberations and practical outcomes for God and my country.
Ladies and gentlemen, another big applause to Grace Bunanuche Bwenje, representing the chairperson of the National Planning Authority. Colleagues, the guest of honor has really laid bare a number of issues, but also touched base on what the National Planning Authority, the institution mandated to guide this country on macroeconomic planning, is doing in terms of addressing the problem. But also, at this point, we also, ladies and gentlemen, applause Commissioner Muanga from Ministry of Health, who ably really represented the Director General of Health Services. And Dr. Muanga, we're very grateful for your words of wisdom as well. And colleagues, the two distinguished speakers highlighted government's position on a number of issues. Of course, from the Ministry of Health side, the need for system strengthening, the proliferation of unhealthy foods and diets, but also issues to do around improving governance and the role of the different stakeholders beyond health in addressing the issue of nutrition. And really not to go against the African proverb of saying when the elders have spoken, you don't add much, but really to recognize that the chief guest highlighted how the fourth and current National Development Plan 2025-26 to 2029-2030 is the main driving macroeconomic overarching policy that will see the tenfold growth strategy be realized, where Uganda is aiming to move its economy from a GDP of 50 billion US dollars to 500 billion US dollars. So indeed, NDP4 is key for us, and therefore as a fraternity gathered here today, it is paramount that we interrogate this NDP4, identify those opportunities, and therefore mobilize resources for investing in them. He also told us how a recent report has shown that nutrition investment increasingly has more return on investment. The first report of 2026 said $1 gives us $16 on return. Now, Bwenje has said the latest report says it has increased to $24, which is really a high return on investment, and therefore a strong justification for our gathering here today. He also touched on the critical window of opportunity, which has already been underscored before. The MyCAN. MyCAN, for those in the room who don't know, is maternal, infant, young child, and adolescent nutrition. It encompasses that critical window that if we invest in MyCAN, we can prevent undernutrition, we can prevent micronutrient deficiencies, but also we can prevent non-communicable chronic diseases linked to nutrition, including overweight and obesity conditions, which we know are really outcomes of excess intake of especially energy and other and nutrients such as fats, etc. Colleagues, Dr. Bwenje is aspiring, I know he's our colleague in the academia, is studying his PhD. We could announce that. But he also outlined a number of things, including the missed opportunities, the delays in policy. The Food National Policy is delayed, the UNAP 3 is delayed, and many other things are delayed. And he asked, where is nutrition in the program-based budgeting framework? And what are the key sectors doing in ensuring that when they are in the PEAP meetings, this cake is cut towards nutrition? So he's arguing that we must be there and our voice must be heard in the PEAP meetings. He also talked of other opportunities which are delaying the Uganda Food and Agriculture Regulatory Authority, that is key for the food systems transformation. He also challenged MPs in the House, where is the private members bill proposed? Yeah, not yet a bill yet, because I think it hasn't gone for the first reading. So, but members of parliament are here, and shortly we shall hear what's happening and even challenge the districts here. Are the district nutrition coordination committees functional? That's a big debate also. And he ended by saying that this is the opportunity, the role of local government and the PDM is key going forward. Colleagues, I may not really fully exhaust everything, but he also challenged Office of the Prime Minister and also urged for ring-fencing nutrition financing, but said, is nutrition in APGA? Are we reporting? AGPA is the annual government performance report every year. All sectors across government and agencies report. Do we see nutrition in there? What is its space? So, yes, we need the costed plans, but also we need to see reports and more dialogue along these lines. Ladies and gentlemen, before we go further, allow me to recognize the presence of the country director of the Global Alliance for Improved Nutrition in Uganda, Madame Damale Sali. If you're there, we recognize you so much. Yes. And at this point, ladies and gentlemen, before we go to have a panel discussion to unpack this, we shall have a short break to stretch and have a group photo. But before that, protocol demands that the representative of the people, and it's getting hot in here, so the technicians need to get us some AC again. People are getting hot in here. But before that, ladies and gentlemen, we have had Grace Bwenje, representing the chief guest, challenge the private members bill. And when you hear law, you hear parliament. And parliament in this country has a very big role. There are many roles, but among which is appropriation of resources, approval of the budget, legislation, and many, many others. And by default, they are the people and they have the power because they represent us, and therefore, in terms of governance, they are the highest level of authority. So by omission, it was a mistake in the program. We really apologize, but we felt it necessary that we hear from our distinguished honorable members of parliament. And since we have a big representation of Karamoja in the house, and also the fact that Karamoja is one of the highly vulnerable, one would say, sub-regions of Uganda in terms of nutrition. If you look at the statistics, all are in red. Stunting, wasting, anemia, food insecurity, which may not be nutrition anyway, but also poverty. Karamoja has seen it all. And for us who have been Karamoja, we say that despite billions of dollars having been invested in Karamoja for many years, progress has been slow. So ladies and gentlemen, join me to welcome Honorable Lokwang, representing the people, I would say of Karenga, but the entire Karamoja now, and also representing the colleagues from Parliament, because he will speak on their behalf, to come and make a remark, really, in his capacity, but also on behalf of Parliament, to this dialogue. And hopefully after Lokwang, we shall have a group photo and a short break. Honorable, you're welcome, sir.
I take this opportunity to welcome all the attendees here to have left the valuable time to come and attend this very core topic. You know, nutrition is all a process about the welfare of the body, and this particular time is the human body. I am really privileged to come and present for Parliament and my members around. I really say all this has been articulated to the point. I've been listening very carefully. I also belong to the Uganda Parliamentary Alliance on Food, Nutrition and what? And security. That is what we use. And in this sense, it is very important for us to have this dialogue. And I therefore welcome all of us to Nutrition Week. That is going to be, it is the 6th Nutrition Week, which is going to be held in the eastern part of the country, and Iganga district will be hosting. My question is, which I've always asked the presenter or the talked about, he ended with Karamoja. I am a Karamojong 311. Grew in Karamoja, and all the hell you are talking about in Karamoja, I belong there. Why Karamoja? Why Karamoja? We have always had talking that we shall not wait for Karamoja to what? To develop. And Karamoja has developed and is present, and will tell us what it is. The Karamoja question is not about what people understand. All the actors I get here should get it clear. That is my Karamoja thought. My other members who are here can believe with me. The Karamoja question is brought by the actors. It's not what Karamoja is. There are many people who use Karamoja as a conduit. You have talked about too much money. Billions of money taken to Karamoja. But does it reach there? Somebody, the finance or Ministry of L say that if you allocate money, resources to a wrong place, you will not get what? The results. That's what Karamoja is exactly. Beginning from the NRM Bush War, it was number 8B. They thought it there. We shall enhance rapid development for Karamoja. How many years now? The actors are the one that are mainly portrayed. One presenter here said that Karamoja, Moroto. There are not two people, two places. Moroto is in Karamoja. And many people think Moroto is Karamoja. That is one thing. Number two is history. The history talked about Karamoja is what spoiled, what makes everybody. First of all, fear. If I told my member here, you are transferred to Karamoja, he will raise up the what? The hands and say, better die here than going where? Because they said Karamoja is a land of no return. A land where God is still creating. They say, welcome to a human zoo. They had put it there. It scares everybody. And when a place is isolated, it's not reached by developers, how can it come to address some of these things? And of course, the attitude. They see if you are Karmojong, you are below the belt, we say. And yet we have the brains. When you talk about nutrition itself, the Karmojong are more knowledgeable about nutrition. If you went to the local, the basic family, they had what they call a reservation of food. They dry meat, they pound it, they get granules, they put it there, they get honey, they put here butter, even there's some cereals they put there and keep for eventual. Anytime a child is is feeling hungry or whatever is given, a visitor comes, is given. The Karamoja case is not about knowledge about food, but it is about the food security, the availability, the water part. If water was there in Karamoja, it will feed the whole country. That's what I can tell us. So I ask all the actors to definitely go and see. Another bit is there are people who have lived in Karamoja, they're enjoying Karamoja, but when you want to reach there, they will tell you it is a bad place. But they are taking their families there. And they are building. They are having factory, businesses and so forth. That is just about why Karamoja. I wanted just to answer that bit of why Karamoja at the lowest. Even some of these statistics they are talking about, these are some statistics that are superficial. I was with my OPM lady there. Why? And yet you have affirmative action for Karamoja. There are certain things that don't reach there. However, Parliament appropriation. It is, I always want to ask the question, it should be some kind of ignorance. As Parliament, we definitely allocate as per the demand, as per the need of the user departments. In this sense, I want to ask the CSOs, they are very instrumental. These civil society organizations are very instrumental in budget allocation. They are the ones on the ground. They are the ones who know the nitty-gritties that can inform government to allocate directly. But there is a gap where the CSOs in this particular forum finish the forum and only write a report to their donors. Because they are supposed as CSOs to communicate to the user departments. Like for example, the Ministry of Agriculture Ministry of Health, all these related ministries, to tell them to have a basic of creating a policy. And from the user departments, that is where they go to the executive. And therefore, when they approve some of those things, they bring and say, it is needed in this way. And Parliament works on it. Get to know that policies are not made by Parliament. Did we know like that? Maybe. Parliament does not. We only make laws. No, so? So, policies are implementation guidelines that the user department uses or passes to implement what government intends to do. So, that gap is there. And of course, we have heard from Ministry of Finance talking about the resource what? The resource envelope. Sometimes when the user departments comes to explain this part, I know as I talk the budget as insufficient, even as a allocation. It is not intentional that is insufficient, but it is because the user departments have not prioritized. If you see what the user departments do, they want 20 cars. They want to build an office. They want to do ABCD. They explicitly stand on it and defend that we want cars. And nutrition is not there. Then it comes, oh yes, for us, we can, but nutrition, let's put this. And sometimes they put what they have requested for. And they go to say Parliament has refused. What? And yet they are the ones who have brought what? Their budgets. Yes, we are happy. Government has come up with the PDM. PDM basically is addressing the key areas that bring production. Like, for example, we're talking about production. This budget for this year is aiming at what? What my guys talked about, ATM. Many of the people, like my villagers, my voters, were thinking it is busy. These ATMs of money. Yeah, it is focusing on this, and which I know is a view. As the forum, we have always advocated. Ours is to advocate that government intervenes. This answer of the private members bill, we pushed, and we are still pushing. But the law says that when the next term, like now, the 12th Parliament is coming in play, it means that all this collapse. If it is not done up to this moment, it is all what? All the bills are what? Collapsed. But as a forum, we shall get back with the user department, and we are interested in having it a government what? A government bill. What was delaying was who hosts the bill. There was a struggle. Is it Ministry of Agriculture, Ministry of Health, Ministry of Water, Prime Ministers? So everybody was, who owns it? You are seeing the ping pong. But we tried to zero it to Prime Minister's office, because it is the head of government businesses. So, but because of the timing now, it needs to be restarted. Maybe the virus has entered the computer, as we say so, because it is going to collapse, and we are going to restart it. Basically, I would say financing of this nutrition is something that people must take. First of all, it starts with an individual. It starts from you as an individual, because this business of attributing it to another person, and yet the impact is on you. Let's support it and make sure, as it comes to government, we are there to advocate. And please drum the financing. And not only is financing, but you should also start from your local base, such that if a person at home is able to start production, Ministry of Health is supposed to give a guiding role to say, Ministry of Agriculture produce this kind of things, let's do this. Otherwise, within this nutrition, food is basically a drug, and definitely Ministry of Health will what? Will have no job. If you eat well, you do exercise, you sleep well, you are nourishing your body, and the medicines will. It goes a long way to develop the country. They say a healthy population is a productive one. For this, I want to request all of us to join hands with us, and we make sure our country is nutritionally sensitive. I say all this for God and my country. Thank you.
Ladies and gentlemen, another big applause to Honorable Okwang. Yes, Honorable Okwang was spot on, challenged us on a number of issues. He told how many of us don't know Karamoja, and for colleagues in the whole house who have never reached Karamoja, I really urge you to reach there. At least I've gone there more than 6 or 7 times. But to remind you that Karamoja is not only Moroto, but we have 9 districts in Karamoja, if I'm not mistaken. B, Mamudat, Kabong, Karenga, Kotido, Moroto, Nabilatuk, Nakapiripirit, and Napak. So that is very important for us to note. And Honorable Okwang is from Karenga, deep close to Kidepo Valley National Park. And ladies and gentlemen, Honorable Okwang raised a number of issues. He's told us how the people of Karamoja are resilient. Indeed, we cannot underestimate their potential, but also made a strong case for the water nutrition nexus. The argument of Honorable Okwang is that if we fix the water problem of Karamoja, we may improve the nutrition significantly. But also issues of accountability and the user department putting these things in the budget and the planning. So in a way, Okwang is saying this country may have resources, but are the sectors, are the agencies, are the districts prioritizing these interventions? So colleagues, and he told us about the private members bill. It's a bit disappointing to hear from Honorable Okwang that all the efforts of 4 years now have to be rebooted, as the computer issue is. Why? Very technically, we failed to table the bill before the 11th Parliament. And the rules of procedure say if you do not table it for first reading, it goes back. And but we're having hope that the new leadership and also the debate around government taking it up. Some of us, Honorable Okwang, felt it may be impossible or difficult for a private member to pass it through because the financial implications were there somehow. And finance has not given. So all these issues, and we need the sectors to come up, because as you had, really the role of agriculture, health, and others is key. So if the sectors don't come behind this bill, it may be a problem. But the wisdom of having it under OPM, as Honorable Okwang said, perhaps is a solution, although sometimes they're telling us OPM can't own laws and policies. They are by the sectors. Again, these are coordination challenges, but they'll come up in the next phase of this dialogue. Ladies and gentlemen, I didn't want to unpack what is yet to come. We are preparing to have a major, one would say, panel discussion of 30 minutes. But before that, we felt we are going to have another health break, but this time for a group photo. So what a wonderful moment. We have been trying to analyze how we can have this photo. Sheraton is fully booked today, and we must have lunch before 1, otherwise there'll be a problem at the serving point. So we have agreed that we are going to have chairs in front here for our distinguished dignitaries to sit, and then a few groups will be called upon to come to the podium, such that no one is missed in the process, because we felt a general group photo may be impossible given the numbers and the limitations of space. So bear with us some 5 to 10 minutes as we stretch, network, and also have our group photos. So ladies and gentlemen, this juncture, we are suspending temporarily for 10 minutes for a group photo. We shall all rise a bit as we organize the front podium, and then we begin the photos. We shall start with government officials present with the dignitaries. The dignitaries are all on the 2 high tables, and others we shall bring forward. So short break, and we can have a music interlude, something that is nutritious from the DJ as we take these group photos and etc. Thank you very much. No, it's okay. So add some chairs. If we have to use the spine. Okay. Otherwise, behind these distinguished colleagues. Local government, academia, Dr. Kato, Dr. Chikomeko there, local governments and academia. Okay, slowly by slowly, as these ones, the ones seated will remain seated. No one is leaving the seat. We need you. Slowly by slowly. You can claim and just turn on the honorable side, the other side. The other side. Here is narrow. Here is a bit narrow. Okay, sorry. Thank you. So, members, we are talking of districts, local governments, academia. If the number is small, I'll call the rest of us. The number looks small. Okay, Dr. Joeri are there. There seems some now. Okay. Okay, that's okay. Is that okay now? We can continue pushing, squeezing a bit. Okay, now I'm going to begin the count once again. Okay, come closer. Okay, so I'm going to begin the count again of 5. Cameraman. Okay, 1, 2, 3, 4, 5. Okay, the one seated remain seated. Now the rest of the people who have not gone in the picture. I see people are dodging there. Please, the tables on our side here. The rest of us, food rights, I see Fia in Uganda. The rest of us who have not gone in the picture, including myself. Yes, I'm also joining. This is the final call, final boarding call for those who are going to take a picture with us. The rest of us, this is the final boarding call. Final boarding call. Okay. We can push a bit, push. Photo moment. Photo moment. So I'm not counting now. We are going to say go. I'm not counting. We count later. Okay. Okay, let's do here on the count of 3, 2, 1. Let's go. 3, 2, 1. Let's go. Thank you. Thank you very much. Thank you. Thank you very, very much. Slowly, slowly. The podium is a bit high. Let's not injure ourselves, colleagues. Slowly. Watch this gap. Okay. Watch the step. Watch the step. Okay, so colleagues, we are going to have a 3-minute stretcher. Those who want to go for small stretching, stretch 2-3 minutes as we organize for the main panel debate. We are going to have very strong debaters. If you have not been in a debate, we have one now, and we'll take strictly 30 minutes, then we go for lunch. We are going for lunch at exactly 10 minutes to 1. So we are right on time. And please, we urge all of us to be around. Don't miss our lunch. It's very sumptuous. It's very nutritious. And it was specifically prepared for this dialogue so it can meet the standard. So we are now going to organize 2-3 minutes, then we get started. So stretch a bit, network, relax, 2 minutes, and then we go into a panel present discussion. Good. Okay, ladies and gentlemen, 1 minute to go. We have 1 minute to go to start the panel discussion. Okay, ladies and gentlemen, as we network, we feel somehow we few seconds, but as we prepare, I urge colleagues to wind up the networking there so that we can have this discussion and we have lunch on time. Since today is really a heavy day here at Sheraton. So, ladies and gentlemen, as we continue to have work in progress, allow me at this juncture notify you that we are heading into a panel discussion to unwrap the key presentations of the day. And after the panel discussion, we shall have room for the audience to be able to also share on some of the experiences, but also some of their responses to the presentations that we have had this morning. So really, this panel discussion is to, in a way, unravel some of those critical opportunities, but also guide us in terms of how different stakeholders can be able to be actively or effectively engaged to support nutrition financing in Uganda. But also we shall learn more on some of those bottlenecks that are facing nutrition financing currently. At this juncture, allow me invite our distinguished panelists, and the first is none other than our own Miss Agnes Chirabo, the Executive Director of the Food Rights Alliance. Shall we manage? So Agnes Chirabo will be taking the podium. For those who do not know Agnes, she's a high-level advocate for food security, nutrition, food sovereignty, and the right to food. And she's currently the Chief Executive Officer, or the manager, one would say, for the Food Rights Alliance, a major non-governmental civil society organization. The second panelist is Madame Joan Vyaruhanga. Madame Joan, if you're there, kindly join the podium. Joan is replacing Grace Bwenje tactfully. So Joan comes from the Ministry of Water and Environment because we had omitted really that core sector, yet is key in ensuring that we deliver on issues to do with water, not only for production, but also for nutrition. So, Madame Joan, you're welcome. You can take the seat. The next, we have someone from UNICEF, Renee. Renee, we are told, is online. Zach has yielded the floor. We had initially thought Zach would be there, but now we have Renee from UNICEF who will be joining us. I hope he's online. Mary is confirming. Okay, we're online. So Renee, when our time comes, we shall come to you. For now, ladies and gentlemen, we have these two ladies. Maybe let me bring a gentleman so that we balance the boat. And Dr. Chikomeko from academia can also come and join us here, since he's the son Arin president. He can easily be hijacked because also he represents our distinguished colleagues from academia, so that we balance the boat somehow. And apologies, Dr. Kato, for hijacking you thus far. So, and as indicated, Dr. Chikomeko Kato Peterson is a lecturer at Chambergo University in the Department of Nutritional Science and Dietetics, but he's also currently the president of the Uganda Civil Society Academia and Research Network. So we are really grateful. San Arin, scaling up of nutrition academia and research network, while Chirabo here also leads from the civil society side. So these are distinguished colleagues who have been in this field for quite a while. We shall start with, of course, Madam Agnes Chirabo. And Madam Agnes Chirabo, as you rightly know, and we rightly have seen you on very many occasions, a lot of perspectives have come in terms of financing for nutrition. And you have on several occasions participated in most of these advocacy activities. But in your view, what have been the trends in budget allocation for nutrition? And do you feel really they meet the desired standards? Or how do you rate our current performance in terms of budget support for nutrition?
Thank you so much, Doctor. Just like one speaker earlier on said, it is very difficult to deny your teacher. So Doctor is my teacher. All the good that I do in this place is because, among others, is Dr. Peter Milton Rukundo. I need to declare, but the bad ones are the reasons why I did not score 100 in his papers. I failed on certain things. But thank you so much for these questions. And I also wish to recognize the current protocol. And going straight to the question, I think we need to congratulate ourselves as a country. Because if you compare where we were in the National Development Plan 3 and where we are in National Development Plan 4, I must say that we are recognizing progress. National Development Plan 3, and colleagues, if we are talking about financing, it moves along with planning. If you did not plan and you spend, it also becomes very difficult for you to report and to account. But we are seeing a progress now in the National Development Plan 3, and all of us in this room have to congratulate ourselves that now the government of Uganda is deliberate in the planning framework to align all efforts by state and non-state actors on the aspects of nutrition in terms of financing. Because we got independent strategic objectives in the National Development Plan. Under the Human Capital Development, Nutrition for All, and then Food Security for All under Agro-Industrialization Program. Earlier on, there was that question. I think it was a concern. Are we reporting? And if you don't report, you didn't do. So for us, we are excited that at least we got nutrition aligned within the development framework. And therefore, getting agreed interventions with indicators, and it is our prayer that the story moves up to the budget, the PBS, the program budget system, and then the reporting and the monitoring. So we are on good track compared to where we are coming from.
Okay.
And we have seen it going down to the local governments.
So Agnes, if you see the current progress, what could be the game changers in terms of where we should invest, but also bearing in mind the dwindling the financing from the multinationals? How are we poised to go forward?
I don't know if how I'm going to be understood if I make this statement. The question, money has never been in abundance. All the time we have been saying the resources are scarce. And surely they could be scarce. But the trends are telling us one thing. Are we really short of resources? Are we really short of resources in Uganda? All we are short of deliberate actions and prioritization and coherence and alignment. I still believe that there are some resources that we could still be put to proper use. And therefore, colleagues, we must get aligned. We must get aligned. We must get coordinated than competing. We must translate what we are talking about. Actually, as I was preparing coming to this panel, I reflected and I was like, if malnutrition was Jesus, he would actually articulate what is written in Matthew 15:8, that the people in this room are honoring me malnutrition by their lips, but their hearts and souls are very far away from me. So what we need to do is putting our resources where our hearts are. Take a center, Wallaba, that's a common street, I'm a street girl, a common street language. Put your money where your hearts are. Can we agree to work together than to compete? Can we align? Can we agree to be coordinated? Can we subscribe to a common plan? Can we see that all what we are doing is aligned at that plan at local governments? Can the center hold? Can we stop depositing reports that look the way they choose to look like in the community development officer's office, but rather work with the planners at local government, but also at national level, both development and government. Break the silos to start with of the mind. Then secondly, doctor, can we put in place, can we operationalize tools? We all know the amount of work that has been pushed to the parish development committees. But we all know the amount of money that government is pushing into the parish development model. Can we target that money?
Thank you,
That
Agnes.
it is invested on food and nutrition. So in that case, we are going to be leveraging on already existing resources. So if we break the mind sales, if we forget about the mandates, align with our plans, the little resources that are still available in Uganda can change the game, including the resources among the people themselves, the community structures. We should stop being givers and thinking that we are going to donate solutions. Those communities eat what they produce. They eat what they procure. And then finally, the systems approach. Food can no longer move as a food. It moves within the food system. It moves along with the health systems. It moves along with the market systems. So it is no longer business within the food system, but also what the market is doing, but also what health is doing. And therefore I'm hurt that we are here discussing nutrition financing and other colleagues at public health discussing health financing. What is health without nutrition and food? I submit.
Oh, okay. Thank you, Agnes. On that note, we are transitioning to government side. Ladies and gentlemen, we have Joan with us from Ministry of Water. And Joan, like you've heard, Agnes and other colleagues this morning, there is a belief that we have the resources, but the issue is the priorities. And also, from Ministry of Water, we have heard this morning, and Honorable Okwang made it very clear, that water is key for nutrition. So, from the government side and perspective, how do you see the financing, for example, for linking water to nutrition? Are we doing more, or what could we do better?
Yes, we are doing more, and we are prioritizing and allocating resources. We are also mainstreaming into infrastructure and service delivery. As the Ministry of Water, most of the resources that we are receiving are going into infrastructure, especially in construction of pipe water supply systems and also the valley dams that we are having in Karamoja. We are also targeting and having a phased implementation approach. The projects that we are implementing as a ministry are being phased. We are having a phase 1, 2, and 3, depending on the resources that we are receiving. So I think we are on track.
But Joan, some people are arguing that Uganda has a rich and abundant water resource, but irrigation and water usage for production is still quite low, I think at less than 2%. How do you see this? Is there a move towards strengthening, for example, water for production, and also the quarrels that have been existing? Are they now much resolved with the agriculture sector?
Yes, the quarrels have been resolved, and we are working closely with the Ministry of Agriculture. We have an irrigation policy in place, and we are implementing it, the both of us. And yes, the Ministry of Water is emphasizing that the irrigation sector is well financed and is strengthened. Yes.
What about the issues of sanitation, Joanne? Colleagues here will tell you that one of the drivers of malnutrition, especially in children, is poor wash. And I know we are doing some progress, but are there some current efforts perhaps to narrow the gap in terms of safe water access?
Yes, there are efforts, and I would like to inform this gathering that the Ministry of Water and Environment has developed the Ministry of Water Nutrition Mainstreaming Strategy. Under that strategy, the issues of sanitation are very critical, and it is this document is a guiding implementation document for all actors in the wash sector. And we believe that once we start implementation, we'll bridge those gaps. And we call upon all development partners to please come and support us, because we need to publicize and disseminate this policy. Sorry, this strategy that we have. Thank you.
Okay, thank you very much. We shall come back to that. Perhaps let me now go to our colleague of UNICEF, who's online. I hope our colleagues of IT are there. And the key question we had for the UNICEF colleague is, based on your experience, what proven models really should Uganda adopt? Of course, we have been hearing about innovative financing since morning, but perhaps from experience you'd give us a little bit more on how we can unpack this innovative financing and some of the models you feel and believe could be useful for Uganda. Maybe you may introduce yourself first for people to know you much better. Sorry, apologies for that. Volume. Do we have the volume, IT? It seems we are missing the volume. IT? Hold it on, Rowena, hold it on a bit. IT, can you confirm that we have some volume? We talk of system strengthening, and this is the real system strengthening test that we have now. To have our colleague online be able to share with us. IST, I'm waiting for your hands up, and we proceed. As IT tries to fix it, maybe let's go to Dr. Chikomeko as IT tries to get in touch with him to make sure we have this connection right. Dr. Chikomeko, you're coming from academia, and in this house, of course, the argument was made that we need to make the case for investing in nutrition. From where you sit, from the academia and the research network, are you convinced that we have all the evidence to convince finance, for example, on where we should prioritize investment, or do we need to do a little bit more? What could be those key entry points or angles for us in academia to focus on so as to enhance financing for nutrition?
Thank you so much, MC. I want to stand on all the existing protocol. You indeed raise a very pertinent question. Do we have the evidence, or what is it that we need to do? I think from my viewpoint, from the academia, the partners, and all the organizations that are here present, we have done so much research. We have done so much research. We have the research. But the main issue is, how is that research kind of packaged to interest the colleagues in finance so that they can allocate resources? So I think we have quite a big gap in the packaging. And because we fail to package properly, probably the colleagues in finance might find it more interesting to put funds maybe into security, into infrastructure. Because us in nutrition, we've not packaged, we don't have a good investment case for nutrition in Uganda, which really shows that if we do not invest and provide finances for nutrition, we are losing this much. So the gap is more into the packaging, but we have some evidence. We have FSNAs done, we have demographic surveys done, we have panel surveys, that information, but how do we package it? Can we come up with maybe a nutrition investment case for nutrition for the country, okay? But still, when it comes to the areas of implementation at the districts, could we, even at district level, maybe have some nutrition profiles for the district, so that maybe even the districts from that area, because they also have finance departments, they can see how they can allocate. Okay. Because based on the profile, they have something to begin with. Yeah, Dr. Kato, you know, there's this famous saying in Africa that if you want to deny an African knowledge, you put it in a book, or you publish it. So perhaps, is it the channels of our communication? Are we engaging? Are we having these opportunities to engage these sectors? Or are we sharing in international journals where the local Ugandans may not have access? So could there be perhaps some local solutions, or what could we do better to make sure people like Commissioner Joseph routinely access the information that we publish? Yes, thank you. Actually, I'm happy that we have the development partners under the leadership of UNICEF. And as a country, we have now the NIPIN. NIPIN, okay. The NIPIN is one, I think, a government approach where they want us to have the information there so that all colleagues can easily have access to that nutrition information. So the NIPIN is one platform for sharing. Of course, I know when you publish in journals, it could be complicated, it could be more academic, but the NIPIN could be simplified. But also the avenues like this, where we have such avenues. And I'm happy to note that this year we are coming back to the nutrition financing. It was last held the other year. But could we maybe have these more frequently? Could we have dedicated kind of policy engagements that are quite deliberate? But also in the arena that now we have the NDP4. And as our chief guest was saying, we are into the first year of implementation. But I'm also thinking, since all sectors have a role to contribute in the NDP4, could we take a sidebar and understand maybe at sector level what are their priorities for nutrition? Okay? That can be packaged, and maybe we develop policy briefs or evidence briefs so that the colleagues in finance and other sectors could take up from there. Thank you, Dr. Kato. I'm wondering whether the colleague from UNICEF is now on. I have not seen a signal from IT. But as we confirm, I don't know, are you there?
Can you hear me now?
Oh, we can hear you very well. So
Perfect.
Take it on from there. What innovative financing options would you guide us on as a country, given your experience? And also, generally, how do you see it in the context of Africa? Could there be barriers that we need to really overcome? Over to you.
Thank you, Doctor, and warm greetings to distinguished guests. Just to quickly introduce myself, I am Dr. Rene Gerard Galera, one of the nutrition specialists focusing on financing for scale from the global practice of child nutrition and development, but based in Bangkok. So I'm really glad to virtually join a room full of nutrition finance champions. So to answer your question about proven financing models, in my experience, I would like to maybe draw from the learnings of Indonesia as an example, where they were able to understand, using one of the main tools within public finance management, which is the public expenditure review, how their expenditures are, what their major cost centers were for nutrition. And with that, they were able to understand the degree of alignment with their national priorities and their budgets and their expenditures. And thus also they gained that ability to repurpose funds based on their priorities, similar to how now they are able to access and procure RUTF through the match window of CNF, and I will talk about this later. And I understand that Uganda is also doing the same in accessing the match window and essentially doubling the amount of supplies within the same cost. So just to unpack briefly what CNF is, or the Child Nutrition Fund, it is a UNICEF-led financing mechanism designed to accelerate really the early prevention, detection, and treatment of undernutrition by bringing together multiple actors. And I'm glad that you're hearing from the keynote addresses and speeches that there's recognition that nutrition is a multi-sectoral challenge. And by bringing together multiple actors, national governments, donors, international financing mechanisms, even philanthropists, we are able to actually highlight this as a concrete example of innovative financing and show how such an approach of catalytic financing can actually help address persistent gaps in nutrition financing while also strengthening governance and also national ownership. Doctor, you also mentioned some barriers, and I quite alluded it also in my examples for Indonesia. It was really more on the generally we did a lot of analysis from Asia Pacific where we've done landscape of public finance for nutrition, and the main barriers we identified included uncosted plans, the lack of financing strategy, and also similar to what we found in Indonesia, an unalignment of budgets and priorities, and the unalignment of plans and budgets. So if we don't have that visibility, we will really continue to face these challenges. So we really have to make sure that coordination and also use of evidence to as a feedback loop to make sure that our programs are responsive. Thank you. Over. Yes, correct. So yes, and you asked me how difficult it is. It is difficult, and that's something we have to recognize. It has to be an intentional action across all sectors. And just to also highlight that these different financing tools are just tools, but the starting point will always be our priorities and our plans. So we have to make sure that within our strategic plans and there's really an understanding of the costs, what we need to implement it, and also the gaps. And this will then how will be able to help us determine how to fund these using the various financing models that you have mentioned. Over. Mm. That's a very real problem, and given the circumstances now, I think there's talk that it might just worsen. So we've really seen that over the past decade, official development assistance specifically to nutrition has only increased marginally and has not kept pace with financing needs. I think within maybe 2015, there was really funding that increased, but when we look at annual increases, it only averaged around 0.4%. And the most funding directed was actually on humanitarian response and also treatment. And the direction that we want to go for is really focusing on domestic investments. But unfortunately, with the World Bank estimates, we also see that currently, given the focus and the attention to nutrition, domestic levels of investment are not projected to catch up with nutrition financing needs. That's why I'm really happy to have this such forum to raise the awareness and raise the flag for nutrition, because we really are encountering such challenges for maternal and child nutrition. And just by doing and coming together, we can, just find solutions together. So given these global circumstances, let's look inwardly, because there will be resources within us. It's now just a matter of identifying the priorities and making sure that we are efficiently and effectively using these resources. Thank you.
Efficiency and effectiveness and frugality in resource allocation. Dr. Rene, keep hanging in there. We shall come back to you, colleagues. Now we are trying to open the discussion before we come back to the panelists to wind up. And we are urging that if you have any question for our panelists, we can raise it, but also asking you to give us some possible solutions to this dilemma of increasing nutrition financing. So we are going to take some comments from the House. Honorable Agnes is there. We're going to count 5 hands first. Then my friend there. Yes, Martha, 2. Magezi Sylvia is 3. We have 4 there. Cascade. The 5th hand, people are still... should we take 4 for now? 5th hand? Okay, 4 for now. Okay, the microphone, please, Peter. Someone there to help us bring the microphone to... okay, it's here. To Honorable Agnes. Flavia, sorry, Honorable Flavia Kawahenda. Sorry, Akik, for messing up your name. That's really terrible in Africa. Yes, Honorable, thank you.
Thank you very much. I would like to appreciate all the presentations this morning and our very well articulated panel. And for me, I don't want to ask questions. I have always asked. But today, I think I just want to suggest a few solutions.
Yes.
Because nutrition investment is first and foremost a political process. So we need that political commitment. But if we need the political commitment, we need a whole of society, not a whole of government only.
Oh, yes.
A whole of society approach. The first one I would like to suggest is harnessing the traditional and homegrown nutrition interventions. Because we know from since we were not born, the people traditionally had their ways of really connecting to food and nutrition. They really respected food, not the way we do. Because for us, we can even afford to sell food on the ground, in the sand, and everywhere, and even eat it when we find it on the sand. But from originally, there was food autonomy in the households, and we need, I think, to go back and get those interventions as they were done traditionally, so that everybody is on board, not only sectors, but a whole of society. And by this, I also call upon the cultural institutions. I'm glad we have a reverend. We want the religious leaders to take this food as a real matter of very, very, very strong importance on all their communities. Number 2, food banks at national, subnational, and regional level. During COVID-19 is when we realized that actually the government can beg for food from their populace. This was embarrassing. I think we need to make food banks real, intentional, and we invest in having food banks so that we can even promote it at subnational levels up to the households. And 3, I would like to propose that the Disaster Risk Management Fund, as stipulated in the Constitution of the Republic of Uganda, be realized, because disaster and risk management, especially with climate action, need that we have strong and intentional support, not fire brigading that now Bududa has broken, and now we have to run there when people are losing farms, people are losing gardens, people are losing food. And so we need to be intentional in the Disaster Risk Management Fund so that we don't touch on sectors as a fire brigade whenever we get these disasters that we are very aware of, that they will happen almost every time. Even COP28 requires us to embed climate action into the food and nutrition systems. And I think the other one is data. I think the academic person talked about data. We need data that is realistic, utilizable, reliable, of course, well packaged for evidence-based advocacy on nutrition. And I would like to say that the food and nutrition bill from the private members' side was frustrated by the Ministry of Finance when they refused to give us the certificate of financial implication. And so we are frustrated by that, and we hope it's not a frustration forever, because we were trying to wake up a government that had slept on the matter. So when we come up with a private members bill, it's not because we are in opposition, but we are waking up sleeping giants. So we needed this earlier. Finally, allow me finally to say,
yes, Honorable,
a nutritionist at every health center 3 is mandatory. And I thought Minister of Health would tell us about this. And also, of course, district nutrition committees be functional, because I'm sure they are not financed.
Thank you so much, Honorable Kabahenda, really, for unpacking those matters. The political side of it, whole of society, that's a new lesson for us. Harnessing the tradition and historical values around nutrition, the cultural institution involvement, the food banks at all levels. Someone will answer the food banks. Agnes hopefully will tell us, or someone from MAIF. I was trying to shield finance, because finance has many issues from Kabahenda's side in terms of the contingency planning, disaster risk fund, commission, COP28, that's for water, COP28, how are climate actions being mainstreamed. Then the human resource Ministry of Health, Prospero, will have answers for us at some moment. So let's go to the number 2 question. There was, I think, a lady at the back, my sister there. Yes, Nagawa Margaret. You can introduce yourself. People may not know you. And if you came late, it will be much better for us to know. Yes.
Thank you very much. My name is Margaret Naga. I'm the Health and Nutrition Coordinator for Action Against Hunger.
Thank you.
Yeah, thank you very much for your insights. And I really stand with you in regard to accountability and tracking for the NDP4. I think most times as stakeholders, we come into meetings, we come into workshops, we prioritize interventions, but when it comes to follow-up and accountability, we stay silent. So maybe that's a call to us to really invest in the accountability and tracking. So my question would go to the Ministry of Water and Environment.
Yes.
And I think the...
And there are other ministries here, so feel free. Yes.
And I think the Honorable talked about it from Karenga in regard to the inequalities or the iniquities that are happening in our country, especially for a region like Karamoja that has a high malnutrition prevalence. For example, Moroto at as high as 20%. And what is the plan for the Ministry of Water in regard to prioritizing areas like Karamoja that currently, as of now, we have gender issues arising because of WASH, water hygiene and sanitation. There's no access to water, which is resulting into high malnutrition rates. Do we have a strategy specifically for Karamoja to see that this is improved? Because it's over 20 years now and we're crying about the same challenges. Yeah.
Thank you so much, Nagawa Margaret. Nagawa Margaret is calling for accountability. What are we doing? We should have had auditors here. OPM was here. Finance maybe will say something. But inequalities in access to wash. You know what Nagawa is saying is that if Karamoja has no water, we should have a bigger budget for water going to Karamoja. Is that happening? That's what Nagawa is asking. Or when shall we really solve the crisis of Karamoja in terms of water? Okay, that was Nagawa. We are moving very well, members. The third is our friend. She'll introduce herself, and you know her better.
My name is Sylvia Magezi, and I work for Harvest Plus as the country manager. Maybe building from what Nagawa has just said, we've had a rosy picture of the many things that are being done. Water said it was okay. Finance gave us different models that are being worked on. So I think our focus should come to the gaps, implementation and capacity gaps that are keeping us behind. Because when we walk into the villages, we see all these gaps. Yet there are these rosy pictures that are above there. So why aren't we, coordinated, like Agnes was saying, or aligned? What are those issues? Because if we don't address those issues, we will remain with these nice policies and nothing on the ground.
Thank you so much, Sylvia Magezi, another distinguished colleague in the fight against malnutrition. And she's saying, why are we not talking about the gaps? So these people here at the high table, we need to tell people what are the gaps. Be frank and open to the gaps. The fourth was another lady somewhere. Who was it? Was it this side? It was the lady from Cascade, yes. Then we shall have our brother from Fian coming. Yes, this Chenjojo. The voice of Chenjojo. Yes, please.
Okay, thank you, colleagues.
Again, you introduce yourself. People may not know you here for the sake of knowing you.
Okay. My name is Nyabtono Medias, implementing in partnership with Kaya de Cascade project in Toro region. Yes, Cascade. I'm beginning with the keynotes we had. There were many, and they had good interventions and presentations. There were just some keywords I was noting from the presentation of Kabanyoro, the director, action against the hunger.
Yes.
She just had one beautiful quote that can we get out of this,
the boardroom.
Yeah, of the board. We go out of the walls, the indoors. We go to the ground and see what is exactly there.
Ground, that's word of ground.
Not just meaning here, even wherever we are. Let us get out of our offices. We go down to the community. And she had a reason for this. I'm going to make my additions. Additionally, the director, World Vision, Jeremiah, added it's enough to know actions of malnutrition. We have had many interventions, but no actions to malnutrition. It's enough. And at the end of the day, as we are here, we should go out and make our actions practical. He had scenarios where I'm going to also add.
Briefly, medias, of
course.
course.
Yes, briefly. Briefly, I will add a brief scenario. As we also implement, I happened to visit a school at lunchtime. Where I found 4 categories of students. Those taking lunch, their parents because have paid in something. Those who don't completely take anything. Those who manage to pack something from home. And then there is this other worrying category whereby parents will only give them what to eat when it is harvest time. Say they are harvesting maize or beans, they say, okay, you can take 10 kilograms of maize and 5 of beans, then they count how long you will take to have this. So when the season is done, no more eating. Those are the situations. And this came to my mind was like, if you reach there and see the scenario, surely, what is the health of these children?
So what should we do,
And now,
medias?
yes, I'm driving there. Yeah. Of course, like we are having the school feeding nutrition policy being developed.
Huh?
And in this meeting, I thought we could have an update on it.
Or a
And-
member
and-
from the
and
Ministry of
I mean,
Education.
Actually,
Yeah.
even we have many parliamentarians here. One of them can give us the update on this and the resilience on this action. Then, basing on what the director Fura has said, we should leave out competition, we coordinate. Yes. Finally,
Yes.
basing on that, there is this program which was under World Bank, where I also visited a primary school, and I found out that they had planted the fruit trees, and children were really feeding on them. Then this is a call to everyone here, because we have seen that nutrition is a multi-sector. Since we are not in a competition, can we always research and see if I'm a partner, where should I begin, where have others reached, and I begin there, than facilitating the same activity sensitization, but now the World Bank had reached that step, what can we add on to achieve the resilience and the strengthening the financing, looking at the scarce resources we are having. Finally,
oh yes, okay.
Finally,
this
is final.
Yes.
The guest of Anna talked about sensitive and specific
interventions.
Interventions. And there is that allocation that has been made. Then my call is, let us look at the sensitive, because when it comes to sensitive, it's where we have the prevention.
Yes.
Then looking at cure. And for us, in our implementation, actually when we are doing scorecard, there are many sensitive interventions we have seen, which are supposed to be handled by government, and they have not been. I actually, it would be my call that I'm happy that he has said that let's be practical, because down there in the community, many communities don't have extension workers.
Okay, extension.
There's only one health worker, only one agricultural officer, and the rest and on. Of course, there are many things I had, but
thank you, Midias.
In respect of time.
Yes, Midias, thank you.
This is my submission.
Members, we applaud Midias all the way from Chenjojo. She has raised many questions, many issues. School feeding is missing in this debate. Where is the school feeding debate here in this financing? She has raised the issue that the policy is going on. Indeed, I was supposed to be also in Entebbe. They are editing it to go to cabinet. So they are working on it, but it is late, it's delayed. She talks of duplication. How do we stop this duplication? That people come, they implement, others also are competing with them. So how do we make sure we align? So the coordination, now the role of the cow. There's a cow here in the house. We are going to ask the cow, how are we solving duplication? As other colleagues also address, especially on the government side. And nutrition sensitive specific, how can we invest 50% of UNAP funding in the specific, and then the 50% in the sensitive and the enabling environment? But media is saying it should have been the other way around. We should have had more money in the sensitive. So Ministry of Health, OPM, I don't know whether it is here. I'm tempted not to think finance, but hopefully finance, I don't know whether they'll say something. Then she challenges us on human resource. We are talking about multi-sector. What about the issue of the extension workers, the nutritionists? Are they really doing more? That they were saying we need to have nutrition extension workers also. Is the nutritionist enough? But also we were raising a question the other day that which officer is in charge of food safety at the district? Who's responsible for food safety at the market to make sure safe food is going to the market? No one is there. They told us production, for him is to produce. The veterinary, no commercial officer, do they have the capacity? So all these are issues Medias has brought up. The fifth one, then we go back. I don't know whether I shall have another round, but the fifth one from Fian. You can introduce yourself also.
Thank you very much, Doctor. I am Shafiq Kajim. I work with Fian Uganda. I just wanted to speak more about coherency and alignment, as discussed by Madame Chirabo, giving an experience that as we are discussing nutrition, and also the Ministry of Agriculture reviewing the policy that looks at ensuring food security, food and nutrition security. In that same ministry, that is the Ministry of Agriculture, Animal Industry and Fisheries, we are receiving directives that are stopping the fishing of silverfish mukene, which we really know that it is the least source of nutrients that even a layman can have. So as we move forward, I would like to give a recommendation that I think as we look at nutrition, we need to run away from, we need to go beyond from the fragmented investment and donor reliance, and at least have a human rights-based approach, which also the NDP4 speaks about. So I think in that line, we shall be able to move in the right direction.
Thank you so much, Bwana Kajimu. Very core issues, coherence, alignment, and coordinated troop movements, the human rights-based approach as a solution. Colleagues, I wanted to give the government guys to respond who are here, but before that, there's Moroto. That principal can't be left out. The principal nutritionist, Moroto Regional Referral Hospital. Yes, sir, Simon.
Thank you very much.
You can introduce yourself better, because I may have missed some things, I don't know. I could have underestimated your potential.
Not really.
Yes, sir.
As a former lecturer, I don't think you missed it out. My name is Simon Ondoga. I work as a principal nutritionist for Karamoja sub-region.
Yes.
Before I put up my proposals, I would like to introduce my elder who has just joined us. Simon,
yes.
you're welcome.
Okay. Yeah, sit at the mic.
Thank you, Simon. Thank you.
Yes.
Good afternoon, everyone.
Good afternoon, sir.
I went to a wrong meeting. I was there by 8 o'clock, but I sat in a wrong meeting.
Oh, so sorry, Honorable.
Yeah, but never too late. Simon, thank you. I'm Nangiro Simon Peter. I chair the Karamoja Elders Association.
Okay.
Thank you.
Thank you so much, Simon Peter, my namesake. We apologize on behalf of the organizers that we didn't guide you well, but nonetheless, it's never too late, and we really highly welcome you to this discussion. Yes, Bwana Ondonga, you're continuing.
Yes, I have the following proposals. One, Bwana MC, I would like to ask you, do you have the action points put down for this meeting? If so, are they actionable really? Because year in, year out, we shall be coming to very flamboyant hotels only to talk about nutrition and nothing is implemented.
Okay.
Number two, as the other colleagues have alluded to, water for production is very, very paramount for Karamoja region. If you want the state of food insecurity and acute malnutrition to improve. Then nationally, I will advocate for, it has been long overdue. The nutrition at the Ministry of Health is a division. We need it to move from a division to a department.
Okay.
Once it goes to a department, definitely the
More
human
money.
resource and the wage will increase.
Okay.
And that will enable also employment of more nutritionists at all levels.
Okay.
Most of the nutrition budget is supported by partners. Thank you, partners. At the beginning of this meeting, I thought there will be a move to include nutrition on the annual budget for the government of Uganda, so that we see nutrition like other thematic areas like HIV, like health, where it is budgeted for. Will this one happen, or it will call for another dialogue?
Okay, okay.
Lastly,
yes, sir.
We needed, if there's a support from a partner to any entity, a government entity, through IFMIS, this should really come earlier when the government is planning and budgeting for other areas. When it is late, if the IPFs come late, it will definitely go as a supplementary budget, which delays activities, hence the performance is affected. Over to you.
Thank you so much, Simon. Really very instructive indeed, colleagues. Simon Odonga, head of nutrition in Karamoja, if we were to use that. Yes, we are rapporteuring. Yes, we are taking it back. We are rapporteuring indeed, Simon. So we are capturing the event. Even there is a live streaming and the recording. Whatever you have said is on record. So indeed, we are documenting. WASH is key. The lady will talk to it. What have we done for Karamoja? The division is another one. Human resource. I think we have commissioner from ministry here. The budget fragmentation and etc. Finance will tell us whether we can have a budget line for nutrition. I'm sure he'll give us answers. IFMIS, I'm also on the IFMIS. As a dean, I do click. And there's where we take off project support. But Odonga, now for the next budget, we are late because the budget framework paper has been approved. I think our final stages. Finance will tell us whether there's still hope that we can say so much money has been received and we channel it for nutrition as part of project support. Oftentimes, this money, I think donors are not giving us the money to government directly, but I think finance will have a good answer for that. Colleagues, the interest of time, we have less time to go, so I was hoping we can have key responses for this round. Madame Prospero will respond. We have Office of the Prime Minister also will say something around the coordination. Finance has also come in. Finance has something to say. I don't know whether the guest of honor will want to add anything. Then the panelists. And if we have more time, we shall see, but I believe we shall be going for lunch. So, Prospero, there are many questions, but 1 minute each, because we are responding. We just have to respond strategically. We may not respond to everything, but what you have heard, the number of things, the ministry, the nutritionists, human resource, it goes beyond health. Maybe 1 minute, Prospero, over to you.
Okay. Thank you so much, Mr. Moderator. Good afternoon, everyone in the room. Prospero, Grace Ocheng. I hope I introduced myself effectively, but for those who have just come, you've seen my name on your invitation letters. So, I'm going to spend exactly 1 minute.
1 minute, yes.
Good, thank you. Nutrition division turning into a department. Mr. Ndoga, thank you so much. That is work in progress because we realize the need. This is long overdue. We're working on it. And in addition to nutrition being a department, I want to add this also to the cadres, the nutrition cadres, as well as extension workers. So as the Ministry of Health, we have what you are calling the equivalent of extension workers, and those are the CHUs, the community health workers and the VHTs. And we train them periodically on all matters, including nutrition. So they're on the ground. On food safety, who is the focal at the district? It's the district health inspector's office. That is his responsibility to do food safety. But as the Minister of Health, of course, with support from partners, Cascade, we are planning to go and train them more on the food safety. So it's not something that is not on the agenda. On the structure for the nutrition cadres, we have already submitted to public service, and at Health Center 2, we are planning to recruit a nutritionist with a certificate holder. At Health Center 3, we are planning to recruit those with a diploma.
Assistant.
And then Health Center 4 and District, of course, those ones will now be holders of bachelors in nutrition. But we also have regionals, like Ondoga here. He's a principal. He oversees the region of Karamoja. So all those structures are in place. And as far as I'm aware, the districts have been requested to ensure that in the next recruitment, they recruit these cadres into the system. Thank you so much.
Thank you, Prospero. We are going to go to Commissioner Joseph from Finance, and then we shall have Prime Minister's office say something. Then we come to the panel to wrap up. Sorry, Prospero, we had to make you carry the microphone. My sisters, okay, yes. Yes, Commissioner.
Well, thank you. I'll address myself just to two issues.
Yes, sir.
One, there is idea that the budget is fragmented.
Yes.
I actually think otherwise. You know, we've adopted a program-based approach to budgeting. You had the opportunity to frame your interventions in the PIAPs. We are financing the PIAPs. Yeah. So you need maybe to sit back as a program and rethink. If you are not happy with those PIAP actions, you actually get an engagement with NPA. The midterm review of the NDP4 is coming. Yeah. It's a good opportunity for you to revisit your PIAP actions if they are not very good. Finance is very committed to program-based budgeting. So what comes through the PIAP exercise is what we are financing.
The IFMIS thing, how can we bring money to IFMIS? Like Odonga says, what we click for nutrition? Maybe project funding or what?
No. IFMIS is just a system. It responds to what you have planned for. That's really... IFMIS is not in that equation. Okay. But what I would like to say is that as part of delivering the 10-fold growth strategy, we identified the game changers. There are 5 things. Number 1, we said we want to clean up government. That includes regulation. So all you MDAs, you have a project. If you are a vote, there's a project called Institutional Development Project. Yes. That project is supposed to be used to equip you with systems to allow you deliver on your regulatory function. So whether it's the district health inspectors or people who are approving, buildings and the environment, all these things which are affecting WASH. We are saying that the laws are there, the regulations are there. It is about time that you enforce. And that's the provision we have made. So we are going to be monitoring the resources on that project versus your regulatory reach and coverage. And depending on how you perform, we will manage the resources accordingly. I think that's what I can answer.
Thank you.
And now, there's no more room. The budget is in Parliament, yes, unless you petition the members of Parliament here.
The BFP is approved already.
Yeah,
okay. But thanks, Commissioner. Really, we have to improve effectiveness, as you say. Let's go to OPM. The issue OPM is that they are saying money is there, but in different sectors. Money is in agriculture, money is in health, and they are saying there are programs. How easy is it to bring this money from all these programs to implement nutrition? How do we coordinate this big effort?
Thank you. The efforts have been there, only that they just need to be enhanced. I'm Judith Orishaba. I'm a senior policy analyst. I sit in the coordination department, also the Prime Minister, which is Secretariat for Nutrition. So I'll start as focal point as well. One, there was an issue of UNAP evaluation, which was raised at the time of keynote. We did a midterm review, the same way NDP3 was reviewed at midterm review. Of course, we realized we had not achieved so much, but there was some progress. and that evaluation and the nutrition assessment done by UBOS has informed UNAP 3. The other thing was, where is UNAP 3? UNAP 3 has fully been developed and approved at technical level. We had all the consultations, both private sector, society, and local governments that have given their input. It's at policy level approval, and the good news is that we have the approval meeting on 23rd of this month. Once it is approved at that level, it will be launched. We plan to launch it before we receive the new government because it has been developed in the old government. So that's the update. In terms of how we intend to, and that UNAP 3 has been aligned to NDP 4. So ideally what we are saying is, yes, we have very many interventions under different programs, almost 12 out of 18 programs. So we've picked interventions and actions along those programs and prioritized them to see what we want to focus on for nutrition purposes. And we've gone ahead and done its M&E framework that we're going to use to monitor it to see its progress. Those 2 documents are ready for approval. In terms of coordination, we coordinate nutrition at a national level and work with Ministry of Local Government to see that coordination at local government level is done. We've had in the previous UNAP 2 coordination and which we're going to benchmark on for UNAP 3, we've had to establish the scaling up nutrition networks, but they are not functional as such because of the financing bit. The 2 chairs of some of the Sun networks are the ones on the panel. Madam Karawo chairs the SunNet Civil Society, and Dr. Peter chairs the Academia Network. We have business, and then we have Development Partners Group, which is chaired by UNICEF, and they are here. So we are, ideally, like we've said, we are only to improve the systems to see that what we've put in our PIAPs and the little money that has been there, plus partner support, we implement, like Commissioner of Finance said, intentional implementation and being accountable as people who are doing the services. In line with UNAP 3, we've been hearing people talk about food systems, because we were advised by Planning Authority that yes, nutrition is an outcome of food systems, but we again need to have a clear transformation targeting plan to see how do we transform food systems, so that at the end of that day, the nutrition is transformed. At the same time, the office has coordinated development of the transformation plan. We have food systems transformation in very many programs, but we've picked out major game changers, and these were informed by the analysis which was done in 2025, which informed the game changers that we need to have. And by good luck, they were captured in NDP 4. So we are simply picking them out to have a targeted financing strategy, which we are calling an action plan for food systems. So these 2 plans, we hope that they are going to be out by May. And once they are done, it is to say, okay, this is what we need to do, and then we do it. They're going to be well costed based on available resources of government, because that is our number 1 resource that we can benchmark on, and then partners will come in and align their budgets to what government has already been put. Because normally you say, what is your commitment as government? Then we put in. So this plan has been costed based on government resources. So once it's out, then partners can say, this is where we are aligning, and this is the amount of money we have.
Thank you.
And I think that is all.
Thank you. Thank you so much, Madam Judith Orishaba. Ladies and gentlemen, lunch is ready, is what I've been told. So the 5 key issues, we're going to give each one 30 seconds to wrap up so that we can go for lunch. But clearly, from the foregoing debate, school feeding financing hasn't come out. Our friend from from Chenjojo brought it up. The issue of climate change, I think the Honorable Kawahenda, how do we integrate it? So person from water will tell us. Food reserves have emerged, the reserve systems, and what are we doing? Of course, contingency funding. Commissioner Joseph didn't have enough time to talk about it. Domestic financing is also emerging. How do we ensure that the little money we have in the various programs, we utilize it efficiently and effectively? System strengthening seems to be an underlying common word. We need to strengthen systems here and there. and also the issues to do with evidence and accountability. So, panelists, half a minute or a minute each. You are standing in between the lunch. We shall move straight from Dr. Kato to the last. I will not say a word until you finalize. Over to you.
Thank you so much, MC and all members. For me, just as a way of summing up from all the discussions that we see, one, from the academia, we are saying that the need for data is always evolving. The need for data and evidence is evolving. Although we have something present, we shall continuously need more data as things change. And I'm also seeing that probably we are talking about underfunding, but it could be that we are also under-quantifying the nutrition problems. Maybe we are under-quantifying them, so
the evidence is lacking.
Maybe it's lacking. We're under-quantifying those in policy and finance. Look at it as not a big problem. Academia and the like, we need to support all the teams to quantify nutrition better. But also, probably evidence is not arriving in a finance-ready format. The nutrition evidence that we are coming up with, maybe it's not in the finance-ready format. That's why I previously said we need to package it better so that those into financing can easily take it. Under Cascade project, Chambogo University did something to look at how MDAs are complying under the UNAP. And what we found at the district, things were not really so good.
Okay.
But maybe we also need to package that evidence so that it can be used. But also, I think we are seeing that nutrition financing needs to be targeted.
Targeted, okay.
Not uniform. If we have humanitarian situation, maybe they need more financing. But at government level, we don't know, Minister of Finance, are we doing targeted financing, or we have a ceiling and you're saying let us budget within that ceiling?
Program-based.
So we need maybe, instead of program-based, it needs to be needs-based.
Okay.
Somehow, that is my view.
Okay.
Because different areas have different needs. So you may not provide the same financing ceiling. And as part of academia, we are ready to support in the area of evidence generation. And at this point, MC, allow me to tell the members to thank the OPM and Minister of Education.
Okay.
They formed the Sun Academia Network, and at this level, we've developed our strategy for 2026, 2030. With the finance from partners, we are looking forward to launch that strategy, and we go into full gear. And as we go into full gear, the key areas are research, innovations, and training in nutrition.
Thank you, Dr. Chikomeko. Yes, my sister Chirabo.
Well, thank you so much, delegates of this dialogue. Mr. Commissioner Joseph, I said that these reps here speak with a lot of honor to malnutrition, but our actions are very far away from what we are talking about. I invite you delegates, if you have not received, please receive an analysis of the budget framework paper for the financial year 2026-2027 that we did as civil society. And you see how priorities...
This is the document that she's talking about.
That we agreed upon, and they are in the PIAPs, end up with a financing gap of 85%. She talked about water. For irrigation, it's a priority action. Funding gap, 85%. You talk about human resource, the nutrition cadres, and then they say recruitment is going to be by replacement. But for nutrition, we are not replacing anything because they've not been there. 85%. And the story goes on and on, concluded in Matthew 15, verse 8. The lips are saying the actions are very far from that. To Dr. My brother, the principal nutritionist, and to stakeholders here, I think we have had game-changing actions and solutions that we have tested. He has said, can we be supported prior? And I'm here to inform you that through the Cascade program, we have developed a handbook with their support from the National Planning Authority to support the local governments and people like the principal nutritionist, prior to the financial year. So what we are asking for is a support to scale up.
Okay.
These are the things that are going to translate our LEAP desires into action. We developed a handbook for mainstreaming nutrition in the parish development model. I'm very selfish when it comes to those trillions that are going to the parish development model. With the support from Ministry of Local Government, we need to scale up, go down and support the implementers with these tools such that by the time he issues his budget call circulars and the indicative planning figures, these people are equipped to use these tools. And finally,
yes,
we are not going to go to heaven.
We
are not going to go to heaven because we are not accountable.
Okay.
We need accountability mechanisms at all levels to make every single shilling that has dropped in the names of improving nutrition be put to prudent use. So we need to institutionalize those accountability mechanisms. Otherwise, if business continues like this, we should forget about going to heaven. But I'm here to say, yes, it is possible and it is immoral that we sit in a country of plenty of knowledge, plenty of expertise, plenty of solutions, plenty of food, and we are talking about malnutrition. Then we are speaking about injustices, inequality, and immorality. Yes, it is possible.
Thank you so much. They are telling me the food is getting cold. Agnes has warned we are going to hell, so we should be so worried. But now over to you, Water. People are telling me the food is cold, but there are issues of COP actions going into the mainstream programs of NDP and ETC, and how generally we have to improve. In 30 seconds, over to you.
Thank you, Doctor. I want to respond to a few questions that came in. Someone has talked about Karamoja being unfunded in terms of WASH.
And equity, the need for equity.
The need for equity. In the beginning, I talked about prioritization of the little resources that we are receiving, and we are also having a targeted implementation approach. What do I mean? We targeted Karamoja specifically because of the high need of the population there for WASH services, that is water and sanitation. The Ministry of Water has of recent established the concentrated units within the Karamoja region. And these are units like water for production. We have a unit called the Water and Sanitation Development Facility Karamoja. We have the umbrella of Karamoja. These are responsible for provision of water supply and sanitation and water for irrigation and for animals in the Karamoja region. Currently, they sit in Moroto. So that office is well funded under our strategic plan and the PEPs. Actually, that region has the biggest share amongst all the other regional offices. There are 7 of them throughout the country.
Okay.
But the Karamoja receives more.
Okay. Finally.
Duplication. The Ministry of Water is coordinating its actors, civil society actors well through our USNet organization, the Water and Sanitation Network. And I think we don't have that issue of duplication because all the plans and all their plans are coming in our strategic plans. Okay. And yeah, we are good to go.
Thank you so much, John. Ladies and gentlemen, applause to our panelists of today. And as they go back, ladies and gentlemen, we appreciate their contribution. We can keep applauding them. We had Dr. Chikomeko Peterson from Chambogo. We also had Agnes Chirabo, Executive Director of Food Rights Alliance. And we had Madam Joan Verhanga from the Ministry of Water and Environment. And they're taking a group photo, as you can see. And ladies and gentlemen, the meeting now is being adjourned for lunch. And we pray that the Almighty God will really grant us good nutritional outcomes out of it. But also, we pray that those who are not able to have food will be able to get food, since we are really planning for them and not for those who have. So, ladies and gentlemen, and no food should go to waste. The meeting is therefore adjourned up to 2:20 p.m. And lunch coupons have been provided. Accordingly, I think my brother will guide us. The coupons, we are in a tent, but I think there's a lunch place around here. Peter, the lunch side, you'll guide people? Okay. Ladies and gentlemen, meeting adjourned. Welcome to lunch, and consume sustainably, as has been said, but also think about those who don't have food and who are starving. Thank you very much. May Almighty God bless you as you go and have that lunch, and may we come back together at 2:20 p.m. or thereabout to conclude the dialogue. Thank you very much. Commodities. Yes, so ladies and gentlemen, the afternoon session is more interactive. We only have two core engagements, if you see on your agenda, and really most of the issues have emerged, but what we are going into this afternoon is more to have concrete actions that we can agree to. And with your indulgence, we are planning breakout sessions. So we have about 2 rooms or 3 rooms which are going to be used. My brother Peter from ACF should be somewhere. Yes, Peter. Yes, so we organize for us the rooms. We are going to agree. And the strategy is that we have 3 key sessions. This room will retain 1 group or 2, and the other groups, Peter will show us where to go. But the idea was, yes, the 3 groups. The idea was that 1, we shall have a core group on strengthening coordination and governance for nutrition. Clearly, you have seen from the debate the need for governance and coordination. So we are really hoping that in this group, chaired by the Office of the Prime Minister, serious discussions will be held on how we can strengthen coherence, coordination, and financing in a coordinated manner. And of course, key here, as has been alluded to before, is how do we ensure that the different amounts or millions of shillings supporting nutrition in different program areas are coordinated and somehow effectively utilized. So that will be led by Office of the Prime Minister. We were worried of whether we should push people into groups by force, but we said no, let's be a bit open-minded. But definitely, if there's someone from planning, if there's someone from, we shall see, cow maybe, they could also find their way in such a group, but we encourage members to join the group of their choice or of their work stream. If you're into coordination, if you're into governance of nutrition, this would be a good group for you. The second group is the group on taxation and policy measures for improved nutrition. Again, this we are hoping will be led by colleagues who are working on finance and etc. And in this group, we want to really unpack some of the existing innovative financing areas. For example, taxation. For members who may not be aware, there are some incentives around nutrition-related products. In particular, for example, if you're importing machinery for value addition, for example, they are tax exempt. If you're into agro-processing, there are some taxes that you may be exempt on. People who are doing premix fortification, I think there are also some exemptions there, but still there's some taxation on water and other commodities. So you can begin to explore, are there physical measures? Where can we get more money for nutrition in terms of tax? Or should we tax some commodities more? For example, in some countries there is sugar tax, fat tax, and etc. So we shall try to hear measures. Guidance from the organizing team, so colleagues kindly bear with us. What I gather is that we are going to, before we break out a bit, we shall have a brief remark from the OPM, which I'll allude to shortly. So colleagues, the third group that shall break out will be on exploring innovative financing approaches. Somebody said this could be the mother group, but in particular, this group will be looking out for what options or approaches should we utilize. For example, we had crowdfunding, we had climate-based funding, but also we had public-private partnerships and all these other areas. And that group will be, I think, I don't know that there has been a change led by Professor Chileo Kaya. That's group 2, policy, yes. So innovative financing, I think there is another colleague who has been allocated that, a group, and we shall see how to manage. So the agreement is that we shall break out into 3 different fronts or groups who will then gather after we are talked of 30, but we can say 40 minutes. And then we have a plenary session. But since the Office of the Prime Minister is supposed to give remarks at the end, and they may leave for another meeting which is urgent, with your indulgence, we felt that we could bring forward some 5 minutes of your time so that we hear from the Office of the Prime Minister. There were also some specific questions which will be handled in the group, that we shall exempt her from that. But we just get the remark from the OPM and perhaps 1 or 2 feedbacks, and then we break out into the breakout sessions, such that we don't miss out that voice of the Office of the Prime Minister, an early closing, or we wait for Commissioner Ogembe later, but I believe that will be held in double, as we call it. But yes, we can consult. Thank you, colleagues. Apologies for that again. Always it's good to consult to solve these challenges. So, ladies and gentlemen, I think we're in agreement that we push forward a bit the Office of the Prime Minister remark, since we have said the group work is going to be short, such that at least they're able to blend in. And as and when we resume, we are told Commissioner Ogembe is about to arrive. So as soon as he arrives, we shall allow him to really make his official remark, which will also be our closing remark, depending on if and when he'll have time. So ladies and gentlemen, without wasting much time, once again I repeat, we are going into a breakout session where 3 groups are going to be working at the same time, simultaneously. One group is on strengthening coordination and governance for nutrition. My sister Kagoya Irene here, I think has some information for the group, so when they sit, we shall be able to distribute that. The first group we are agreeing of the Office of the Prime Minister, perhaps since they are very powerful, we leave them in this house. So coordination is going to remain here. So members of coordination group, those interested, we are not pushing people to join groups of their forced really transfer, but rather we want people to go into groups where they are comfortable. So the first group is strengthening coordination and governance for nutrition. It is staying in this room, and the chairperson is Madam Orishaba Judith there. So we shall put our chairs around her, and we manage the group from that high table with our elder from Karamoja as well. Then the second group, Madam Irene has guided that financing the group on policy, taxation and policy measures for improved nutrition. There was a rumor whether they should stay here or go to another room. We had 3 rooms. They will stay here. Okay? So Professor Kaya is going to chair that, and they will go to the last table there, the table at the end, to avoid the noise collusion and the interruptions. So group 2 on taxation and policy measures will be in the other corner. And then the last and most important also group is the one of innovative financing approaches. And I think our sister there, you're going to lead that group. It's Rona. Ronnie. Ronnie? Ronnie, are you here? Ronnie? Ronnie, very good. Yes, my brother Ronnie is going to lead this group, and he's going to take them to, I think, Forest. The room is called Forest. Peter is guiding that. It's near here. Forest is just across. So maybe by show of hands, let's see the people of innovative financing. Who are interested in innovative financing? Tax is different. There are 3 areas. It's a bit interesting. I like that discussion. Maybe some members are arguing these groups are a bit overlapping. Should we try to hear from them? Mike? No. Okay. There are questions which have been aligned. So the argument was taxation and policy measures. We are talking fiscal policy. If you have some economics, it's fiscal policy. But also you can have monetary policy there if need be. Measures. And that's also remaining here. While the one of innovating financing approaches is the one which will go with our brother to the Forest room across. So once again, innovating financing. Innovating financing. Can we see them stand up so that we see them moving with the chairperson? One. We had also my sister there. Innovative financing near Nagawa. She had put up the hand. Yes. Alupo, I see you there. CS Bag also is going to innovative financing. CS Bag. And who else is in money? Parliament, okay. Any of the parliamentarians will also join innovative financing. Colleagues, taxation measures and policy. Okay. My sister is here. Okay. Professor Kaya is going to occupy the other seat at the back, and you kindly join them there. Then I'm assuming the rest of the members are going for coordination, because I've not seen hands going up. So coordination, we are expecting many members to converge around this table. But when there are so many, we shall reduce some. So we shall count the first 10 members who come to coordination, and that will be it. The rest we shall take you somewhere else. So if you want coordination, begin gathering around this table so that the first 10 shall be sustained. And then the others shall definitely go to other groups. Then my brother is for group number 3, Forest. Kindly follow my brother. I see all people we have said financing will have CS Bag and ETC join those groups. In each group, we are going to have a chair who is already indicated. There's Orishawa Judith, Achileo Kaya, and our brother for group 2, who has also joined the Forest group. And then we have, for each group, we shall also have a rapporteur, I think, who's armed with a laptop. The rapporteur should give us a presentation. We are not going to use oral, but PowerPoint. So, taxation members, Professor Kaya is waiting for you there. Coordination. So now Irene Kagoya should begin telling me the rapporteurs. Who are they? The rapporteurs, kindly show up in the groups. You know yourself, and make sure we type the issues assigned to us, and the chair will present them on behalf of the group. Okay. So I will be moving around the groups to ensure that we are spending strictly 40 minutes. Because Commissioner Walugembe is about to arrive, And once he arrives, we shall be going into the final session, but it would be so nice he hears the outcomes of the groups before he can wind up with his final closing remarks. Okay, so now, colleagues, we have begun counting from now. It is exactly 3 o'clock. At 3:40, we shall resume, and I will warn you at 10 minutes to end of the time. Okay. Yes, ladies and gentlemen, sorry for the brief interruption. It's not to distract you, but to tell you that we have 10 more minutes to go. And the commissioner is already in the house, ready to give us remarks after the group work. we are saying we should just wrap up as members join us. The commissioner has limited time, but we are hoping that in a few minutes, 2-3 minutes of wrapping up, and really the rapporteur fixing the presentation, and we shall make a panel. So we shall invite everybody forward to make that submission. We are not so sure whether the commissioner has time, but we want to see whether we can squeeze 2 minutes. Then we have bigger presentations later. So 2 minutes of wind up. Yes, ladies and gentlemen, we are encouraging that we begin to resume our seats, and also the rapporteuring can continue with the secretariat. I'm encouraging that our group, I don't know, Peter, is he here? Peter is not yet here, but someone reach out to the other group. I already mobilized them to come, such that we continue working as also we go into the final session, because according to the agenda we're supposed to leave the hotel by 4:15 or 4:15. So Martha is volunteering to call for me the people, yes, in the other room. So 1 minute we'll be gathering and being ready to hear from the commissioner from OPM and also the group chairs who have been supporting the group work. So 1 minute to settle down. Okay, ladies and gentlemen, we'll be back from the group. I'm trying to speak slowly so that the discussions can continue as we reorganize and find our seats. But we sincerely have to appreciate the great discussions that have been going on. I've been moving around all the groups, and I must say we had no limited time. I think we had more hours to debate because there were quite interesting discussions really happening. And one should say that I think we need to organize a means or a way of ensuring that the debate continues even after this dialogue. Time may be limiting for us here, but I think the debate should be unlimitless, or limitless, sorry, or unlimited, such that advocacy continues to happen and also people continue to get informed of what's happening and what needs to be done. Ladies and gentlemen, amidst us we have the Commissioner for Strategic Coordination from OPM, another chief guest for us today. And we thought we would really listen in from him. There's another very key meeting called by the Prime Minister at 4. So it's very late, but we held him a bit because we needed to hear from him, given his critical responsibility of coordination and strategic coordination and implementation. So I will not really try or attempt to talk to his big CV or to introduce him formally, but at this juncture, allow me once again to invite the Ministry of Health, who is the main host of this event, Dr. Prospero, who will officially recognize the Commissioner and invite him to make his remarks. Then we shall continue with the program.
Thank you so much, Peter. Good afternoon. Welcome back. Thank you so much for being Gumite. Are you Gumite? You have not answered. Are you Gumite? Okay, thank you so much for being Gumite, and thank you for those breakaway sessions. I know you've had very fruitful discussions. My job here at this time is very simple, and being the kind of scientist I am, I usually don't want to spend so much time. So I would like at this opportunity to, first of all, welcome our commissioner from OPM, Mr. Frederick Walugembe. He's the Commissioner for Strategic Coordination and Implementation in the Office of the Prime Minister, and that is the department where nutrition sits. And Mr. Walugembe is very passionate about nutrition. That's why, despite his busy schedule, he took off time to come and be with us here. Commissioner, this dialogue was convened by the Ministry of Health with support of partners, Action Against Hunger, World Vision, Food Rights Alliance, UNICEF, and World Vision. Okay, so we are here basically discussing what can we do to improve nutrition financing. And we had very good submissions from different sectors. The Ministry of Health made a call that we should go to the community. That's where the real issues of nutrition are. So we should go and be able to support at community level. And Action Against Hunger also echoed the same, said we should stop sitting in these boardrooms, but we should go to the community and be able to deliver whatever packages and initiatives we have in nutrition. We also had presentations from from UNICEF, and UNICEF re-echoed the fact that nutrition is core to health. And for us to have a healthy nation, a healthy generation, nutrition is very critical. Then we had a keynote speech from the Ministry of Finance, Planning and Economic Development, because we were tasking them and telling them we need money from government to implement nutrition, because almost up to 90% of our activities in nutrition are supported by partners, and we are very grateful to partners for stepping in. And one of the issues that came out of Ministry of Finance was that they have several priorities, and one of them is to clean up government. And in cleaning up government, they're going to come up with systems that will ensure that resources are well utilized. We had our guest speaker from the National Planning Authority, and he asked us several questions, Mr. Commissioner. One of them, he asked, where is the UNAP 4? UNAP 3? And that's a very core question to us, but I know that as you come, probably you'll speak to it. We also had some presentations from panelists. They were talking about civil society perspectives on financing for nutrition, and we were reminded that because we do not do accountability, we are not going to heaven. It was a very serious rebuke. So we are called to ensure that we really do accountability. From academia, they were telling us about data. We should use data because academia feels that the data we're using is an underestimate of the real nutrition issues that are on the ground. And they are continuing to do several research to ensure that we have enough evidence to support. Even when we are going to finance to request for money, we have evidence that speaks to our request. Mr. Commissioner, just as you were coming in, you found us going out for the breakaway sessions, and we had 3 breakaway sessions. I'll just give you a highlight. because they are supposed to make a presentation. We had the first one, which was strengthening coordination in nutrition, and it was chaired by your office, by Judith. Then we had the second one on taxation and policy, which was chaired by Professor Kaya. And we had the third one on innovative financing, which was shared by Mr. Mulongo. Mr. Commissioner, it would have been really nice if you had the time to sit and listen into the outcomes from these breakaway sessions. But we know you do not have the time. But as the organizers, we shall ensure that we share the report with you so that you can be able to internalize the issues that have come out of this nutrition financing dialogue today. Mr. Commissioner, it is now my honor to invite you on behalf of the Ministry of Health and the partners that put up this dialogue together to welcome you to come and give some remarks to the gathering. Thank you so much. You're welcome, Mr. Commissioner.
Good afternoon, ladies and gentlemen. The response is hungry. Good afternoon, ladies and gentlemen. Allow me to stand in existing protocol. I recognize you all in your various capacities, and I want to apologize for rushing away, but that's the nature of work. But I know there is business continuity, whatever the case, and we shall take it from there. So, ladies and gentlemen, I want to first of all thank the organizers for inviting us to be here this afternoon, and of course our team has been here since morning, and we partners have been together. And allow me also to congratulate the Minister of Health for spearheading this, but of course not alone, with the partners. But I sing out Minister of Health for this because when you do coordination, there are action tracks, and those action tracks, in order for them to operate well, we needed the lead agencies to coordinate. So Ministry of Health has shown us that they can also coordinate at this level to make sure that the outcomes are achieved. We are encouraging the systems approach because, as we normally say, that the government business is not addressed by or successfully implemented by one ministry, but by a system. So when we talk about health outcomes, we cannot achieve health outcomes by relying on one ministry, but that one ministry needs to work with other MDAs to lead, because by mandate it is the lead agency, but it can never achieve those outcomes without working with the other MDAs. So I want to congratulate you upon that. In the other arena of food systems, where we have got action tracks, one of the issues we are trying to grapple with is to make sure that at that level they coordinate, they don't wait for PM to coordinate. So I want to thank Minister of Health. Kindly let's clap for them for this endeavor. So I want to congratulate all organizers upon this successful dialogue. And you know, ladies and gentlemen, that nutrition financing situation remains quite challenging despite efforts to improve nutrition. Funding is dwindling and partners are having challenges as well. And of course also all of us are having challenges in that area, leading to a potential crisis. We say in the nutrition arena, in the UNAP, that there is fragmentation, there is inadequate funding, and of course we need to work together to work on the funding issues. The malnutrition rates, as you know, are alarming. Of course, if you talk about the statistics, some of them are very damning, and we've noted this and we need to work on them. But ladies and gentlemen, as Prospero was speaking, she talked about UNAP 3. UNAP, where is UNAP 3? I want us also to reflect on that as an area where it has been developed, aligned to our NDP 4, and this outlines strategic priorities that can be funded through current budget structures. But as you said, there are inadequate funding. There's inadequate funding, inadequate allocations for nutrition across all levels. And of course, across all MDAs, because as we said, this is a system which has to be addressed from all angles. Under the 18 programs, you'll find that in each program there could be an initiative for nutrition which needs to be addressed. But the UNAP 3 brings out all those indicators, all those initiatives in one document. We normally say that the NDP 3, NDP 4, and the PIAPS is 780 pages. So for you to track those indicators, track those initiatives, you need to bring them in one document and look at them and follow them and track them together. So the UNAP 3 has been developed and is aligned to our NDP 4. It is in the final stages. It outlines the strategic priorities that can be funded through current budget structures, and of course also indicates the funding gaps. So this is a very good arrangement today to discuss the nutrition financing and see where we can move forward. Investing in nutrition is in Uganda prosperity. There is a crucial link between nutrition and national development. Every shilling invested in nutrition yields a triple return. We come up with healthier communities, healthier people, smarter workforce, and a thriving economy. More efforts are needed to explore how investing in nutrition isn't just a moral imperative, but an economic necessity. So we are in the right place at the right time, doing the right thing, in the right attitude, and using the right morale and momentum. So thank you very much for discussing these items. I know there are potential funding strategies which we can discuss, and also innovative funding arrangements which can also be discussed. But we need to collaborate together, all of us, using the whole of society approach. And I'm glad, and as I congratulated the Minister of Health that has been able to coordinate and work with all the partners who are here today. A couple of questions we shall ask ourselves when you look at the NDP 4. And one question I want to ask is that to what extent are the nutrition interventions in the NDP 4, which are reflected in the PIAP, funded? To what extent are we've done the thinking, but now we need to do the action. To what extent are all the initiatives funded? And this dialogue addresses those issues. And we need to keep asking these questions along the way as we implement UNAP 3 and as we implement NDP 4. I'm glad a rich menu has been discussed this evening, and you broke out into the various groups. I know you've discussed strengthening coordination and governance for nutrition. You've discussed taxation and policy measures for improved nutrition. And we've also explored innovative financing approaches for financing nutrition. And these are issues that are critical for us to achieve our nutrition outcomes. And these are issues that need to be addressed. So this rich menu which has been discussed, I'm also sure has come up with the key recommendations to be implemented. We need to be intentional on these recommendations. We need to be serious and track and implement our recommendations. These recommendations, ladies and gentlemen, will help us to achieve the nutrition outcomes. So, colleagues, we need to identify innovative funding approaches to unlock resources for nutrition if you are to achieve our nutrition outcomes. we need to leverage on existing systems. One question again which we need to ask ourselves, that suppose the resources don't expand, what happens? Do we give up? Can we leverage the existing systems? I know when we discuss and have governance discussions, we talk about reviewing policies, coming up with new policies and laws. But the question which we need to ask, can we look at the existing setup and achieve, and can we be realistic and achieve what we are supposed to achieve? So the point I'm raising here is that let us optimize and maximize the existing infrastructure as we try to look at innovative ways, as we try to amend, as we try to formulate new policies. That's what one thing we need to discuss. That maybe could be budget neutral, but most importantly, we need to look at the existing arrangements and implement them. There are gaps in implementation. When we look at the implementation of the various initiatives that we have already, we'll find that implementation levels have been suboptimal. The quality and the pace has been low. Can we catalyze that? How can we catalyze the implementation? So, ladies and gentlemen, it is important that as we try to expand the resources, which is critical, we also need to be a little bit pessimistic that suppose the resources don't come our way. But I'm glad we have partners here. We can always make sure that the resources are obtained. But just in case we don't get those resources, what else can we do in ensuring that we achieve our objectives? So, ladies and gentlemen, so the outcomes of this dialogue, in order for us to achieve our objectives, the outcomes of this dialogue need to be trafficked or transported and shared widely. I'm using this because maybe the word advocacy, we've got used to it. Sometimes we don't do enough. But can we traffic the outcomes of this engagement, this dialogue? Can we market them? Can we transport them vigorously so that they are shared widely? And where we need to get additional resources, we do that. Where we may not be able to get additional resources, but where we need to be more innovative in terms of implementation, again, we can achieve what we need to achieve. So, ladies and gentlemen, I want to leave this challenge to all of us. Number one is that for all of us who are here, we are converted. We know that we need to fund nutrition. We know the rationale. We know the costs that we incur when we have nutrition challenges. Those of us who are here, we are convinced and we are the advocates. But those outside this room and who are influential, we need to bring them on our side. We need to bring them on our side. Innovative ways, again, have got to be developed to make sure that we bring them on our side. We paint the picture in such a way that we can get support and resources. We convert those who are on borderlines to come to our side, and of course try to get us more resources. So we note that the financing and of course also the implementation levels are sometimes low, sometimes poor. We need to check ourselves who is not doing what is supposed to do. This is very important, especially in an area where we are several players and we are working on a conveyor belt. We need to deliver our products to the level where they need to be and picked as inputs by the next level to achieve our outcomes. So, ladies and gentlemen, I want to emphasize the fact that the outcomes of this dialogue need to be trafficked, transported, and shared widely, and again implemented with the ferocity and a lot of vigor. We shall be able to address, as OPM, we've worked together to address the issues of fragmentation by trying to ensure that we do better coordination. And I'm glad it has been an agenda item here, which you've discussed. But allow me to say that as OPM, we are looking at finalizing the UNAP 3, and the Right Honorable Prime Minister has invited a meeting on the 23rd to look at the UNAP, also give us some input and also approve. So we are going to present it to her and the team on the 23rd of April. We also want to present the Food System Transformation Action Plan because they are linked and they also cause better coordination of the efforts. So the UNAP 3, which is going to be our driver, is linked to the NDP 4, and the vision is a well-nourished, healthy, and productive population with equitable access to nutritious foods and services for sustainable socio-economic transformation. The goal is to reduce triple burden of malnutrition along the human life cycle by 2030. The strategic objectives are 5 in nature, but we are saying the goal is to reduce the triple burden of malnutrition along the human life cycle. In the past, we've been talking about the under 5, but now we realize that some of us are left out, and also we also suffer malnutrition issues, as you may all know. And these are the issues that cause challenges to the economy. The non-communicable diseases maybe come out of there. So we want to look at the entire cycle. And the objectives are, number 1, increase sustainable consumption of safe and nutritious foods. The second one is build nutrition resilience for households, enhance institutional capacity for nutrition governance, enhance nutrition behavior and mindset change, then strengthen delivery of nutrition services. Those are the key objectives that we are looking at, and these objectives are mapped and linked to the National Development Plan. So these are to be implemented in the next 5 years. But although they are there, they may be having funding gaps here and there, and that's why we salute the effort this afternoon of looking at the funding of nutrition. So I want to thank you very much for this endeavor. We look forward to receiving the outcomes, but of course, most importantly, to follow them up in implementation. And as I requested, let's get the outcomes from here into the community. Let's use the outcomes from this engagement to impact others so that they can impact the funding and the financing for nutrition. I want to say thank you very much. I say this for God and my country.
Thank you so much, Commissioner Edward Frederick Walugembe. Ladies and gentlemen, another big applause to Commissioner Walugembe. For those who may not have known, Commissioner now is the lead advocate for nutrition, but also our chair for sectors. Why I say lead advocate? Because he's the deepest voice for nutrition in government, given that he sits at the office of the Prime Minister. And as you know, the office of the Prime Minister is the coordinator of government business. But for members who may not know, I always tell my students that pronouncement was made by His Excellency, the President of the Republic of Uganda. I recall it was on 3rd October 2010 in Imperial Royal Hotel, where officially His Excellency declared that nutrition would now be coordinated by the Office of the Prime Minister by virtue of UNAP 1. So it's not by coincidence, but really by policy decision. And every day we keep hoping and praying that more resources can be given to the Office of the Prime Minister specifically to advance nutrition coordination, and therefore the Commissioner for Strategic Coordination and Implementation becomes our lead in bringing us together. Our colleagues, we must appreciate his remarks where he emphasized a number of key issues, among them the hope that really NDP4 is nutrition compliant, but also the emphasis that efforts are underway under the Office of the Prime Minister to approve UNAP 3 on the 23rd of April this year, and also develop along it a food systems transformation action plan to be able to have these two enabling instruments to support our interventions. And therefore, he has argued that we must be intentional, but also he brought in the words that the outcomes of this meeting should be trafficked, transported, and shared widely so that really every person appreciates what we are talking about, and we need to paint the picture in its real entirety. And the Commissioner called upon more support in this endeavor. And colleagues, indeed, let's join an effort once again to thank Commissioner Olugembe for this effort. As we take a breather, ladies and gentlemen, we are now on the final lap of this dialogue. We are now going to receive very briefly the feedback. I've been made aware that work is still ongoing in refining the points, but allow me invite the three chairs to the podium where they will share with us the key findings, and then we have a small plenary, and then we close this dialogue. Yes, so at this juncture, moderators. Okay, the moderators, which I had thought the chairpersons, but the rapporteur, Professor Kai, is reminding me that we should give that job to rapporteurs. Okay, well, we thought the chairs would project, but let me take this opportunity. We have said we shall avoid the PowerPoint. They can come with the computers and project the main issues in 3 minutes, such that the updates will be done, and then we shall share a refined version following the inputs of plenary. So at this juncture, ladies and gentlemen, allow me kindly invite the three rapporteurs. But one would say the chairs could make one remark and hand over to the rapporteur, because the chair, where I sit in government, the secretary doesn't make a statement. It's the chair who defends. So I'm getting a challenge, Professor Kaya, whether we leave the rapporteurs to be the ones to share. But I think in the interest of protocol and service, I will invite the chairs because the chair has to own up. What I say, when there's collective responsibility. I know it may be a challenge, but we shall make it brief. So allow me invite Madam Judith Orishaba to come forward, Professor Chileo Kaya, and my brother Ronnie from the Private Sector Foundation. We can read to it. Yes, we can take the front seat. Ronnie, I don't see my brother Ronnie from the private sector, the chair of. So who will step in? A dangerous substitute for Ronnie? CS Bag, very great, as always. CS Bag becomes our dangerous substitute. Ladies and gentlemen, in the interest of time, we thought we would just wrap up from the group of the parallel sessions, where the chairs would give us the key highlights of what emerged from the sessions. And then each one will take 3 minutes or thereabout. If it's less, that's even better. And then we shall have plenary to respond to some of those issues. And members can complement. If there was something controversial that the chair is not bringing out, we can bring it out so that we don't miss out on what really was debated. And then subsequent to that, We shall have them wrap up in a second or two, and then we shall officially close the dialogue. So at this juncture, ladies and gentlemen, we have microphones. We could switch them on. I know. Let's take, yes. I'm thinking I invite you to the podium since you have a laptop, such that you are comfortable in submission. You can leave the mic there. So we shall start with Judith Orishaba, Group 1.
Thank you, Dr. Okundo. Good evening, members. I know we are in the evening of your time. I pray that all of us will be very brief. We are looking at how we can enhance coordination, both at national and local government level. And I appreciate that OPM chaired, because I realized everything comes back to us, almost 80%. And yeah, I'm giving almost what I need to do, but we are sorry that we didn't do so much. One was to identify achievements registered at national and sub-national level over the previous 5 years. That was question number 1 for our group. And we are saying, with our coordination that has been done, multi-sectoral, both technical and political level, we've been able to, for those who don't know, we have a multi-sectoral committee at technical level. I realize my group members, some of them didn't know that that committee exists. But as we coordinate both technical and political level. So we have a multi-sectoral technical coordination committee, which looks at nutrition issues at technical level. It's multi-sectoral. It has 12 government institutions, and also has civil society represented by FRA. We have Chamber representing the academia. We have the business represented, and we have UNICEF representing the development partners. So it's multi-sector and it meets quarterly. But apart from quarterly, when we have any other consultations, we call the people they are representing, we call them in large numbers to come and also give their input. Issues that come from there that need to be updated, we call what we call an institutional coordination committee. This is a meeting by the PSCs of the heads of institutions we are talking about, and those ones come and address administrative issues. If issues require a policy nature, we call what we call a policy coordination committee for nutrition, which is chaired by the Prime Minister, which looks at the policy issues. That is at national level. At district level, every district should have a coordination committee, and the committee should form other structures at sub-national and parish level. For those that have done that, we thank you that you've worked closely with us. Those that have not, it's time for us to continue to adjust. We do that together with Ministry of Local Government at local government level. Having said that, what have we achieved? Ministries appreciate the alignment of nutrition and are able to understand how they relate to nutrition outcomes. We've been able to improve advocacy for nutrition activities. We've been able to improve partnership and coordination across sectors and partners and other stakeholders. We've been able to have cross-sectional accountability, because in these meetings we're able to tell what we are doing and where. We've been able to improve our stakeholder mapping. At least we know key stakeholders at national level, but also at sub-national level for some districts, they're able to tell you who their partners are and where they are implementing. We've achieved some capacity building on nutrition aspects. Some knowledge has been built for most of the government officers and at the district. However, there are questions of challenges, and we're going to bring challenges after. We've been able to improve lobbying and funding. If health says that they have been able to achieve restructuring in public service, that is because of multi-sectoral. If you hear that the BCC has talked about nutrition, that is because of multi-sectoral coordination. If you hear that 2% did give fund at district level for coordination, it is because of multi-sectoral coordination. All those are achievements, and we hope to achieve more. We've been able to enhance policy decision making. That's why you hear that UNAP 3 has been allowed to have UNAP 2 has been able to take on UNAP 3, and other plans like food system have been advocated for. This is because of multi-sectoral. Because at first actually we thought we would have both food systems and nutrition in one plan, until in one meeting they said, no, let's not merge. You can irrigate and have enough food produced, but it's also another aspect to have it consumed in a nutritious way. So while the food system will focus on having major irrigations for people to have food in its transformation, and you advocate for seed banks to be developed, we need to now say, once you've produced the food and everything, then let's go the 5 objectives of the UNAP: advocate, finance, eat well, transport the food well, cold chains and everything. Yeah, so those 2 plans, it was because of this multi-sectoral funding. We've been able to form networks to see that issue mapping of stakeholders and also their roles are well understood at that level. That's why you have the Sun movement networks. And of course, we've been able to see that the global agenda for nutrition is enhanced through these multi-sectoral engagements. And having said that, then what can be done to strengthen multi-sectoral collaboration and ownership? With all those achievements, we realize that there are gaps. And we are saying that we need to ensure that people understand nutrition coordination. When I talk about coordination, some people don't look at it as maybe having a meeting, but in coordination and governance, we have very many aspects. You must monitor, you must advocate for nutrition, you must know your stakeholders, that is stakeholder mapping, you must engage them on their different roles, you must be accountable, you have to build best practices. So all that is coordination, and most people don't understand their role, including even our committee members. We've done functionality of most of them, but realize that there is still a gap. We need to popularize the terms of reference for the district nutrition coordination committee members. They are there, but they need to understand clearly what is their role when it comes to nutrition. We need to streamline, we need to empower the local government level, local leaders through enhancing stakeholder engagement. Nutrition has been talked so much at the center, and in the district it's known by the planner and the DHO. But when it comes to the lower levels of local government, they seem to take it as seeing food in the garden. But we need to do more knowledge and understanding to see that people are able to. And by the way, you see, when communities know what to do, you might not need so much money because they will know what to use for which food to grow, how to eat it, and where it should come from. So somehow, if they are taught what to do, we have less financing gaps in a way, because a child will know that, a mother will know that you have to give 1 egg for my child per day for them to have nutrition, better nutrition. So if chicken is laying 5 eggs, let me give her 1 per day, then I can sell the other 3. So somehow, the knowledge can help us lower all these, some of these financing gaps we have. We need to, OPM and Ministry of Local Government need to ensure that every district has fully functional nutrition coordination committees. We note that out of one, we only have 85 districts that fully have committees that are somehow functional, not even fully functional. So we need to see that every district does that. But also, in addition, we need to streamline the leadership of these committees. We note that in districts where the coordination, the focal person is a planner, there is achievement, because a planner is like a center of the entire district, so they know where to put and what to put where and what not to put there. But once they don't appreciate nutrition, they never advocate for its budget. So we are proposing a clear shift to be clear that the focal person at the district level will be a district planner. Of course, the chair is the cow, but they delegate the focal person. And at the center, we are saying, yes, we have focal persons, but for purposes of also ownership and program nature, we are requesting that we shall have the secretariats, the secretary of, ensure that the secretary for that committee in the ministry is from a planning department, so they can also always analyze the budgets, because they're the ones who analyze the final budget to see that nutrition is catered for and also reported on. We need to ensure that we enhance capacity building, especially of implementers, more so at parish level, because money is going there. People are growing coffee, not food, and then they end up starving but having good houses. We need to enhance stakeholder engagement and mapping. Of course, you must first map for you to know, and then you engage. You realize that sometimes a partner comes on ground, and they tell you, I'm working in Kapiripirit, and they want to own the whole district, that they're working in the district, But ideally, he's working in 2 villages. And 2 villages, they are working in 1 or 3 households. And they will tell that we are working in Nakapiripirit. No other partner should come. That is our area. But once you map them, you can easily coordinate them and align their resources and be able to have an achieved, a well-coordinated achievement and outcome. Having said that, what financing actions are needed to ensure coordinated planning and budgeting, including implementation for improved nutrition outcomes? We need to continue integration in the national and district plans and budgets. Of course, once we receive the UNAP 3 well approved, you will at least be able to pick key interventions that can make a transformation. Challenge we have is that Ministry of Health, nutrition outcomes, by the time you realize them, every player must have really been very accountable for you to see that stunting has gone down, obesity has gone down, underweight, overweight, to see that you've achieved that. Interventions at sector level, intermediate level, must have been well implemented. And this calls for proper alignment, but also you keep focusing at the final achievement. So once the plan is out, it is a guiding tool, but also a resource mobilization tool. And we need to see that it is well aligned to our partner plans. Please don't come to do for us what we've not planned for, because it won't help us to achieve where we are going. Because now it has been mapped based on the government priorities. But if a partner comes and says, okay, fine, I want to support you in this area, but realize that area, you didn't even plan for it, so it won't be reported on, first of all, so it won't be captured among the achievements at the end of the day. So we lose track in achieving what we've done. Enhancing the meal for nutrition, monitoring, evaluation, accountability, and learning framework. That has to be really, really done, because once you do it, you can easily tag and know where you've put money and if it has done what it has to do. You need to enhance collection and use of evidence. Evidence can help you either have a resource or not have a resource. If you speak with evidence, you make your advocacy and your point, we always call it, make it eye-catching, that when the president sees a policy brief on nutrition, you get, they call them what? Some of us went to UPE, goose pimples, that one. But also need to strengthen advocacy at all levels. Let us be advocates. Let us know what we need to tell people. We need to build capacity, first of all, for the advocators. Let's map our stakeholders. Let us know what they are. Let them appreciate nutrition. Then they can speak. I imagine if a priest was able to say, God be with you, please eat well, please plant enough food. I mean, people would actually take up all these areas and believe them. Having said that, that is all I can give you for today. As OPM, of course, we are ready. And by the way, what Commissioner didn't tell you, government, when it comes to coordination, has enhanced the level of coordination. We have a PS right now that is key to only look at government service and accountability. Okay? That's the permanent secretary for coordination and accountability. So it means that right now, it won't be the whole, to say that I'm looking at refugees, I'm looking at disaster. There is one that is focusing on how we are doing things and how we are accountable. To us, that is a plus, because government is intentional to that we do our work well. But even above that, we have a deputy head of public service in charge of service delivery, still at OPM. So this PS reports to the deputy head of public for service delivery. And where we've been having issues where you call a PS, there is this issue you're not taking up, and maybe because now for this case, she walks there and says, please tell me why this is not happening. So we believe that our UNAP 3 will achieve greater than other UNAPs because we've been enhanced in terms of coordination. I want to thank you.
Thank you so much, Olishaba Judith. An applause, ladies and gentlemen. Yeah, those parting shots were very key, that there is now 2 new officers in OPM, meaning there are 2 permanent secretaries in OPM. The general permanent secretary, but also the one for coordination. And as she said, now all permanent secretaries are reporting to the deputy head of public service, who is also still the prime minister. So nowadays the PSs have a whip. They no longer see the fellow PS as a colleague, but rather they are called by a high authority, deputy head of public service. And if you don't come, you lose the job. So that's how it is serious at the moment. Ladies and gentlemen, we are running out of time. Allow me to invite Professor Chile Okaya to also summarize, and then we shall have the third group, and then our final plenary.
Thank you very much, Dr. Peter Rukundo. Good evening, ladies and gentlemen. Our group dealt with taxation and policy measures for improved nutrition. And we first of all reviewed the existing policies, the few existing policies which are concerning nutrition, of course, which include the Uganda Food and Nutrition Policy of 2003, which is, all of you heard, that is now being reviewed. Then UNAP 2, which is also being reviewed. Then others include strategies like the food fortification strategy, the biofortification strategies, etc. And then we found out that all those actually have expired, and therefore they need to be reviewed. And unfortunately, the review process is very slow. So that was a very big observation. And when it came to taxation, we don't have a lot of taxation measures really for nutrition. We realized that most of them are also being proposed. For example, the sugar sweetened beverage, tax, which is advocating for, raising taxes on sweetened sweetened beverages, the sugar sweetened beverages or drinks, the sodas and what, and then of course taxes on some of these dangerous foodstuffs. Some of them are not even foodstuffs, but whatever that we consume, alcohol, and then cigarettes, etc. So most of these were just being now proposed, if I can summarize. Then we observed the challenges, of course, which I have mentioned, that actually are governing these existing policies and taxes. Then we went to specific questions which were given to us by Minister of Health. And the first one was to identify Uganda's how Uganda's tax system can be a barrier or an enabler of healthy diets. And we discussed, we categorized this into 2, the enablers and then the barriers. Of course, the enablers, for instance, when they increase taxes on these alcoholic drinks, and then maybe, and also tobacco, less people are going to to consume those kind of products, and then they maybe healthier, and then in terms of barriers, of course there are some food products which are actually highly taxed up to now. The prices are quite high. If this could actually, highly nutritious foods, if the taxes could be actually reduced, maybe their consumption could also be enhanced. Our rapporteur was actually Isabella, and she has all the details that we discussed. I'm just summarizing. So in terms of fiscal and policy incentives that can be introduced to encourage production, processing, and distribution of nutritious foods in the country, we identified quite a lot. Of course, including introducing subsidies on nutrient-dense crops, and then of course tax exemption for healthy food products, and investing in rural infrastructure, and even preferential public procurement policies. And then we also encouraged the tax exemption from these equipment that are used for value addition, and also encouraging farmers to produce those particular foodstuffs that can actually be highly nutritious. Of course, even including the orange fresh sweet potato varieties, and then high, they call it high iron-rich beans. Yeah. So those are some of the issues that we identified. There was a question on how can government ensure coherence between taxation, agriculture, health, and trade policies to deliver improved nutrition outcomes and stronger human capital development, because of the uncoordinated issues about nutrition and policies governing nutrition, working in silos. So in there, we identified a number of governance and coordination issues that can actually help these coming together, including establishment of cooperatives, and and then of course incentives, increasing incentives for farmers, and then multi-sectoral food systems approach, that actually align very well with policy goals, targets, and investments. There was a question on the fiscal and legal policy gaps, hindering nutrition financing and the service delivery. So in here, we identified a number of issues, which include the lack of dedicated funding, by government, then if fragmented governance structures, weak regulatory enforcement. Actually, that was also came actually as almost everywhere, because the existing policies and the laws are not implemented because of weak enforcement, which has to be actually encouraged. Yeah, and then the corruption and lack of accountability, issues to do with the monitoring and evaluation, are very, very important. Then the last question was about what tax or policy reforms related to nutrition that parliamentarians should actually prioritize, and why. So we had the two parliamentarians who guided us in this answering this question, and for them, they felt that actually if we prioritize issues to do with the regulating, the burden of non-communicable diseases, that can actually be good. Then they also mentioned about the regulating therapeutic foods, like the rootafers, those, and then the herbalists, the local herbalists, they are very powerful, and they are controlling most of these FM radios, providing a lot of information about nutrition. And there was an example that was given with the famous Kasenene, yeah, so they need to be actually regulated, and what they are doing could be actually good, but who is now monitoring and regulating them? Yeah, so I think in a nutshell, that's what we observed, but there are a number of challenges which are related to policies and taxation. Many of them actually are just are still, and then we observed something about the big industries. We are talking about regulating the sugar sweetened beverages, but the industries are very powerful and they are not easy to influence, and then government wants money in form of revenue. So revenue versus health is a very big challenge.
Thank you so much, Professor Chileokaya. Ladies and gentlemen, applause to Professor. Those last points are very critical. The big sugar industry or the big food. It's not easy. If you hear how even World Health Organization finds it a challenge to give recommendations on how much sugar we should consume. It's because there's no consensus yet. And some of these big players are supporting government in the form of taxation. They'll tell you Coca-Cola is one of the biggest taxpayers. So any disruption of Coca-Cola is but I think we need to see how do we engage. And also information control, which is quite a big one. So clearly there are some opportunities But like we had, there are also a number of challenges that we need to address. Ladies and gentlemen, the final presenter of the day is from CS Bag, representing Group 3. And Madam, I'm sure CS Bag has been very key in issues of financing. So kindly, the floor is yours.
Thank you so much. Good evening, everyone. My name is Christina Namubiru, and I work with the Civil Society Budget Advocacy Group, CS-BAG, as a program associate, but also the focal person for nutrition and WASH. So I'm representing my chair for Group 3, and really ours was about innovative financing for nutrition. And the question we kept on asking ourselves, how does government, private sector, the NGOs, the development partners sustainably finance nutrition? And we spent a little bit of time trying to understand who really finances nutrition in this country, who funds nutrition in this country. And whereas many people are saying the private sector does finance nutrition, others were not in agreement with that. And we zeroed down to development partners like UNICEF, FAO, SCF. These really finance nutrition, both the sensitive, enabling environment, and also the funding that goes to NGOs is really a contribution from the DPs. And we also noted that government financing is there. It exists, but it's very limited. We noted the 2% allocation under the DDG that goes for the operationalization of the district nutrition coordination committees. We see that government is putting in effort, but there is really a lot to be done. And when it comes to private sector investment in nutrition, we all agree that this is really inclined to profit making, whereas they could be investing in areas that are really well aligned to nutrition, say manufacturing of commodities or even products that are nutrition sensitive. This in most cases is for profit. And when we talk about alternative financing, we have government and then the development partners. And in an era where we are facing declining donor funding, the next best alternative for us as a country would be then businesses or the private sector. So for us, we dealt so much on how do we entice the businessmen and women to invest in nutrition in Uganda. And our first question that we asked ourselves was, what would make a business invest in nutrition in Uganda? What would be the case for you to entice that lady in Chikubo or the farmer who is doing this for business to really invest or do it for nutrition? And for us, we agreed that favorable government policies, these are available. But do we have policies that really speak to investment in nutrition specifically? It could be that the policy is trying to incentivize the investments in nutrition, or we are having subsidized loans, for example, through the agriculture credit facility, or maybe we have tax waivers for people that are trying or willing to invest in nutrition. That could be one area that the government could look at and say, oh yeah, if we put a tax waiver on maybe fortification, probably large-scale actors could be interested in doing that. And then we agreed that for a business really to invest, we have to do a cost-benefit analysis for them. Why would I do it? What is the cost? And where do I benefit as a person looking at making profits in the country? So data and evidence generation is very important if we are to entice our business people to invest in nutrition. Awareness creation. What does nutrition in business really mean? People would love to know that. What do you mean? This is just food. What do you mean it has to be embedded in my business that I'm trying to do that? And then strengthening the entire value chain. For us, we think having market-driven demand is really important to entice businesses in Uganda, because if they are to produce something that is not backed by demand, then that is a loss on their side that they're not willing to take. Then we looked at the other question was, how can government then boost investment in nutrition in Uganda? And the first that came out is a direct grant towards nutrition. We know we have the DDG, but that is really for anything that a local government can think of that they need to be equalized in. But then if we get a direct grant and maybe a budget tag in this case, because we have the recent ones that have been made at the adaptation and the mitigation of climate change. Those have been done and put in the budget. How about nutrition? Which we have HIV budget tags, and for us we are able to see, oh, this is the money that is going in HIV, this is the money that is going in nutrition, in climate adaptation and or mitigation. But when it comes to nutrition, you have to look around. What is Ministry of Health budgeting for? And it's also not direct, it's not clear. What is OPM budgeting for? So maybe a budget tag could do us good as the first step in trying to assess the financing we have as a country at the moment. What else the government can do is the policies. Those really have been spoken about so much. This is really to entice the private sector. You need to sweet talk them into coming to your area of interest. But also we need to embed nutrition-related interventions in existing government programs. If you're talking about priorities and maybe reprioritization, we need to see that we have different programs, for example, in production, but most of them may be just around boosting production in a given area, maybe rice. But are we keen to understand if it's we are also boosting the quality of the food being produced under that given government program. So we know that we have so many programs in water, in agriculture. Maybe we can use them as a window to embed nutrition-related activities or interventions or indicators that can give us really a leeway on achieving what we want to do. Then the recruitment of nutritionists at all levels that was mentioned by Ministry of Health is being done, but then my question would be, is this being backed by availability of wage? Because that really is the question. If we are given a leeway to recruit, that was done some time back, but do we have the monies? Are they available in the coming budget? And then we also noted something interesting, that there are always retooling exercises of extension workers, and these we know are now the people or group of people that are really working closely with all Ugandans at the last, that is the parish level, even the villages. And every time they have the retooling exercises, issues of nutrition are not really well dealt with, and we thought this really could be a way of first of all developing their capacity and skills, but also making them understand the importance of nutrition, so that they can then pass on the information to Ugandans that are engaged in different areas. Tax waivers have been talked about, but also integration of nutrition in community and school programs like PDM. FRA mentioned what they did with PDM, which is good and commendable, but also strengthening accountability at all levels. For example, with the 2% that we have, the government or Ministry of Finance has no data to see how that has been really utilized. If you ask them, they don't have the data, because it's just a grant that is given to a district to do what they think is best for their district. So we need to strengthen accountability at all levels to ensure that the monies, the little that we have, is really put to the right use. And then we had an interesting question. If you had 10 billion Uganda shillings today, where would you invest for high return in nutrition? And some of our group members mentioned workforce. That could be the extension workers, the nutritionists, but this really is to bridge the gap, the knowledge gap in production, usage and consumption. We also talked about food stocking. We note that whereas Uganda is a net food importer as we speak of now, production is still really high. And the food that we lose annually due to poor post-harvest handling is also high. So we thought of food stocking as really one area we could put money into. Those are the food banks that we've been mentioning, that the country also already budgeted, planned for in the NDP4. But also, we need to build linkages between farmers and the final consumers. We need to know what does the final consumer want to be produced, and then that's really what the farmer will be able to produce. Mindset change is very important. People need to understand that nutrition is not about food. There is more to it, and a lot is at stake. Yeah, I think that was from our group. Thank you so much.
Thank you so much, CS Bag, for those wonderful summaries from the submissions of the group. Ladies and gentlemen, clearly you can see there are many issues. Innovative financing had more questions than answers, but bottom line, she seems to say it's not easy to create demand for nutrition. And the whole argument was on how then do we mobilize. Even the 2% of DDG, telling you it's not there in some districts. It's going for TPC, Technical Planning Committee, and this other committee of ours are seemingly not being considered. So clearly, although alternative financing can be found in PDM and others, for example, they say we should fund school feeding through PDM. But often the how is an issue. It leaves, it's always hanging, and that's a challenge. The tax, direct tax on some products, we have been studying a situation in some countries that have been introducing tax on some commodities like airtime. They say 0.5%, and that tax goes to school feeding, or it goes to maybe maternity health. And even some communities have adopted that. And you say in Karamoja, let every Karamajongo who's working pay 10,000 per month. And the money remains in Karamoja to support Karamoja's development. That's happening in Ethiopia. Some mandatory contribution from the communities. Of course, it's not easy. We have seen circles now coming in, but how are they funding nutrition or etc.? So yeah, you raise some points there. Others have been saying, can't we tax sugar to have water given to some communities? So we put a tax on sugar so that water goes to Karamoja from that tax. But the argument is, if the tax goes to the government, will the government release the money for the other purpose? So that is the challenge. But ladies and gentlemen, let me not debrief completely, but to allow us, we have run out of time, but we have agreed that we give ourselves 5 minutes to hear 1 or 2 points from the audience, which are critical, which you feel really haven't come out, such that at least then we leave this room or this dialogue well aware that we left no one behind, because we're in a world of inclusivity. So I wanted to give the mic to somebody, or 2, 3, 4 people with key issues. There could be questions for the members, and they are okay. Members, let's count the hands so that we do not go. There's UNICEF, 1. We have 2 here, 3, 4, 5, 6. Yeah. And we're going to say 30 seconds, maximum 1 minute, please. So, yes, Peter is going to help me with the mic. Okay, let me move it myself. Then I know who I have picked. Mary.
Thank you so much, Chair. And I hope the whole group is still with us. I know many people are thinking about picking up their children. Judith, I see you. So I was in the innovative financing group, and I think we didn't have much time to really delve deep into all the available funding mechanisms. But one that is critical for UNICEF is a child nutrition fund that the presenter hinted on in his submission. The Child Nutrition Fund is a UNICEF-led funding opportunity that we can tap into. Uganda is already tapping into it on the RUTF fund. So the government is allocating $1 million and UNICEF is matching it. So it is an incentive for the government to put resources so that, you know, we match it so that they get double of it. So we want to see how we can, and it's sustainable, because then the government will keep allocating that amount of money and keep increasing it, you know, as long as the incentive continues. We should try to tap into this, especially around commodities like vitamin A, which are heavily donor dependent. and the MMS that is coming on board, the multiple micronutrient supplements. This funding opportunity also has program. It has different windows. It has programmatic windows where they can fund high impact interventions as long as there's domestic resources injected into UNICEF doubles, you know. So I think this is something that moving forward, we should add on our next steps for tapping into the innovative funding mechanisms. Thank you.
Thank you, Mary. I think what's key now is perhaps if we agree a position from the Ministry of Health, Finance, to strengthen the Child Nutrition Fund. Perhaps people may not be aware about it, but as you have said, and we heard from Dr. Was it Renee in the morning, also who raised the same point. So 1 million USD for RUTF and other commodities for children. I think we need to see more engagement, advocacy, so that government can put in more, like they did for SAGE and etc. Yes, that's one opportunity. I don't want to talk much. We're running out of time. Number 2 was this one here. Yes.
Thank you very much. This is Elizabeth from Action Against Hunger. I was in the group for coordination and governance, and there is something we are not really discussing in depth. Like we are not, you know, finishing the entire discussion around it, and it's something to do with accountability. So the available funds that have already been invested into nutrition, how are we holding people accountable to account for this? Because we keep on looking for funds, but we're not accounting for the funds you already have. So how can we hold these stakeholders accountable, like at the local government levels and the higher levels? So we should really look for measures to really see that the funds we have are put into the rightful use. Then secondly, it's on data and evidence utilization. We've really done a lot of evidence, and we've been talking about evidence since morning, evidence for decision making, evidence for resource mobilization. But then all the speakers we had were referencing on using international data from World Bank, from various sources. But then where is our local evidence? Like, where is the local data we are collecting? So are we using it? Because we can keep on saying we need evidence, but then these things that we've already been doing, how are we disseminating them? How are we using them? Does the government even know about them? Because no one is referencing on them. So that's something we really need to think about, because at the end of the day, decisions are made on data. Decisions are made out of evidence. If we reference something from World Bank, it won't sound as something we did, like locally, like the Ministry of Health did this, and they got this and this. It holds, it's stronger like within a country when we are doing our local financing. Thank you very much.
Thank you, Elizabeth. Accountability. This question is always difficult. You know, when there is off-budget support, then accountability becomes difficult. But government, there is auditing. So perhaps we need to ask ourselves, in the Auditor General's report, are we satisfied that nutrition has been effectively audited? But that's one proposal. Because if most funding is coming from the donors and not on the budget line of government, there's a tendency not to capture it. But I wanted, I'm sure the colleagues will answer, and Prospero, accountability, what are we doing? And also the evidence. How do we get local evidence? Are we having studies? Dr. Kato should have answered it, but unfortunately, it's difficult. Yes, please.
Thank you very much. My name is Stella Kijae Lajiri from Kekwara Choli. I would be doing an injustice if I leave this room without talking about nodding syndrome. This is, yes, since 1997 to date, this disease has no cure. It has affected about children from 5 to 15 years of age. And we appreciate the government that is managing by providing nutritional supplements to manage symptoms. In the morning, we had a National Planning Authority talking about regional development plans that require affirmative action for northern Uganda. Now, my request is, as a Choli sub-region, can we expedite the process of taking good care of these children who are suffering from nodding syndrome? And one of the causes or the impact could be children dying from malnutrition. So can we take this as an affirmative action? Thank you.
Actually, Kwekaro, what was the name?
It's K Kwaro, actually. K means chiefdom.
Kwara, actually, thank you so much. Nodding disease. I was one member of the committee in the Ministry of Health who was arguing about the cause. We didn't come to the cause. There was psoriasis, but it's a very good point to make. How I wish next time we can give you an opportunity to give us evidence on the link with malnutrition, because there's a lot around it, but somehow it doesn't come out very strongly. But actually, representative here arguing we have forgotten the nodding disease and its linkage to nutrition. Yes, my brother.
Thank you so much. I'm Godfrey Kokoi from a CBO in Karamoja in Abilatok. Mine is just to really talk of what my other brother said sometime back in the opening of this, that we need to translate some of these dialogues into the local person down in the village. I am saying that we'll try truly to promote the bottom-up approach of programming. For example, this kind of discussions, I love them so much, but it would be so good if we involved the local person in Abilatok in some village so that we can understand the gist of how nutrition is really important. And then the other one is the issue of localization. I'm talking from the civil society aspect, that if government, I want to appreciate the donors who support us, the CBOs. I would also want government really to handle the issue of localization real. Because if we, the CBOs who are grassroots in the villages, can really take this information back and you go through the guidance of government, this idea of nutrition will really be supported very well, and other programming as well. Kindly support us as civil society, and I'm sure that we shall achieve the goal. Thank you.
Thank you so much. Localization, community engagement. I didn't see in your hand, but now ladies are powerful. I counted you, okay? Localization and the community engagement. How do we cascade? In fact, the word is cascade downwards.
Yeah, thank you so much. I'm Sandra Aloyo. I work for Mission Uganda as a project officer implementing Cascade through CARE. I want to add on the sustainability strategy. Let us really, if we are doing this implementation, we talk about sustainability, because for how long will the organization be funding? I know with time, the organization, they phase out, and you know the nutrition should continue. Then also awareness creation, we should continue giving awareness for mindset change. I know it's a process, but with time, the community will change. I can give example of one of the community that they believe a breastfeeding mother should be taking alcohol. Yeah, that one is their belief, of which we know alcohol is not good for the health. Then also, my sister also talked about disseminating the information to the lower people. We should not leave this information here. We should make sure we disseminate so that the indigenous people, they also know what we always discuss. Yeah, thank you.
Thank you so much, my sister from Karamoja. Ladies and gentlemen, unfortunately, we have run out of time. We only had one more final here. Then we go back to the other side.
Okay, I feel bad because I had spoken earlier and he hadn't spoken. Okay, I'll just use 1 second. Yeah, for me, I just wanted to add on exploring innovative financing approaches for nutrition financing. I think one of the things we should also strengthen is integration of nutrition services within existing health systems and food systems, other than parallel implementation of services. I think that's a mandate that came out in the discussion on the health sector annual review. But I think we should do it in a multi-sectoral about sectoral level, and I think that will help in cost effectiveness.
Integration, and that is very key for program-based planning, as they said. But if you don't attend the PIAP, if they are discussing human capital development and nutritionists don't come, there's no way there will be integration. That's what was being said. That oftentimes they go to discuss the money, key sectors miss out. Then the vocal ones take the money. So integration is not easy. We must be advocates for integration and be there to battle for those resources. Finally, no, this is the final. Finally? Okay, one statement, then this one. Then we close.
Thank you very much, Chair, for the opportunity. My name is Atiang Eunice Patience. I work with For Africa as a health and nutrition lead. Just to pick on from Margaret's point over integration, just very quickly, I want to encourage us as partners. We are doing a lot of research, not only partners, the government, we're doing a lot of research on innovative solutions, and especially those that could even be low cost, low resource. I would encourage us that we use the different platforms that we have for sharing our findings, but also make this available on media such that we're able to pick on and support in scaling it up. There are very many innovations that we've tried, tested, and it's worked. Instead of us waiting for the therapeutic feeds, we could use this at low cost to manage but also prevent malnutrition. So this is just a call for us to pick it up. Thank you.
A call for localization, local investment, information sharing, and really supporting local innovations that improve nutrition, like the root affairs and others. Finally, sir.
Yeah, thank you very much for allowing. Max Chaudhry is my name. I work for Rural Action for Development Organization in Nakapiprit, that's Karamoja. I think my sister was sharing with me what I was a bit to say, but I would add still, PHC, we have it already in the primary health care. So why not the ministry or the government to integrate also nutrition into it, which will be now like at school level also. We already have what we call school green gardens. Those are also avenues how to promote the nutrition part of it. I like what Uganda is saying, that Bubu, buy Uganda, build what? Build Uganda. Why don't we bring that aspect to say that nutrition also should go in that way? Thank you very much.
Thank you so much, my brother from Nakapiripirit, you said? Yes, Nakapiripirit. I've been there at Namalu and all those places. And very well said. Primary health care, yeah, there's some nutrition there, but we could strengthen it. I think, like you have said. And the school garden. Somehow, school feeding hasn't emerged strongly. And that's why I talk of integration. I think we need to see what works in which sector and what should be contributed by which sector, or which investments should be considered by which sector. So I fully agree with you that the potential for school gardens, school feeding and others to improve nutrition is very key. Colleagues, we can realize we have run out of time. I don't know, there are not many questions for the group members, but just a parting shot before we leave the podium. Then I invite for the closing remarks. Just a parting shot.
Time is not on our side. Members, there are two things. One, accountability. As you've heard, government is accountable because it is audited by the auditor's office annually. But I want to ask myself, who audits the partners? You're coming in telling us you're doing so much for us. And even that, I want to put a disclaimer on behalf of the government, and I want to be quoted well. This narrative of partners are doing so much for nutrition is not true. Government has a whole budget that is doing hardware and human resource capacity. You're coming in with almost 10% of governance support advocacy, but still we're even saying we're not advocating well. So are you doing what you're supposed to do or not? Because your role is for advocacy for all these aspects, but we are still decrying that people don't know about nutrition, they don't know, they are not aware. Then how have you supported government? Because ideally we are doing the hard work of doing the of the resources, putting stuff in place, districts, forming this and this, partners. Let's not make noise on what government is not doing. And that's why moving forward, I think we're going to engage NGO Bureau to help us understand and make you accountable on what you are doing for government. Because you're telling us you're doing so much, we are doing so less, but we do not see your reports, we do not see your accountability done. And that, to me, that's a take. Let's all be accountable. As government, we are going to enhance and we want you to continue to come to tell us that we are not doing so much, because for us, you help us to check ourselves. But I want to urge your leaders, UNICEF, you're leading the local government partners group on behalf of nutrition, FRA, you're leading civil society, private sector, academia. Let us also bring out our accountabilities on how much we are doing for nutrition. This will help us to move forward. We are talking, the last thing is aligned implementation. Government, we've brought programs. OPM, we are struggling with programs to work together. Our partners, are you really working together? Why would you find 3 partners? One is supporting, bringing posho. Another one is trying to say, let me bring some milk. Another one is saying, but all of them, at the end of the day, the whole region remains malnourished. Karamoja has had the most affirmative action. It is very sad that we still bring it on table as Karamoja that is still doing badly. With all the years, partners have been there. So the question is, what are you doing there? I was seated with a political leader here, and he said, the problem of Karamoja is not actually Karamoja. The issue is the partners that are coming to support us. They are not supporting our priorities. They are coming with their own issues to address. I'm a privatist, I'm a driller. We talk of dry land in Karamoja, but Karamoja water table, when you're drilling, you only go up to 50 meters and you get plenty of water in cubics. Okay? When rain it is flooding. So where is the problem? So let us not keep saying Karamoja, Karamoja. Nodding syndrome, we have an affirmative ministry, Northern Uganda. I'm surprised that has never been addressed. Well, for 10 years, we've had an affirmative ministry for affirmative in that area. What is the problem? Who is not doing their work? Let us be accountable. Let us be accountable, but let's plan and work together. Especially, I want to call civil society. Our partners, please, share your plans, share your areas, and districts, please, as we move forward, map your stakeholders. And ministries, let's map our stakeholders. At OPM, we've established a whole department to look at partnerships, NGOs. And we are going to be looking into the detail of your work plans and what you intend to put on the table. And of course, as nutrition coordinators, we are going to look into it. That is our pledge. Thank you.
Thank you very much. For me, I think one area that has not been discussed thoroughly here is the issue of food safety. And we all know that if it is not safe, it is not food. So in our group, we identified one area of excessive use of pesticides. That in the struggle to produce, high nutritious food, which includes, of course, fruits and vegetables, farmers use a lot of pesticides, which actually end up now, poisoning the consumers in form of residues. So we proposed that it is important that there is actually a policy regulating. Of course, we know very well that there is the Agricultural Chemical Act, and then I think the Health Act, Public Health Act. I don't know whether it caters for that, but I think it is important that these actually are enhanced. And then also the extension, the agriculture extension staff policy, including training and the recruitment of and then facilitation of the extension officers to guide the farmers when they are actually applying chemicals or pesticides. I think that is something that came out in our group. But otherwise, if we don't address the issues of food safety, we are just wasting time. Thank you.
Thank you so much. For me, I think we cannot overemphasize the issues of accountability. And for us from civil society, Judith, I think I need to tell you that in NDP for now we are mandated, we are required to align all our actions with the program action plans, but also at the district level. So something that is being done to show what really civil society or non-government actors are really doing to support the development of the country. But accountability, I would love to look at it from another angle. For example, if we are doing research and anything to do with data to support financing for nutrition per se, I think you need to also be accountable. Why? It should be demand driven. Don't do research that is not going to be taken up. That is an area that is being discussed. I think I got an opportunity to participate in the annual review of the agro-industrialization program. And Naro mentioned that they had research that was being done with very many varieties produced, but not farmers are not taking it up because maybe it's not demand driven. So it also comes back to us, is the research that we are doing to inform our policy actions or even budget allocations, demand driven, and also speaking to the priorities in the country, but also being able to account and being transparent with the few finances or funds that we have currently in the nutrition sector is very important. That is the only way we'll be able to show that the more money we need will really be put to use. Thank you.
Thank you so much, ladies and gentlemen. It's everybody's responsibility to ensure that we effectively support nutrition in all ways. And from what we have heard, investing in nutrition is one of the areas that has the highest possible returns on investment. And the consequences of not investing in nutrition are even much worse, because then many lives will be lost and generations will have no potential. Ladies and gentlemen, join me to applaud these distinguished colleagues who have been our panelists or session chairs for that matter. Allow us to appreciate you and thank you very, very much for your wisdom, for the guidance you gave to the groups, and above all, for the key recommendations that you have proposed. In terms of going forward, the rapporteurs for each group, it's too late, my brother, you forgot. The rapporteurs for each group shall ensure that the points that were captured in the plenary also are captured as part of your submission, and then you will share with the Secretariat. At this juncture, ladies and gentlemen, cameraman, unfortunately, we have run out of time. Sorry, next time. At this juncture, ladies and gentlemen, allow me invite the Ministry of Health to officially give us the closing remarks for this dialogue. Madam Prospero, you're welcome.
Colleagues, thank you so much. Can you give a very big applause to our moderator today? Please. Thank you so much. Thank you so much, Dr. Peter Rukundo. You've done a really excellent job. I don't want to stand between you and the traffic. So first of all, I want to appreciate all of you. Thank you so much for staying in the room. I realized that this dialogue really generated a lot of interest. I could see the passion with which we were discussing. So I want to thank you so much. Thank you for coming. I cannot overlook the fact that the partners were really at the core of this dialogue. So I want to take this opportunity also. Colleagues, let us let us give a very big applause to our partners. Okay, if that is how you feel, you should clap for the partners. That's why Agnes said we shall not go to heaven. Yes, those are one of the issues we don't appreciate well. Anyway, thank you so much, partners. Without you, there's nothing the Ministry of Health would have done. But this was your contribution. You have lifted up this dialogue high. It's running already all over. It's on the NTV. I know Kawongezi, you'll be there. Some of our people were speaking. So anyone who watches the news this evening will be able to see some snippets of what took place here. As the country director of ACH mentioned this morning, why don't we go to the community next time? Partners, I'm advocating. Can we go to the community next time with this dialogue? Let's go and hear from the community. What are they saying? What you see, for us, we plan for them from up here and we go and push it down their throats. Why don't we go and now start a bottom up? Let's go and listen. Ondoga, is Simon here? He has left. Yes. We can go to Karamoja. Let's go and hear the voices of Karamoja. We can go to West Nile. Let's go and hear the refugee hosting districts and the settlements. Let's go and hear. So I'm hoping that next year we are not going to be in this kind of setting. Okay? Let us plan well. Let us go to the community. Let's go and listen to those voices there. Even if it's just the district officials. I know the cost is high. But you can just get a few, the core people in the district. Let's listen to them so that we can be able to plan effectively. So thank you so much for all the support. And let's remember accountability. I'm not going to emphasize it. Me, I want to go to heaven. So for me, I'm going to endeavor to do lots of accountability. Yes, there was a question that I want to answer here very quickly. Is nutrition audited? For us at the ministry, we are audited. We have what we call annual sector reviews, which OPM also sits in. And they ask us questions. Nutrition, you have all these indicators, but when you look at the results, we don't see what you have done. Of course, we know the government envelope is small, but partners have really tried to, help us to improve. And what we are advocating for OPM is that let us, as you coordinate, can we also do joint review of nutrition? Can we do joint monitoring and evaluation of nutrition? There we can be able to have collective responsibility for the results that we get on the ground. Other issues are really about integration. We at the Ministry of Health, we are beginning to do integration, and we've already started with the NCDs because that's one of the very big challenges in the country. So we're working together with the Department of Non-Communicable Diseases to ensure that people's lives are improved. Food safety, Professor Kaya, I know you're a food safety guru, and that's my docket. We shall be working a lot in this area. We already have a technical working group for food safety, but we are trying to streamline the terms of reference because we don't want to do what agriculture is doing. When you talk of pesticides, that is more in the docket of agriculture. But when you talk of street foods, cholera, dysentery, you are talking of Ministry of Health. But we need to streamline that before we can go. But we have already started with the support from Cascade. We've already started training those processors so that they produce safe, nutritious food for the target groups that they are going to provide this food to. Otherwise, a very big thank you. I want to thank all the panelists and all the session chairs, and I want to thank each one of us for every input that we've put into this dialogue. So I hope that we shall meet again next year. Those who are traveling up country, Safari Njema. Those of us who are within the vicinity of Central also have a safe journey home. Thank you so much, and may God bless you all. And I say all this for God and my country. Thank you.